Yon, good afternoon everyone. Hello. Here, how about this one? Karina, rinig na po ba ako? Good afternoon po. Yon, yan. Yan. Kamusta naman kayo guys? Recalls 11. Okay, Recalls 11. Napakainit. Yun lang yung una kong gustong sabihin. Diyos ko, pagkainit-init ng panahon. Ay, hindi na lang nasabi. Anyway, let's go. So let me share my screen now. Ayan. Hello. Kamusta naman kayo, guys? In fairness, congratulations for even reaching Recalls 11. Ang layo na narating nyo. Hanggang Recalls 13 to, apparently. Tapos you still have your pre-boards 2 and pre-boards 3. Yes, thank you. Thank you, everyone. Kayo rin po ba yung gumawa ng PB2? Hindi na po kami yung gumawa ng PB2. So, pwede nyo na po kaming pagpahingahin. Okay, sa mga riot nyo, guys. Okay, but anyways, I hope naka-move on na po kayo from PB1. Let's go. Recalls 11. Again, ganun pa rin. Still have any questions or clarifications, please feel free para right then and there maka-clarify natin. Oo nga eh. Ngayon na lang ulit. Actually, ngayon na lang ulit. Ang first break po natin would be at 3:30 p.m. or as long as matapos natin yung NP3. So, ang assigned po sa akin is the second half. That's NP3 51 to 100. And then, yung next break natin, sabihin natin around 6 p.m. pa yan. Okay? Guys, I'll be with you from 2 p.m. to 8 p.m. So, okay lang po bang pa-type na ready na para alam ko pong nandiyan na po tayo. Ayan, kasi ilan lang yung naka-open cam? Si Ma'am Elena naka-open cam. Hello po, good afternoon. Ayan. Okay. I read the material. Apparently, it's very, very easy. Okay, kumpara sa ibang mga materials na tinake natin, parang quiz nga lang to sa inyo. Actually, parang quiz lang to sa inyo. So, daanan na lang natin, hindi kailangan ng masyadong maraming paliwanagan dito para rin ma-preserve yung brain cells natin in preparation for PB2. Okay? Sige. Number 51. Dami namang sinabi, nakakaloka. Hindi na lang magsimula, di ba? Number 51. Packed red blood cells have been prescribed for a female client with anemia who has a hemoglobin level 7.6 grams per deciliter and hematocrit level of 30%. So again, kapag binigyan po kayo ng lab values, please make sure na isang reference na lang sana para hindi na kayo malito-lito. Okay? Tapos dito pa lang, mag-highlight na tayo. Okay? Gusto ko lang sabihin na ang hemoglobin ni patient, na female patient, is relatively low. Kasi ang normal value sana natin for this one would be 12 to 15. Okay, so this one is low. Sa kanya, 7.6 lang. Okay, ang hematocrit level naman niya is 30%. Apparently, low pa rin. Right? Kasi usually, kapag female patient, ang normal values natin would be at 36 to 48% around those values. Sa kanya, napakababa. So, tama naman, okay, na kailangan tayong mag-blood transfuse sa kanya ng RBC. Next one. Okay, ang temperature niya daw before hanging the blood would be 38.1. So, feverish ngayon si patient. Ang tinatanong sa atin is ano yung kailangan mong gawin next? Okay, ay nasulat ko na pala dito yung lab values. Ayan, okay yan. Okay, so that would be letter dog, delay hanging the blood and notify the doctor. Okay, kasi mali mo, nagsiseptic pala si patient o kaya naman napaka-immunocompromised o kaya naman sobrang infected so baka magpa-further assess si doctor. Okay, minsan naman kapag nagre-refer tayo ng mga feverish patients just before the BT, nagpapabigay lang sila ng paracetamol tapos tinutuloy lang din yung BT. Okay, so depende sa doctor, which is why you have to refer pa rin. Okay, so 51 letter dog. Okay, 51 letter dog. Again, number 51, that's letter dog. 51, that's dog. Number 52. The nurse has received a prescription to transfuse a client with a unit of packed red blood cells. And before explaining the procedure to the client, the nurse should ask which initial question. Again, okay, kailangan malinaw sa'yo at sana tama yung mga hina-highlight natin sa buhay para malilid ka sa tamang landas. Okay, minsan kasi nag-highlight tapos mali yung hina-highlight. So mali rin yung sagot. Okay, here, the question is asking you about the initial thing that you would do. That's letter apple. Okay. Have you ever had a transfusion before? Okay. Napakasimple lang ng tanong, it's a matter of a yes or no question, pero kasi doon, marami ka na ring may implied na cues from there. Okay, if ever na yes, okay, so tanungin mo siya ngayon ng further questions. Nagkaroon ka ba ng allergic reactions or whatnot, mga ganyan. Okay, so 52, that's apple. Para doon mo na lang din ipapattern yung experience niya ngayon. Okay, so 52, that's apple. 52, that's letter apple. One more. Number 52, that's apple. One more. 52, apple. 53, client receiving a transfusion of packed red blood cells begins to vomit. Ayun na nga po. Right? Kapag nag-BBT tayo, the patient is not supposed to vomit. So kapag sumuka yan, bakit? Right? The client's VP is 90/50 from the baseline of 125/78 and the client's temperature is 38.2. So if you would notice, hypotensive tapos feverish. So baka nagsiseptic si patient. Okay, so that's letter apple, septicemia. Okay, 53, that's apple, septicemia. And when you say septicemia as a reaction towards your blood transfusion, contaminated po yung blood na hinook natin. Okay, so 53, that's apple. 53, letter apple. One more, number 53, that's letter apple. 54, uy, please tell me if we're going too fast or slow. Okay, 54, the nurse determines, one more. Okay, so the client is hypotensive, the client is feverish. Okay, may sakit, may lagnat. Okay, so ano daw yung na-experience niyang adverse reaction or complication from the blood transfusion? Septicemia or septic reaction. Okay, yung blood na hinook natin sa kanya, probably baka contaminated. Kaya ganyan yung reaction niya. Okay, 53, that's apple. 53, letter apple. 54, nurse determines that a client is having a transfusion reaction. After the nurse stops the transfusion, which action should be taken next? Okay, tama naman yung first na ginawa niya. What's the next thing? Okay, that's letter C, keep vein open rate. Okay, 54 is keep vein open rate. Sinulat ko na rin dito. Usually, ilang drops ba? Okay, kapag kini-KVO natin, that's 10 drops per minute lang. Okay, so 54, letter C. Bakit? Anong ratio? Ba't kailangan naka-KVO? So that, if ever ni-refer mo kay doktor, tapos magpapabigay siya ng drugs, okay, na kailangan IV ang daan, at least may access ka. Right? 54, that's cat. 54, that's letter cat. Again, number 54, that's letter cat. 55. A client has received a transfusion of platelets. The nurse evaluates that the client is benefiting most from this therapy if the client exhibits which finding. Okay. Sige. Ano itatransfuse sa kanya? Platelets. Bakit siya tatransfusan ng platelets? Kasi mababa yung platelets niya. So prone siya to bleeding. Okay, so para masabi mo na na-achieve natin yung goal ng blood transfusion ng platelets, okay, is kapag meron siyang decreased bleeding episodes ngayon. Asan siya dyan? Letter dog. Okay, 55, that's letter dog. 55, that's letter dog. Pwede po 10 to 15. Which one? 10 to 15. Okay. Drops per minute? Yes, pwede naman. Basta minimum of, or 10 drops per minute. Okay? Yes, correct. 55, that's dog. 55, that's letter dog. 56, the nurse has obtained a unit of blood from the blood bank and has checked the blood bag properly with another nurse. Just before the beginning of the transfusion, the nurse should assess which priority item, of course, guys, for the baseline, that's letter apple, vital signs. Okay, 56, letter apple, that's vital signs. Parang na-share ko na to sa inyo before, pero karaniwan kapag nakakita po kayo ng vital signs sa multiple choices, madalas tama siya. Okay, but I said madalas and karaniwan, hindi ko po sinabing absolute tama siya lagi. Okay, so you still have to analyze the context of the situation. Okay, so 56, that's apple. 56, that's apple. Number 55, dog. 55, that's dog. 56 is letter apple. 57, the nurse has just received a prescription to transfuse a unit of packed red blood cells for an assigned client. What action should the nurse take next? So yun na nga, nabasa mo na yung order ni Doc na okay, BT tayo ngayon. Okay, what's the next thing that you would do? Okay, get the consent of the patient. Make sure na na-sign na yung consent form. Okay, kasi baliwala po yung the rest of the choices dito kapag hindi naman siya pumayag. Right? So 57, that's dog. Okay, 57, that's letter dog. Again, 57, that's letter dog. Number 58, following infusion of a unit of packed red blood cells, the client has developed new onset of tachycardia, bounding pulses, crackles, and wheezes. Okay, so kapag binigyan po kayo ng set of symptoms, please paki-highlightan na. Okay, tapos mag-imagine na kayo, ano yung general picture na na-form nyo once you have this set of symptoms? Okay, so which action should the nurse implement first? Correct. Circulatory overload, fluid overload. Okay, kapag ganito yung tanungan, implement first, kapag binasa mo yung choices, you would like to know or you would like to realize na lahat yan tama. Okay, lahat yan gagawin mo. Pero ang tanong kasi, ano yung pinakauna mong gagawin? So it's a matter of prioritization ulit. Okay, that's letter boy. Place the client in a high Fowler's position because alam mo na meron siyang respite symptoms para lang ma-facilitate natin yung ease of breathing niya. Okay, positioning. 58, letter boy. Okay, number 58, that's letter boy. Again, 58 is letter boy. One more, number 58, that's letter boy. 59. The nurse, listening to the morning report, learns that an assigned client received a unit of granulocytes the previous evening. Ito naman, feeling ko, tinitest kayo, okay, if you know the synonymous terms, the related terms or concepts. Okay? Kasi kapag sinabi mong granulocytes, WBC po yan. That's letter dog, white blood cell count. Okay, so 59, that's dog. So kapag meron kang patient na may neutropenia, pwede siyang salinan ng granulocytes. Okay, so 59, that's dog. 59, that's letter dog. 59, that's letter dog. Number 60, a client is brought to the ED having experienced blood loss related to an arterial laceration. So dito pa lang, may idea ka na. Arterial laceration. Which blood component should the nurse expect the primary healthcare provider to prescribe? Okay? Kapag artery, lalo na yung na-cut, okay, yung na-compromise, very, very prone to a lot of blood loss si patient. So mag-prepare ka na ng FFP. Okay, so 60, that's letter C. Fresh frozen plasma. Okay, anong purpose nito? Okay, as a volume expander. Yun. Okay, so 60, that's letter C. Mabilis lang ibigay yung FFP, napakanipis lang na blood niyan. Okay, thank you. Thank you sa mga random compliments. Napakainit po kasi, so I encourage you, okay, magpagupit na rin kayo guys. It's so hot, Diyos ko. Wow, ang arte. So hot. 60, that's cat. Okay, 60, that's letter cat. Again, number 60, that's letter cat. Number 61. A client has a 1,000 ml bag. Yun na nga, oo, nakalimutan ko, sorry. May superstition pala. So after na lang pala. So tiis-tiis na lang pala kayo. Tiis-tiis na lang muna. Okay, so client had a 1,000 ml bag of 5% dextrose in 0.9 sodium chloride hung at 15 o'clock. So that's 3 p.m. Okay, the nurse making rounds at 3:45 finds that the client is complaining of a pounding headache and is dyspneic, experiencing chills and apprehensive with an increased pulse rate. Okay, so sige nga, i-highlight nga natin itong mga sinasabi niya. Okay, the IV bag has 400 ml remaining. Yun naman kasi, after 45 minutes, 600 ml na yung na-infuse mo. At fast drip, hypotensive ba si patient? Hindi naman, right? So 61, that's letter apple. Okay, slow the IV infusion first. Okay, so if you answer letter apple, you directly address the problem. Okay, so 61, that's apple. 60, that's cat. 60, that's letter cat. Uy, ba't may iPhone akong student dito? May iPhone din sa kabila. Ba't pares kayo pangalan? Charot. Okay, so 60, that's letter cat. Number 61, that's letter apple. 61, that's apple. 62, the nurse has a prescription to hang a 1000 ml IV bag of 5% dextrose in water with 20 mg of potassium chloride. The nurse also needs to hang an IV infusion of piptazo. Okay, the client has one IV site. Okay, the nurse should plan to take which action first. Okay. Kapag ba in-slow mo yung IV fluid, kailangan mo pa bang i-report yun sa HCP? Not really yung act of you slowing the IV fluid, yung kailangan mo i-report. Ang kailangan mo i-report is what happened to the patient that made you slow the IV infusion rate. Okay? Ganun. Ganun lang. So, as complete pa rin as possible kapag nagre-refer tayo kay doc. Okay, so here, well, taas here, or here, okay, mag-infuse tayo ng piptazo na pagkatagal-tagal ma-dilute. Okay? Katagal-tagal mo dilute. Alam mo, sa sobrang tagal ng dilution ng piptazo, pwede ka na makabuo na isang dance choreography, guys. Okay, pwede ka na makaproduce na isang dance prod sa ward ninyo. Okay, hindi pa rin tapos yung dilution mo ng piptazo. Okay, pero since 1 year na po kami nagdi-dilute ng piptazo, guys, may technique kasi yan. Okay, lagyan mo muna ng hangin yung buong vial. Okay, tapos iwan mo for a shorter period of time. Pagbalik mo, diluted na yan. Kasi kailangan mo nang matanggal nung particles, okay, nung powder doon sa bote. Kailangan niya munang humiwalay. Pwede rin yung baril-baril effect. Okay, pwede rin mag-TikTok bago or habang nag-dilute ng piptazo. Okay, so to answer this question, kailangan muna nating i-check yung compatibility ng drug. Okay, not only with the medication but with the actual fluid itself. Okay, pati doon sa incorporated medication. Okay, kung isa-search nyo to, guys, compatible naman yung D5 water sa piptazo. At the same time, compatible din naman yung potassium chloride sa piptazo. Okay, pero kasi ako kapag nag-infuse ng potassium, siniseparate line ko siya sa antibiotic para lang make sure na walang masyadong reaction na mangyayari. Okay, so 62, that's letter boy. Check compatibility of the medication and IV fluids. Okay, 62, that's boy. Paano mo malalaman na letter boy yung sagot? Kasi bini-build up niya. Wait lang, hindi ako ready. Bakit nandito si Doc? Wait lang. Uy, Doc. Nagpaalam ka po ba? Na maging special appearance ka here. Nahiya naman ako bigla. Nakakaloka. Hanap niyo daw ako. Okay, so basta may permit ka, sir, to enter, okay lang naman. Okay, sige. So 62. Sorry. Sorry. Ang dami kasi yung pwedeng dumalaw. Si Doc Carl Balita pa. Sorry, guys. Hirap maka-move on. Alright, sige. So balik tayo dito. Ang question po kasi sa atin is, which action first? Okay? Tapos, bini-build up kasi yung question na marami daw siya ditong, may line siya na D5 water na merong KCl, tapos meron din siya ditong 1 IV site. Okay? Gusto mo munang i-check yung compatibility ng medication kung po pwedeng i-side drip na lang ba doon. Okay? Kasi pwede naman, kung pwede, kung compatible. Okay? Kung hindi, that's the time that you would start your second IV site. Okay? Kung hindi siya compatible, that's the time that you would start your second IV site. Alright? So 62, that's boy. 62, that's letter boy. Okay, 62, that's boy. 63, the nurse is making initial rounds. Uy, mataalis ka na agad. Aga pa. On the nursing unit to assess the condition of assigned clients. Ayaw mo ba mag-sit-in muna dito? Okay, which assessment findings are consistent with infiltration? All right, so here, I'm very sure that you already know the concept of infiltration. So, kung the concept po ito, okay, nag-out of vein ka lang, lumabas na sa tissue. Okay, yung yung cannula mo. Okay, ano yung pwedeng ma-feel or ma-assess mo kay patient? It's letter boy, pallor and coolness, okay, numbness and pain, and edema and blanched skin. Okay, 63, that's boy, cat, and dog. Okay. The rest of the choices, that's phlebitis already, yung apple tsaka yung E. Okay, so 63, that's boy, cat, and dog. 63, that's boy, cat, and dog. 63, boy, cat, and letter dog. 64, the nurse is inserting an IV line into the client's vein. After the initial stick, the nurse would continue advancing the catheter in which situation? Okay. Kailan mo daw itutuloy-tuloy? Okay. Uy, ano ba? Ang dami nating special guest. Nahihiya ako na nandito sila. Parang hindi ko deserve. That's letter dog. Blood return shows the backlash chamber of the catheter. Okay, kapag may backflow, tsaka mo siya ituloy-tuloy. Huwag mo naman pilitin, kawawa yung pasyente. Okay, 64, that's dog. 64, that's letter dog. Okay, 64, that's letter dog. Nakakaloka naman tong section na to. Paano po if yung question is stop advancing? Ay kapag nag-bulge. Okay, so kapag nag-bulge, pumutok na yung ugat, stop advancing mo, tanggalin mo na. Okay? Yan. So 64, that's letter dog. 64, that's letter dog. Diyos ko, ma'am. Nakakaloka. 65, the nurse is assessing a client's peripheral IV site after completion of a vancomycin infusion and notes that the area is reddened, warm, and painful, slightly edematous proximal to the insertion point of the IV catheter. At this time, which action by the nurse is the best? Uy, sorry. Ang hirap maging composed. Ang dami nating special guest. Nakakaloka. May pa-brain hub din. May pa-brain hub. Conference ba to? Hindi ako informed. NP4IB ito. No, that's dog po. Okay. NP4, ay NP4 ba to? Yes. Ay, hindi. Nalilito na ako. NP3 pa lang po, NP3. Ay, naku. Naloka na ako, guys. Wait lang, iko-compose ko muna ulit yung sarili ko. Sorry, ah. Okay, so 64 is stop advancing sa form. Tama ba? Can I see? Naloka na rin yung question, would continue stop advancing. Ano ba talaga? Continue or stop? Litong-lito na po yung mga tao sa buhay. Okay, pili lang tayo isa. Continued po ito. Okay, so continue. Okay, so pakitanggal na lang po ng word na stop sa 64. Okay, para continue na lang yung ma-retain. Tapos same answer tayo, letter dog. Okay, kasi if you answer letter boy, dapat po is distended na yung vein even before you insert the cannula. Okay, dapat kapag naglagay ka ng tourniquet dito, ideally, distended na dapat siya. Okay, so 64, that's supposed to be letter dog. 64, that's dog. And yes, kadugtong lang po ito ng Recalls 11 kanina with Sir Raymond. NP3 po tayo. Okay. So 64, dog yan. 65. May mga nagtatawag din dito ng special appearance. Nako, 65. All right. So vancomycin infusion, you have to remember very well na kapag po vancomycin yung i-infuse natin, dapat as slowly as possible. Uy! Ay naku, Diyos ko. Nag-demo po si Sir Raymond. Anong ide-demo ko dito? Sorry. Okay, so 65, dapat po kapag vancomycin, ang hirap magseryoso, guys. Okay, as low as possible po ito. Okay, hindi siya po pwedeng rapid infusion kasi magre-react talaga si patient. So you have to remove the IV site and restart at another site. Okay? Kasi ito na yung cluster of symptoms. Nagre-react na si patient. So tanggalin mo na. Okay, so 65, that's boy. Ganito pala dito. 65, that's boy. 66, the nurse provides a list of instructions, okay, to a client being discharged to whom with a peripherally inserted central catheter. The nurse determines that the client needs further instruction if the client made which statement. Okay. So i-highlight po natin ito, that's the pick line. At the same time, i-highlight din ang needs further instructions. It's not all the time na mabait yung BUN at ibobold nila yung mga phrases na gusto nilang i-highlight. So please, paki-practice pa rin po ng mga highlight natin sa buhay kasi nakakasagip po ito ng buhay. Okay, so lagay mo dyan negative sign. That should be letter boy. I need to restrict my activity while this catheter is in place. Not really, and not necessarily. Okay, so 66, that's boy. You just have to protect it very well, especially kapag naliligo para hindi siya mabasa. Kasi prone to infection naman na kapag nababasa. Okay, 66, that's boy. Sorry, edi tama din yung dalawang answers. Which one? What number? Wait lang ha. 64. I see. All right. Okay. Sorry. Oo nga, no? So, kapag ang question is would continue advancing the catheter in which situation, tama yung apple. Lagay nga tayo ng signs here. So this one, tama yung dog. The catheter advances easily. Yes, tama rin. So walang obstruction. Okay, the vein is distended under the needle. Okay, so negative sign. So dapat distended na siya even before. Okay, the client does not complain of discomfort. Yes, you have to continue advancing. So mali. Okay, so dapat pala ang i-maintain natin is yung word na stop. Tama? Tama ba ako? Okay. So sige, so tanggalin natin ito. Dapat stop yan. Okay, would stop advancing para yung sagot natin would be letter boy. Correct? Ay, sorry. There you go. Tama na. Alright. So 64, letter dog tayo. Okay, letter dog. Ay, boy rather, boy. Gulo ka usap. 64, that's boy. Okay, 64, that's letter boy. Okay, kasi the rest of the choices would continue advancing. Okay? Mag-address lang ako ng questions. Number 60. Bakit po hindi pwede yung packed RBCs? Alright, kasi ang concern naman natin dito is about the blood loss. Diba kapag packed RBCs, anong concern natin dito? Low RBC or anemic si patient. So kapag blood loss tapos arterial laceration, high risk na maging hypotensive si patient. Diba? So agapan na natin, volume expander tayo, 60, that's letter C. Okay. Right, so 60, that's letter C. So, yun yung focus ng question natin. As a volume expander. Any more questions? Pag-pick. What's the question? Meron pa rin. Okay? Meron pa rin risk yan. Okay? May risk pa rin yan. Okay? So itong letter boy, siya yung sinagot natin kasi sabi niya that you have to restrict your activity. Okay? Kung magre-restrict man tayo dito, minor activity restrictions lang, hindi yung sobrang strict na restrictions. Okay? Okay, so 66, that's still letter boy. 66 is boy. Sino si Professor Chavez? Hindi ko pa siya nami-meet. 67, a client has just undergone insertion. Okay, it is my pleasure that you're here, okay, sa class natin. At the central venous catheter at the bedside under ultrasound, the nurse should be sure to check which results. Okay, especially, napakabilis no IV infusion rate natin, 100 cc per hour. So you have to make sure the proper placement muna. Okay, 67, that's dog. Chest radiology results. Okay, 67, that's letter dog. Chest radiology results. 67, that's dog. Number 68, IV fluid have been infusing at 100 cc per hour via a central line catheter at the right internal jugular vein for approximately 24 hours. All right, so upon entering the client's room, the nurse notes that the client is breathing rapidly and coughing. Yun na yun. Alam mo na yun, di ba? Tapos 100 cc per hour pa. So fluid overload siya. Letter boy, crackles in the lungs. Okay, 68, that's boy. 68, letter boy. 68, that's boy. One more, 68, letter boy. 69, vasopressin is prescribed for a client with a diagnosis of bleeding esophageal varices. The nurse should prepare to administer this medication by which route? Okay, so meron na kasi siyang issue enterally, sa enteral route. Okay, so hindi mo na siya po pwedeng padaanan sa orally o kaya sa enteral route. So dapat po sa ugat na natin yan papadaanan, that's letter C. IV infusion, 69, that's cat. 69, that's letter cat. Okay, number 69, that's cat. One more, 69 is letter cat. Hindi yung letter dog, wag dyan. Okay, number 70, vasopressin therapy is prescribed for a client with a diagnosis of bleeding esophageal varices. The nurse is preparing to administer the medication to the client and which essential item is needed during the administration of this vasopressin. As we know, itong vasopressin na to could be an inotrope, right? Pwede siya maging inotrope. And ano yung possible adverse reaction na pwedeng ma-feel ni patient? Pwede magkaroon ng number 1, dysrhythmias. Okay, even pwede mag-lead to MI or angina. Ano pa ba? Heart failure, hypertension, mga ganyan. So with that, kailangan po natin ng letter C, cardiac monitor. Okay, number 70, that's cat. Cardiac monitor. 70 is letter cat. 70, that's letter cat. Again, number 70, that's cat. Number 71, client is being weaned from parenteral nutrition and is expected to begin taking solid food today. The ongoing solution rate has been 100 cc per hour, and the nurse anticipates that which prescription regarding the PN solution will accompany the diet prescription. Ang hahaba ng mga tanong, nakakaloka. But the point is, gusto nating i-wean si patient sa TPN. From 100 cc per hour, ayaw nating biglain. Okay, natanggalin yung TPN sa buhay niya, guys. Okay, kasi baka naman mag-at risk siya to hypoglycemia. So, unti-untiin natin yung pagbaba ng rate. Okay, that's letter boy. To 50 cc per hour. Yes, gradual decrease lang. Okay, so 71, that's boy. 71, that's letter boy. Again, number 71, that's letter boy. Number 72, the nurse is preparing to change the PN solution bag and tubing. The client's central venous line is located in the right subclavian vein. The nurse asks the client to take which essential action during the tubing change. Yun na yun, mother, sasabay ka sa akin, okay? So letter dog, take a deep breath, hold it, and bear down. So kailangan Valsalva maneuver to avoid the possibility of air embolism during these tube changes. Okay, so 72, letter dog. Kailangan maayos yung instructions natin kay pasyente. Okay, so 72, letter dog. 72, that's letter dog. Again, number 72, that's dog. 72 is letter dog. Number 73, the nurse is changing the central line. Sorry. So kailangan natin ipa-Valsalva maneuver si patient para ma-prevent natin yung air entry habang nagpapalit tayo ng tubings, okay? To avoid your air embolism. Okay, so 72, that's dog. 72, that's letter dog. May bayad kapag nagpapademo. Okay, tumataas po yung PF natin pag ganyan. Okay, the 72, that's dog. 72, that's letter dog. Number 73, the nurse is changing the central line dressing of a client receiving parenteral nutrition and notes that the catheter insertion site appears reddened. Okay, the nurse should next assess which item. Yun na yun. As long as alam mo yung foundations mo, huwag kayong lumayo doon kasi pinapaikot-ikot lang naman nila yan. Okay, so that's letter apple, client's temperature kasi baka may infection na si patient. Okay, so 73, that's apple. 73, that's letter apple. Again, number 73, that's apple. 73 apple, 74, the nurse is preparing to hang fat emulsion or lipids and notes that the fat globules are visible at the top of the solution. The nurse should take which action? Okay, so maghahang tayo ng fat emulsion dito. Sana. Okay, sana. Pero nung inassess mo, anong nangyayari? Okay, para humihiwalay na siya sa solution, pakisoli na lang sa pharmacy. Okay, so 74 letter boy. Obtain a different bottle of solution. Ayaw nating risk, di ba? Na baka doon pa siya sa loob ng katawan ni patient mag-react. 74, that's boy. 74, letter boy. Again, number 74, that's boy. 75, a client receiving parenteral nutrition suddenly develops a fever. The nurse notifies a doctor and the doctor initially prescribes the solution and tubing be changed. Ano daw yung next natin gagawin dito sa mga discontinued materials? Of course, syempre, if ever nga po na ang dahilan ng fever ni patient ay infection, at least, okay, ongoing na yung test natin, that's letter dog, prepared to send them to the laboratory for culture. 75 letter dog. Kasi kung ano man yung result niyan, dun mag-base sa next interventions natin. Okay, 75, that's letter dog. 75, that's dog. Number 76, the nurse caring for a group of adult clients on an acute care medical surgical nursing unit determines that which clients would be the most likely candidates for parenteral nutrition. Select all that apply. Okay, sino-sino ba muna yung mga candidates natin for TPN? Because as you know, hindi naman lahat yan po pwede. Okay, kung kaya nung i-enteral feeding, ipa-enteral feeding. Okay, so number 1, okay, yung mga patient po na hindi na functional talaga yung GI tract nila o kaya naman kailangan ng pahinga, okay, yun yung pwedeng TPN. Okay, number 2, sino po yung mga patients na yan? Yung mga patients natin who cannot take a diet enterally for longer periods of time. Okay, let's say itong letter dog. Diba? And number 3 criteria is kapag meron tayong patients who need this increased metabolic need and we have to make sure na na-achieve nila yung daily caloric intake nila. Okay, yun yung tatlong criteria natin. So pipili na tayo ngayon. It's letter apple, a client with extensive burns, kailangan ng pahinga ng GI tract niyan. Okay? Tsaka pwede rin kasi siyang merong paralytic ill use. So baliwala rin kapag enteral feeding yan. So letter boy, client with cancer who is septic. Of course, letter dog, client with severe exacerbation of Crohn's disease. And letter E, the persistent nausea and vomiting. Okay? Yung open cole, as we know, hindi siya po pwedeng parenteral nutrition kasi over time, di ba, may progression yung diet niyan. Okay? So 76, everything except letters. 76, that's everything except letter C. Okay. Number 77, the nurse is preparing to hang the first bag of parenteral nutrition solution by the central line. What is the most essential piece of equipment before hanging the solution? That's letter C. Electronic infusion pump. Because Ayaw natin na masyadong mabilis yung pag-infuse nito. High risk for hyperglycemia, napakataas po ng glucose content. And at the same time, ayaw mo rin naman na sobrang bagal no infusion. Kasi ang TPN guys, mahal to. Tapos mabilis lang din yan mapanis kapag binigay na natin sa patient. And at the same time, the doctor has to make sure na well-infused yung PN, okay, para ma-make sure niya na yung daily caloric intake is nakukuha ni patient. Okay, so 77, that's cat. 77, that's letter cat. Okay, number 77, that's cat. Balik lang tayo dito. So number 1, kapag yung GI tract ni patient is not functional, o kaya naman kailangang i-rest, that's the first one. Okay. Number 2 is if the patient cannot take a diet entirely for longer periods of time. The third one is if your patient has this increased metabolic need. And you have to make sure na na-achieve niya yung daily caloric intake. Yun yung mga indications for parenteral nutrition. Okay. So 76, A, B, dog, and E. 77, cat. 77 is cat. 78, the nurse is making initial rounds at the beginning of the shift and notes that the PN of an assigned client is empty. Which solution should the nurse hang until another PN solution is mixed and delivered to the nursing unit? It's letter boy, 10% dextrose in water. If you would notice, lahat ng choices ay D5 water. Okay, it is a matter of choosing kung asan dito yung may highest amount of glucose. Okay, para lang hindi siya mag-hypogly habang hinihintay yung next set or next batch ng PN solution. So 78, that's boy. Okay, so number 78, letter boy. Yes. Okay, 78, that's boy. 79, the nurse is monitoring the status of a client's fat emulsion, infusion, and notes that the infusion is 1 hour behind. Which action should the nurse take? Okay, same concept, same principle. Hindi mo siya ipa-fast drip kasi baka naman magkaroon siya ng fat overload. Okay, at kapag may fat overload si patient, meron din siya possible fluid overload. Okay, so i-adjust mo na lang to the prescribed rate. Okay, so 79, that's letter C. 79, that's letter C. Ideally, that's D10 sana. That's D10. So kapag walang D10 sa choice, baka D5 yung highest. Okay. Mahirap humanap ng D10. Hindi siya regularly available sa ward namin. May special mixture yung D10. So 79, that's letter C. 79 is letter C. Number 80, a client receiving parenteral nutrition in the home setting has a weight gain of 5 pounds in 1 week. The nurse should next assess the client for the presence of which condition? Okay. PN, tapos gain weight in 1 week. Okay. Pwede naman siya mag-gain ng weight in 1 week. Pero ilan lang yung ideal range sana? Okay. Dapat 1 to 2 pounds lang sana per week. Sa kanya 5 pounds. So, sobrang taas nun. Okay, baka nag-fluid overload na rin siya dyan. So, letter dog, fractals on auscultation of the lungs. Okay, so 80, that's dog. 80, that's letter dog. 80, that's letter dog. 81, the nurse is assisting to defibrillate a client in VFib after placing the pads on the client's chest and before discharging the device, which intervention is a priority? That's letter dog. Confirm that the rhythm is VFib. Okay, so after mo attach, i-confirm mo na ngayon. Okay, so VFib ba to o pulseless VTAP? Diba? Kasi iba yung intervention natin for that. So 81, letter dog. 81, that's letter dog. One more, number 81, that's dog. Isa pa. 81 is letter dog. 82, the client in VFib is about to be defibrillated. And to convert this rhythm effectively, the monophasic defibrillator machine should be set at which energy level for the first delivery? Okay, so taking note of the word monophasic. Okay, that's letter dog, 360 joules. Very objective type question, right? So please do not forget to read more. Okay? Because the more you read, the more you know. So ito po letter boy, 120 joules to 200 joules. Okay? Ito naman po kapag biphasic. Yan. Monophasic yung tinatanong. So dog. 82, that's dog. Okay, 82, that's letter dog. 82 is letter dog. 83. Okay, the nurse should evaluate that the FIB of a client was most successful if which observation was made. Okay, most successful if which observation was made. This is what you want kapag inassess si patient after the FIB. Okay, letter apple. Okay, sana arousable siya. Sana okay yung rhythm, sinus rhythm. Sana okay din yung BP niya. Okay, so in this kind of assessment, na-assess mo yung ECG rhythm ni patient, okay, yung hemodynamic status ni patient, at the same time, yung neurological status ni patient. Sana okay yung tatlo. 83, that's apple. Okay, 83, that's letter apple. 83 is letter apple. 83 is letter apple. Taking note of the question, most successful. So yung pinaka magandang set of cues yung gusto nating piliin dito. Okay, so this one is 82. Okay. Harry, 82, that's dog. 83, that's apple. 84, the nurse is documenting information in a client's chart where the ECG telemetry alarm sounds and the nurse notes that client is in VTAC. Okay, so the nurse rushes to the client's bedside and should perform which assessment first? Which assessment first? So prioritization, letter dog, check the responsiveness of the patient. Okay? Kapag nagbibitak ang isang pasyente, ina-assume natin, okay, that he or she is also suffering from this significant decrease in cardiac output. And gusto nating i-verify yon through checking the patient's responsiveness. Okay, so kapag inadequate yung tissue perfusion niyan, affected din kasi yung cerebral niyan. So check the responsiveness first and then the pulse na. Okay, so 84, that's dog. 84, that's letter dog. Again, number 84, that's letter dog. 84, dog. 85. A client is brought in the ED in VFib. The nurse prepares to defibrillate by placing defibrillation pads on which part of the chest? Another objective type question. That's letter dog, to the right of the sternum and to the left of the precordium. Okay, so 85, that's letter dog. Okay, placing defib pads. So, syempre, kapag nilagay mo na yung defib pads, dyan mo rin ipi-place yung paddle. Okay, so 85, letter dog. Okay, so 85, that's dog. 85, letter dog. 85, that's letter dog. 86, an adult client has been unsuccessfully defibrillated for ventricular fibrillation and CPR is resumed. The nurse confirms that CPR is being administered effectively by noting which action. Okay. Makalang ma-mislead kayo sa question na to, pati sa set of choices, pero i-highlight ko lang yung focus ng question. Gusto niya pong itanong sa'yo na paano daw natin malalaman na na-administer natin effectively yung purpose, yung essence ng paggagawa natin ng CPR. Okay, that's letter boy. The carotid pulse is palpable with each compression because as we know, kaya tayo nagko-compress ng patient is to deliver sana, okay, yung appropriate cardiac output, just enough lang to keep the body alive. Okay, and kapag nagsi-CPR po tayo, 30% lang ng normal cardiac output yung kaya nating maibigay sa patient. So might as well, we have to maximize the 30% na sana na ibibigay natin ng tama kay patient. I remember my very first CPR experience, sa ER ko siya na-experience. Nasa tabi ko yung head nurse, okay, ng ER. Tapos sabi niya, I have to do it properly, as deep and as fast as possible kasi parang kinikiliti ko lang daw yung chest ni patient kapag hindi ka nag-exert na masyadong malakas na effort. So dapat tama rin yung rate, okay, dapat tama rin yung depth ng compression mo. Okay, the rest of the choices, tama rin naman ito, pero kasi it talks about the method or the procedure of the actual CPR. Okay, so 86 letter boy. Eh, hindi yun yung focus ng question. Okay, so 86, that's boy. 86, that's letter boy. Sino dito gusto maging ER nurse? As in, super full support ako sa inyo. Just make sure to do everything right. Ayan, so may nag-raise hand. Iba yung adrenaline kapag nasa ER ka. Yan. I'm sure marami dito gusto maging ER nurse. Ayan, ang dami nila. Taas kamay. Mabilis kumilos. Yes, correct. Okay? Iba yung angas kapag ER nurse ka. Yung mga badass din yung mga tao dyan. Is 86, that's boy. 86, that's letter boy. May angas na po. Lisensya na lang kulang. Okay, so makukuha mo rin yung lisensya mo eventually after the May board exam. So 87, the nurse is performing CPR on a client who has had a cardiac arrest. Okay, an automatic external defib is available to treat the client, which activity will allow the nurse to assess the cardiac rhythm of the client. So that's letter boy. Apply adhesive patch electrodes to the chest and move away from the client. Okay, so 87, that's letter boy. Okay, so 87, that's letter boy. 87, that's boy. 88, the nurse is teaching adult CPR guidelines to a group of lay people. The nurse observes the group correctly demonstrate a two-rescuer CPR when which ratios of compression to ventilation is performed on the mannequin. Okay, so the first thing that I would like you to highlight is anong klaseng patient meron tayo? Adult patient. Okay, ilan yung rescuer? Two rescuer. But even still, guys, whether or not one rescuer or two rescuer, parehas lang din naman po. That's 30:2 pa rin. Okay, so 88, that's dog. Okay, 88, that's letter dog. 30:2. Ang 15:2, this one is for the children. So 88, that's dog. 88, that's letter dog. One more. 88, that's letter dog. 89, the nurse is teaching CPR to a group of community members. The nurse tells the group that when chest compressions are performed on infants, the sternum should be depressed by how far? Okay, so ang magandang article na pwedeng basahin dito, kaya naman website, would be of course from the American Heart Association guidelines. Okay, so 89, that's letter boy, about 1.5 inches or 4 centimeters. Okay. Ito pong letter C, hindi siya 1/2. Dapat 1/3 yan para maging tama. Okay, so 89, that's letter boy. 89, that's letter boy. Balik lang tayo sa previous question. Ang 30:2, so 30 compressions, tapos 2 ventilations. Saan yung ratio ng compression to ventilation mo? Yan. Yun yung 30:2. Yun yung adult, 30:2. Okay, so 88, that's letter dog. 89, that's letter boy. Number 90, the nursing instructor teaches a group of students about CPR. Okay, the instructor asks the student to identify the most appropriate location at which to assess the pulse of the infant younger than 1 year of age. Which response would indicate that the student understands the assessment procedure? Of course, that's letter C, brachial artery. Okay, brachial artery. So kapag hindi mo nakita yung brachial artery sa choices, baka naman femoral artery. Pwede rin yan. Okay? Kasi po, yung mga babies natin, very, very cute, chubby chicks. Minsan wala silang leeg. So hindi natin masyadong ginagamit yung carotid arteries for the babies. Okay? Yung radial artery naman nila, pati yung popliteal artery, it's very, very difficult to appreciate. So hindi rin yan yung reliable artery to assess. Okay? So 90 letters. 90 letters. Hala, ang cute. Pinalpate niya yung arteries ng baby niya. Number 90, that's cat. Number 90, letter cat. Number 91, an ultrasound is performed when a client at a term gestation. Pinagsama, germ gestation. At a term gestation who is experiencing moderate vaginal bleeding. The results of the ultrasound indicate that a rupture placenta is present. On the basis of these findings, the nurse should prepare the client for which anticipated prescription. Wala tayong choice. The baby has to come out already. Okay, kasi nahiwalay na po yung placenta niya. Deliver na natin yan. 91, that's apple. Term na rin naman siya. Okay, so 91, that's apple. 91, that's letter apple. Deliver the fetus. 91, that's apple. 92, fetal distress is occurring with a laboring client. As the nurse prepares the client for a cesarean birth, what is the most important nursing action? That's letter dog. Administer oxygen 8 to 10 liters per minute via the face mask. Okay, so 92, that's letter dog. So for example, preterm. Tapos, a rupture placenta. Okay? So, minsan, sometimes a doctor would prescribe yung mga steroids to hasten the long maturity of the fetus. Okay? Kasi gusto natin kapag dineliver si baby, okay, makakasurvive siya sa outside world. Okay? So, 91, that's apple. 92, that's dog. 92, letter dog. Fetal distress. So, just make sure lang na okay pa yung amount of oxygenation na nagsisirculate sa blood. Okay, so 92, that's dog. 93, the nurse in a labor room is performing a vaginal assessment on a pregnant client in labor. The nurse notes the presence of the umbilical cord protruding from the vagina. Memorize nyo na ito. Classic question, letter boy, place the client in Trendelenburg position to relieve the cord compression. Right, so 93, that's boy. 93, that's letter boy. 93, that's boy. 93 boy. 94, the nurse is monitoring the amount of lochia drainage in a client who is 2 hours postpartum and notes the client has a saturated perineal pad in 15 minutes. How should the nurse respond to this finding initially? Pag ganito, i-contact mo na si doc. Okay? Kasi napakabilis po ng blood loss na nangyayari kay patient. Saturated in 15 minutes, excessive na po yan. Okay? And recap ko lang, ililista lang ulit natin dito yung mga terms para hindi natin makakalimutan. So kapag scant ang bleeding ni mother, ano yung palatandaan natin dyan? Let's say less than 2.5 centimeters or less than 1 inch. Yung bleeding. Okay, yung bleeding in 1 hour. Okay, in 1 hour. Okay? Sa pad to, sa perineal pad to. Okay? Next naman is kapag light naman, that would be less than 10 centimeters. O kaya less than 4 inches. Okay? In 1 hour as well. Yan yung light bleeding. Pag moderate, on the other hand, kapag moderate, sulat natin dito, that's less than 15 centimeters o kaya naman less than 6 inches in 1 hour. Laging in 1 hour. Okay? Wait, there's more. Paano naman po kapag heavy bleeding? Ito na, heavy bleeding, saturated. Yun pa yung nakalimutan. So, nasaturate mo na po yung buong pad in 1 hour. Ayan, nasaturate mo na yung pad in 1 hour. And kapag po sinabi nating excessive bleeding, okay, nasaturate mo na yung pad in 15 minutes. Ganyan. Eh, yung sa kanya in 15 minutes. So, excessive bleeding na yan. Okay, paki-report na lang din kay doc. Ganun. Okay? So, 94, that's letter dog. 94, that's letter dog. Again, number 94, that's letter dog. All right. Number 95, a client in postpartum unit complains of sudden sharp chest pain and dyspnea. The nurse notes that the client is tachycardic and the respiratory rate is elevated. The nurse suspects pulmonary embolism. What should be the initial nursing action? Yun na yun. Okay, pulmonary embolism. So, oxygen pa rin tayo dito, letter dog. Administer oxygen by face mask. Uunahan ko na kayo, guys. Okay? Yung iba dito baka nag-overthink. Sabihin, kailangan po bang doctor's order ng letter dog? Of course, kailangan yan. Okay? Pero kapag po kasi board exam, ini-imply na kapag sinulat yan sa choices, okay, ay meron na siyang doctor's order. Okay? So wag na tayo mag-overthink, guys. Yung question na yon, overthinking question yan. So number 95, that's letter dog. Just stick to what is being asked of you. Okay? 95, that's letter dog. As long as hindi siya heavy bleeding, pati excessive bleeding, okay tayo. Okay tayo. Kasi ang tinitingnan naman natin kasi ang gusto nating i-monitor is yung excessive bleeding, baka kasi hemorrhage na yung nangyayari kay mother. Okay? So 95, that's dog. 95, that's letter dog. Number 96, the nurse is assessing a client in the 4th stage of labor and notes that the fundus is firm, which is what we want, na firm ang fundus natin, pero may bleeding pa rin daw. So saan siya galing? Right? So what is the initial nursing action? Paki-notify na rin po si doc. Okay? Kahit na alam mo naman kung ano yung possible na nangyayari sa kanya, and that is any laceration, let's say from the cervix o kaya naman sa vaginal laceration, paki-refer pa rin kay doc. Okay? Kasi sa kanya magde-depend yung next actions natin. 96, that's cat. Okay? So number 96, that's letter cat. 96, that's letter cat. Number 96, that's cat. Number 97, the nurse in the neonatal ICU receives a telephone call to prepare for the admission of a 43-week gestation newborn with APGAR scores of 1 and 4. Okay? Dito pa lang guys, gusto ko yung tanungin, ano ba yung perfect score for the APGAR? 1 ba yung perfect? 1 ba yung perfect kapag APGAR? What's the perfect score? 5? Try again. 10. Okay. 10. Yes, correct. I'm asking about the perfect score, hindi yung acceptable. Okay, so perfect score is 10. Okay, sa kanya kasi 1 and 4 lang, imagine. So kailangan na nating i-resuscitate si patient dito. So letter boy tayo, connect the resuscitation bag to the oxygen outlet. Okay, so 97, that's letter boy. 97, that's letter boy. Again, 97, that's boy. Number 98, the child undergoes surgical removal of a brain tumor. During the post-op period, the nurse notes that the child is restless, the pulse rate is elevated, and the BP has decreased significantly from the baseline value. Yun na yun. Okay? Sinabi na rin sa'yo kung ano nangyayari sa kanya. Nagsha-shock daw si patient. Ano na daw yung next mong gagawin? Pakitawag na lang din po si doktor. Okay? So 98, that's dog. Notify the doctor. Number 98, that's letter dog. Number 98, that's dog. One more. Number 98, that's letter dog. Number 99, a child has a right femur fracture caused by a motor vehicle crash and placed in skin traction temporarily until surgery can be performed. Tapos during your assessment, you found out na absent daw po yung dorsalis pedis pulse niya on the right foot. So ano yung kailangan mong gawin? Pakitawag na lang din po ulit si doktor kasi compromised na yung circulation niyan, pulselessness. And as you know, di ba, ang dorsalis pedis pulse, anong sinusuplayan yan? Artery sa paa. Okay, so baka ma-amputate palalo. So 99, that's dog. Okay, number 99, that's letter dog. Oo, bentang-benta si Doc today. So 99, that's dog. Last number, 100. The nurse is monitoring the IV infusion of the anti-neoplastic medication. And then, the client complains of pain at the insertion site. Okay, and during inspection, meron daw siyang redness and swelling, and the medication has slowed in rate. Okay? Possibly mag-extravasate, ano yung next nating gagawin? Yung konsepto ng extravasation, nag-infiltrate po yung gamot, pero chemo drugs yung gamit natin. Okay, and as we know, meron tayong special protocols when it comes to the preparation and even administration of this drug. Okay, so with that, meron din po tayong special protocol once this extravasation episode happens. Okay, kasi mas grabe yung toxic effects ng drug kapag nag-infiltrate siya. Okay, hindi lang yan simpleng redness and swelling. Pwede magkaroon ng necrosis dyan, especially kapag yes, vesicant yung chemo drug natin. So number 100, select all that apply, that's letter apple. Stop the infusion to prevent the progression, okay, no reaction. Letter boy, prepare to apply the ice or heat to the site. Okay. Letter dog, notify the primary healthcare provider. Kapag mga chemo patients tayo, dapat in every step of the way, dapat na-notify si doc. And letter E, prepare to administer a prescribed antidote into the site kung meron. Okay, so number 100, that's A, B, dog, and letter E. Okay, 100, A, B, dog, E. Questions? Depende kung ano yung chemo drug na yon. Doon tayo magde-depend for the antidote. Okay. Ano po ang safe score nito? Pwede na ako sa 60, 65. Okay. Possible po ba na i-restart yung IV pero other site na? Depende sa further assessment ni Doc. Okay. Depende siya. Pero yes, I could say possible na i-restart pero other site na. Kasi ideally, kapag chemo drugs yung ibibigay natin, sana ay central line. Pero pwede naman tayo magbigay peripheral line, pero mas grabe yung adverse reactions if ever ka na mag-extravasate. Okay? So if we don't have any more questions, I'll be giving you your break. So 15 minutes break. Sige, isagad natin ng 3:30. So balik po tayo by 3:45. Thank you, guys. Sige, sagutan natin yung question mo mamaya. Dapat po sige na nga ngayon na. Makailang tama po kami per NP sa blood extraction. So board exam. Okay? Ano yung passing rate sa boards? Wait lang, sorry. 75. So dapat maka at least 75 kayo. Pero yung computation, palaisipan pa rin para sa amin kung paano ba nila kino-compute yung passing rate. Maraming mga sinasabi, okay, pero walang conclusive answer for that. Minsan sabi nila kung ano daw yung highest scorer, ina-adjust doon binibase. So sige, break muna tayo. Yes, hello. Carry, tuloy na tayo, guys. Normal lang po ba na 60-70 pa rin ang scores at this point? Hu. May na po. Panic mode na. Okay, sige. So, let me tell you this story that I would like to share with you and hopefully sana gumaan yung loob niyo, guys. Okay? Recently, ang hobby ko ngayon is about surfing. So, I'm taking surfing and I'm going back and forth to LU to practice surfing. And you cannot surf properly if you do not know how to swim. So I'm taking swimming lessons as well. And I learned that, okay, kapag ikaw po ay nasa open waters, guys, gusto ko pong sabihin sa inyo that you cannot cheat your way to life. Okay, yun yung pinakaunang gusto kong sabihin. You cannot cheat your way to life. Hindi mo kayang dayain or hindi mo po pwedeng dayain ang proseso ng buhay. Okay, so step by step process tayo and eventually, hopefully, we will get there. Okay, so kapag po ikaw ay nasa open waters na, wala ka na pong pader na kakapitan doon, that's number 1. Okay, wala na pong mga coaches doon, that's number 2. Okay, and you can only hold your breath for so long. Okay, you can hold your breath, yes, but eventually you have to breathe. Okay, so kailangan ko siyang sabihin because I feel that when you are taking your actual board exams, wala na po mga lecturers doon, wala na po mga references, mga libro doon sa board exam, ikaw na lang po mag-isa. So please, as much as possible, sana po is i-maximize natin yung time and effort na binibigay po sa atin, okay, para matulungan po namin kayo to pass and even top the board exam. So please gather every resources that you could have, even us, okay, please gather as much support system that you could have kasi kailangan mo yan para kapag ikaw na po yung mismong nakaupo sa board exam, mas confident ka, mas kaya mo na. Eventually, you would learn how to swim on your own. Okay, eventually, you would fly on your own. Okay, yun yung pinaka-hinihintay ko sa inyo, guys. And I'm very, very excited for your season. Kaya nga sinasabihan ko yung mga previous sessions or sections rather na balikan niyo ako, balitaan niyo ako kapag nakapasa na kayo sa board exam. Itag niyo ako sa mga essay posts ninyo sa Facebook when you do that because gusto ko kayong isa-isang i-congratulate because I feel so proud na nakatulong po ako sa pag-attain ng license ninyo. So please guys, wag kayong mawawalan ng pag-asa because everything is a process. Okay, wala naman po mga success stories na nagsimula sa umpisa. Wala namang talagang mga magagaling na tao na magaling na in the first place. Lahat yan nagsimula muna sa pinakamababa, pinaka-basic na level bago sila gumaling ng gumaling. Okay, so please, 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 yung mga scores nyo na 60-70, do not focus so much on the scores kasi hindi naman yan iniisa-isa ng BUN. Parang, uy, ano score mo nung Recalls 11? Wala silang ganong aspect. Okay? So ako, gusto ko pa rin sabihin sa inyo na mag-focus kayo on what you would do after you get that score. Okay? Hindi ka satisfied sa score niya, what you would do after it. Okay? So the self-awareness would come in na. Okay? You have to, ilatag mo lahat. Okay, no references mo sa mesa, ilatag mo yung study plan mo, kailangan malinaw sa'yo kung nasa na ba ako at this point in time and then we will start there, we'll go there. Okay, basta ang importante, you keep on going, okay, and you would never stop. Okay, do not stop, konting-konti na lang. You're there na guys, babalik pa ba tayo? Di ba? January ko kayo na-meet, sobrang liliit niyo pa lang, ngayon ibang klase yung growth niyo. Okay, I'm very, very proud of you. Okay? Ano po, saan po ba ako dapat mag-focus? Okay, or ano ba yung kailangan ko pang studyhan? Ito ay pawang personal na opinion ko lang. Again, this is just my personal opinion that kapag meron po kayong naririnig na, uy, ito daw yung lalabas sa board exam, uy, ito yung kailangan mong i-focus. Ako, kailangan mong i-block yung mga taong nagsasabi ng gano'n. Hindi i-block sa Facebook ha, kasi for me, noise lang siya. Okay, ingay siya. Okay? Number 1 fact is walang nakakaalam kung anong lalabas sa board exam unless may mag-leak niyan. Okay? And number 2, how sure are you? 'Di ba? How would you trust that person Diba? So ako, for me, dapat mas okay siguro na wala tayong preconceived notions about what would go out sa board exam, what would come out rather sa board exam. So kailangan lang natin paghandaan, okay, yung bawat exams. Huwag tayo mag-expect. Kasi imaginein mo, naniwala ka sa nagsabi na mag-focus ka dito kasi ito yung lalabas. So naka-hyper-focus ka dun sa concept na yon, pina-neglect mo na yung ibang concept, paano kung hindi lumabas? Talo ka. Okay, so please, please, please study wisely and trust yourself enough. Okay, and you also have to trust the trust that we're giving you guys. And ako naman, full support naman ako from day one. I'm a fan of yours. I'm a fan of yours. Okay, ano po ba yung technique na ginawa nyo sa pag-shade ng Scantron sheet? Pa-circle kasi ako eh. Pa-circle ako ng shade, outer to inner yung style ko. Pero yung iba up and down, okay lang din naman yan. Okay? Yes. For the cry na tayong ma'am. Dr. Carmelita, pasok. Ayun lang, lapit na kasi eh. Lapit na talaga niyan. Yung iba dito nag-ano na, nagko-contemplate na, kaya ko pa bang humabol sa May? Okay? Saan ka nag-enroll sa top rank? 'Di ba? Pang May batch. So ituloy mo na. Sayang naman, 'di ba? Ano po yung usual scores nyo nung nagre-recalls kayo? Hindi rin tumutungtong ng 70, Diyos ko. Mababa lang din yan. Pero hindi ko kasi sinanay yung sarili ko na mag-focus sa scores. Gusto ko malaman kung bakit ganun yung score ko. What can I do to improve my scores? Okay? Pwede ba magbura na answer sa board? Pwede, pero hindi siya advisable. Pwede pero hindi advisable kasi sensitive ata yung machine na magre-read ng Scantron. Nag-top po ba kayo sa PB? Hindi po ako nag-top sa PB. Yun nga yung story, di ba? Nung nirelease yung ranking ng PB sa top rank, wala pong JD Rojas sa top 1 to 50. Okay. Alright. Sige. Gina. Gina guys, NP4 ratio. Okay, proceed na tayo. Okay, Gina ma'am, guys, tuloy na natin to. Ganun pa rin, mabilis lang din siyang pag-aralan. May pasok pa later? Hanggang 8 ako eh. May pasok pa kayo later? Sa top rank ba to or sa work niya na? Okay, so ito, mabilis lang din siyang pag-usapan. I-run through lang din natin. Okay, hindi kailangan ng masyadong mahabang paliwanagan ulit. Okay, so number 1, the nurse has instructed a client diagnosed with TB about how to prevent the spread of infection after discharge from the hospital. The nurse determines that the client needs further reinforcement of information if the client makes which statement. Again, binold na po sa atin yung phrase na to. Lagay mo lang dyan sa tabi, negative sign. Tapos, isagot natin letter apple because as we clearly know, the way that this tuberculosis is being spread, airborne naman ito, hindi naman siya through your utensils or clothing or any other thing. So number 1, that's apple. 1 is apple. Again, number 1 is letter apple. Number 2, client is being discharged to home after 2 weeks with a diagnosis of tuberculosis and is worried about the possibility of infecting family members and others. How should the nurse respond to provide reassurance? That's letter dog. The family will be treated prophylactically and the client will not be contagious after 2 to 3 weeks of medication therapy. Okay? In fact, according to WHO, ang recommended niyan would be 6 months of isoniazid therapy, okay, for the prophylactic treatment. Okay? Pero since merong mga nag-emerge na bagong researches, may mga recommendations na pwedeng mas mababa sa 6 months. Okay, so number 2, that's dog. Number 2, letter dog. Again, number 2, that's letter dog. Number 3, client with active tuberculosis demonstrates less than expected interest in learning about the prescribed medication therapy. So ano nang gagawin natin? Ayaw mo makinig kung paano ba, okay, mina-manage ang tuberculosis. Very, very prone to antibiotic resistance yung mga ganitong klaseng pasaway na kliyente. So wala tayong choice, iti-TB dots natin siya. Okay, so number 3, letter apple, directly observe therapy to ensure the compliance because the compliance really plays a huge role, okay, in treating tuberculosis. Okay? Okay naman for me yung TB response ng government here in the Philippines and ibang klase rin yung funds na binibigay or ina-allot ng gobyerno here for our Filipino TB patients. In fact, alam mo ba yung isang vial ng streptomycin, napakamahal nun. Tapos imagine mo, araw-araw siya binibigay sa mga pasyente. At ilang pasyente yun? Diba? So may commitment. Andun yung commitment ng gobyerno. So number 2, that's dog. Number 3, that's apple. Okay, number 3, that's letter apple. Buti nga sikat na yung konsepto ng TB dots here in the Philippines. Okay, minsan kasi, like in other countries, hindi pa masyadong practice or well-practiced itong TB dots na yan. So number 3, that's apple. Number 3, that's letter apple. Not everyone ay nag-avail ng TB dots na treatment. Okay, so number 3, that's apple. Number 4, which action by the parent of an infant with respiratory syncytial virus infection who is receiving ribavirin would indicate a need for further instruction regarding the management of the disease process. So further instruction, so lagay ka dito ng negative sign. Okay, kailangan po nating isagot yung letter dog. Okay, because gusto ko pang i-highlight yung word na ribavirin. As we know, itong ribavirin na to is teratogenic. Okay, so iwasan muna natin na lumapit ang pregnant patients to this person taking ribavirin. Okay, and the way na teratogen itong ribavirin is through your aerosol. Okay, sa hangin po siya nakukuha. So number 4, letter dog talaga. Okay, so number 4, that's dog. Number 4, letter dog. One more. Number 4, that's letter dog. Isa pa. Number 4, that's dog. Number 5, client is seen in the healthcare clinic and a diagnosis of acute sinusitis is made. The nurse provides home care instructions to the client regarding measures that will promote sinus drainage and comfort. Which statement by the client indicates a need for further instruction? That's letter boy. I should use a hot mist vaporizer to liquefy secretions. So, i-highlight ko lang ulit ito. Okay, lagay ako na negative sign. Yung letter boy, sa unang basa, parang tama. Right? I should use a hot mist vaporizer. Pero kasi, binasa mo ulit, may mas tama. Diba? I think mas okay kapag humidifier ito. Okay? Kaya siya yung sagot natin. So, number 5, letter boy. Number 5, that's letter boy. Again, number 5, that's letter boy. Nagbabasa po ba ako ng white book sa CHN? Sabi kasi basahin So binasa ko. So binasa ko rin siya. Okay, so number 5, that's no. Number 6, a client has been receiving a series of medications as part of the IV antineoplastic therapy. The nurse should implement neutropenic precautions after noting which laboratory result for this client. That's letter dog, white blood cell count of 2,000 millimeters cubed. Kahit anong reference value yung gamitin natin, let's say 4, 5 to 11,000, yung iba ang gagamitin is 5,000 to 10,000, sobrang baba pa rin nung kay patient. Okay, so number 6, letter dog. Number 6, that's letter dog. Number 6, that's letter dog. Especially neutropenic precautions yung tinatanong. Balik lang tayo sa number 4. Ang ribavirin po kasi is teratogenic. Okay, so pakiiwasan po mo nang lumapit yung mga buntis sa pasyenteng nagtitake ng ribavirin. Okay, so number 4, that's dog. Okay, so number 4, that's letter dog. Number 5 is boy. Number 6, dog. Number 7, assistive personnel is caring for a client who has an indwelling urinary catheter, which action by the AP would indicate the need for further instruction in the care of the client. Ganun pa rin, walang kasawaan guys. Hanggang dulo to. Okay, negative sign, lagay ka lang dyan. Letter boy, allow the drainage tubing to rest under the leg. Okay, naiipit kasi, right? So dapat hindi yan under the leg. In fact, this drainage bag should be kept below the level of the bladder, and then the tubing itself must be drained freely at all times. So number 7, that's boy. Okay, so number 7, that's letter boy. Again, number 7, that's boy. Number 8, client who is admitted for an unrelated medical problem diagnosed with urethritis caused by chlamydial infection. The assistive personnel assigned to the client asks the nurse what measures are necessary to prevent contraction of the infection during care. What should the nurse tell the AP? Ang AP po, ang counterpart dito sa Philippines is the nursing aid. Okay? So, i-highlight ko po ito, chlamydial infection, and as we know, ito po ay sexually transmitted kind of infection. Therefore, okay na po tayo sa standard precautions lang. Number 8, that's letter dog. Okay, so number 8, letter dog. When you say transmission-based precautions, we are talking about your contact-based, your droplet, and your airborne precautions. Eh, hindi niya kailangan nun kasi sexually transmitted nga ito. Right? So number 8, that's dog. Number 8, that's letter dog. Again, number 8, that's letter dog. Number 9, the nurse is conducting a community surveillance study for the purpose of communicable disease control. The nurse knows that performing an active surveillance method of assessment is best. For what reason? That's letter boy, results in detection of a more accurate number of cases. Okay, so number 9, that's letter boy. So ang surveillance method po natin would focus more on the assessment. Okay, compare natin sa interventions. Okay, so number 9, letter boy. And if we're dealing with assessment, mas gusto natin as accurate as possible. Right, so number 9, that's boy. Number 9, that's letter boy. Ay, sige, i-park natin yung question, mama. Madadaanan pa natin yan later. Maraming question about that actually. Pansin niyo ba yan? Okay, so number 9, that's boy. Number 10, registered nurse providing instructions to an assistive personnel or AP assigned to give a bed bath to a client who is on contact precautions. The RN instructs the AP to use which protective item when giving the bed bath. It's letter apple, gown and gloves. Napakadali, guys. Diyos ko. Number 10, that's apple. Ito yung tipong pag sinagutan mo yung Recalls 11 after PB1, feeling ko ang taas na naman ng tingin niyo sa sarili niyo, ganun kayo ka-confident. Kasi ang dami yan namang nasagutan. Okay? Pero may PB2. So tingnan natin kung magpa-fluctuate ulit yung emotions niyo after you take your PB2. Okay, so number 10, that's apple. Pero sa ngayon, matalino kayo kasi ang dami yung nasasagutan dito. So number 10, that's apple. Sa true lang. Number 10, that's apple. Okay, number 11, a client is being prepared for a thoracentesis. The nurse should assist the client to which position for the procedure. All right. Actually, marami tayong pwedeng consider na positioning kapag thoracentesis po. The number 1 is the usual wherein ipapaupo natin si patient at the edge of the bed and then ipapalin natin siya sa bedside table. Pwede yun. Okay? Pwede rin naman po itong letter boy, lying in bed on the unaffected side. Okay, so number 11, that's letter boy. Para lang mas ma-facilitate natin yung pagtanggal ng fluid from the patient. 11, that's boy. Okay, number 11, that's letter boy. Again, number 11, that's boy. One more, 11 boy. Number 12, the nurse is preparing to care for a client who has returned to the nursing unit after cardiac cath performed through the femoral vessel. Okay, the nurse checks the doctor's prescription and plans to allow which client position or activity after the procedure. Okay, so that's letter dog, bed rest with head elevation no greater than 30 degrees. Okay, first and foremost, after the patient had this cardiac cath procedure, kailangan talaga niya magpa-bed rest. Okay, strict bed rest for 6 to 12 hours kasi saan natin pinadaan yung catheter? Sa femoral vessels. Okay, vessel. Okay, ang dami vessels. Femoral vessel. Okay, although pwede naman siya mag-turn side to side. Although, may additional instruction pa tayo na kung ano po yung extremity na ginamit natin sa insertion ng catheter na to, it has to be kept straight then for 4 to 6 hours. Okay? In relation to your head of bed elevation, some of the references would tell you dapat daw 15 to 30 degrees. Eh yung option letter dog, pasok pa rin naman. Okay, so dog pa rin tayo. So 12 is letter D. Just no greater than 30 degrees. Okay, so 12, that's letter D. Kasi ayaw mong makink, okay, yung blood vessel na ginamit natin, baka magkaroon ng arterial occlusion naman. Okay, so 12, that's letter dog. Okay, number 12, that's dog. Again, number 12, that's letter dog. Number 13, a client has undergone EGD. The nurse should place highest priority on which item as part of the client's care plan. Of course, guys. Again, alam niyo na to. Wow. Kanina mo pa sinasabi na alam na namin to, hindi nga po namin alam. Charot. So number 13, that's dog. Assessing for the return of the gag reflex. Kasi nag-provide tayo ng local anesthesia dyan. Usually that's lidocaine spray. And to prevent your risk for aspiration, assess natin yung return ng gag reflex. So you have to keep the leg straight for 4 to 6 hours. Okay, that's 4 to 6 hours. Okay, so 13, that's dog. 14, the nurse has taught the client about an upcoming endoscopic retrograde cholangiopancreatography procedure. The nurse determines that the client needs further information if the client makes which statement. Okay. I'm glad I don't have to lie still for this procedure. Hindi ka sure dyan, mami. Okay, bakit? Kasi nga po mag-i-insert tayo ng scope. So all the more that you have to lie still. At the same time, magpipicture-picture po sila. Okay, magtitake sila ng x-ray images. So all the more that you have to lie still talaga. So 14, that's cat. Okay, so 14, that's letter cat. 14, that's cat. One more, number 14, that's letter cat. Number 15, a client is about to undergo a lumbar puncture. The nurse describes to the client that which position will be used during the procedure. All right, lumbar puncture, guys. Okay, gusto natin na ma-open yung spaces between the vertebrae para lang may ease of insertion ng needle. Okay, so knee chest position, 15, letter dog, side lying with the legs pulled up and head bent down onto the chest. Okay, so 15, that's dog. 15, that's letter dog. 15, that's letter dog. Again, number 15, that's letter dog. Number 14, that's cat. 14, that's letter cat. 15, dog. 16, young adult client has never had a chest x-ray before and expresses to the nurse a fear of experiencing some form of harm from the test. Which statement by the nurse provides valid reassurance to the client? Letter dog. The X-ray exam itself is painless and the lead shield protects you from the minimal radiation. Okay, so 16, that's letter dog. Okay, 16, that's letter dog. Again, number 16, that's letter dog. One more, 16, that's dog. Number 17, the nurse is explaining to an older client about the creatinine clearance test that has been prescribed. What response by the client indicates that there is a need for further teaching ulit? Okay, creatinine clearance test. Masyado naman pong mataas yung expectation nila about this test para isagot yung letter apple that it would measure all the level of medication that I take. Okay, hindi na yan kayang ibigay ng creatinine clearance test kasi basically, if we're doing this test, we would want to measure the patient's GFR or the glomerular filtration rate. Okay, because ito po yung isa sa mga magandang indicator ng kidney function natin. Okay, so everything is true. B, C, D, true yan, except letter apple. Okay, so 17, that's apple. 17, that's letter apple. 17, apple, one more. Number 17, that's apple. Number 18, a client is scheduled for pap smear at the next scheduled clinic visit. The nurse provides instructions to the client regarding preparation for this test. Which statement should the nurse include in the teaching? All right, so we've been talking about the pap smear for the last time. Okay, in fact, lumabas siya sa pre-boards 1. Okay, and I think nag-take na rin kayo na on-call lecture ninyo. Okay, alam natin na painless ang pap smear test. Okay, so sasabihin mo siya sa patient mo. Pero hindi nagtatapos doon yung instruction mo. Sasabihin mo siya na, ma'am, meron po itong discomfort. Okay, discomfort is different from the pain. Okay, may discomfort po kayong mararanasan kasi po magpapasok po ang doktor ng speculum para lang mas makita niyang maigay yung cervix ninyo. And then we will insert this brush applicator kasi kukuha lang tayo, okay, ng konting cervical cells para matest sa laboratory. Okay, so number 18, that's apple. Okay, number 18, that's letter apple. Ito pong letter dog, vaginal douching, douching, ano bang correct pronunciation yan, is required 2 hours before the test. This is not true. Okay, this is not true. In fact, sabi ng American Cancer Society guidelines, please do not douche or douche. Ano bang pronunciation nun, guys? Sorry na. 2 to 3 days before the pap test. Okay? So, 18 apple tayo dyan. Okay, so 18 is apple. Mali rin yung letter C. Dapat at least 5 days after the period stops. 18 apple. 18 apple. 19 donosis caring for a client after pulmonary angiography with catheter insertion via the left groin, which assessment finding is related to an allergic reaction to the contrast medium. Okay, so answer natin dito would be letter C, hematoma in the left groin. Okay, paano po magkakaroon ng hematoma sa area na yan? I-define muna natin yung hematoma. Isang malaking pasa. May swelling ng blood within those tissues. Okay? Number 1, pwedeng primarily caused by the contrast medium itself, kaya siya nagkaroon ng ganyang reaction, o kaya naman, when you administer the actual contrast medium, nag-react. Okay? Kaya ka magkakaroon ng hematoma. So either way, 19 letters. Okay? So number 19, that's cat. 19, that's letter cat. Again, number 19, that's letter cat. Number 20, the nurse provides information to a client scheduled for a dual X-ray absorptiometry or DEXA test. Which information should the nurse provide to the client? Select all that apply. Number 1 is that it is a painless test. Okay, and letter E, metallic objects such as jewelry or belt may interfere with the test and need to be removed. Apple and eggplant. Okay, so 20, A and E. 20 is A. And letter E. The rest of the choices, medyo walang katotohanan yan. Dapat ito ay less radiation. Okay, hindi necessary ang letter C. So, X yan. Hindi rin necessary yung letter dog. So, 20, A and E talaga. 20, apple, eggplant. Okay, number 21. Client with atrial fibrillation who is receiving maintenance therapy of warfarin sodium has prothrombin time of 35 seconds. So, dito pa lang guys, okay, highlight natin to, tapos ilapag mo dito, what is the normal PT time? Diba? Para lang malaman natin kung normal or abnormal ba yung binigay sa atin. 10 to 13 seconds lang, imagine. Tapos sa kanya, 35 seconds. It's very, very high. Okay? The nurse anticipates which prescription? Okay, that's letter boy, holding the next dose of warfarin. Ouch. 21, that's letter boy. That's PT. Iba pa yung therapeutic PT level, so that should be 1.5 to 2 times higher, okay, than this normal level. Either way, pag kinompute natin, mataas pa rin yung 35 seconds. So, i-hold natin. 21, that's boy. 21, letter boy. One more. 21, that's letter boy. 22, client has been admitted to the hospital for gastroenteritis and dehydration. The nurse determines that the client has received adequate volume replacement if the BUN level drops to which value. Okay, so kung mapapansin nyo guys, pinagsasama-sama na yung mga concepts sa isang question. That's what makes it more complex. So dyan lalabas yung galing natin sa analysis. So i-highlight ko lang po yung mga involved na concepts. Okay, ang normal BUN level natin supposedly, sabihin natin that's from 8 to 25 milligrams per deciliter. 8 to 25 milligrams per deciliter. Okay, paano mo daw masasabi na okay na yung volume replacement kapag nag-normalize na yung BUN? So that's letter boy, 15 milligrams per deciliter. Okay. Yung iba, 10 to 20 yung ginamit. Yung iba, 7 to 20. Okay. Either way, pasok pa rin yung 15. Okay. Kapag masyadong mababa naman yung BUN mo, let's say 3 milligrams, okay, per deciliter, fluid volume overload naman yung nangyayari sa kanya. As opposed to kapag masyadong mataas naman yung BUN, let's say 29, dehydrated pa rin si patient, hindi mo na-address. Okay, so 22, that's boy. Okay. Matagal yung clotting time. Okay, matagal yung clotting time. So, mas prone siya sa bleeding. So, i-hold natin yon. So, 22, that's boy. right? So here, kaya tayo nag-hold kasi mataas na siya. Okay, so 21, that's boy. 22, that's boy. Number 23, a client is receiving a continuous IV infusion of heparin sodium to treat DVT or deep vein thrombosis. The client's activated partial thromboplastin time is 65 seconds. Yan naman tayo sa mga lab values, guys. Kakaloka. Alright, so ito namang normal APTT mo. Iba to sa PT ha. Iba rin yung APTT. Okay, ang normal naman natin would be from 20 to 36 seconds. Okay, 20 to 36 seconds. Okay, hindi pa dyan nagtatapos. Ang therapeutic dose ng heparin natin, okay, ay dapat daw yung APTT value ni patient would be 1.5 to 2.5 times this value. Okay, so kapag i-multiply natin yung 20 times 1.5, anong lalabas dyan? 30 seconds hanggang alin? Kapag minultiply mo naman yung 36 to 2.5, ang higher limit naman natin is dapat hindi siya lalagpas ng 90 seconds. Okay, yung sa kanya 65, so pasok. Right? Pasok yung sa kanya. So okay yan, letter dog, leaving the rate of the heparin infusion as is. Okay, so 23, that's dog. 23, that's letter dog. Again, number 23, that's letter dog. Gets? Okay tayo. Medyo may konting computation dyan, pero kayang-kaya naman. 24, client with history of heart failure is due for a morning dose of furosemide, which serum potassium level. Alam niyo, patagal na patagal, parang si Queen Yasmin talaga yung na-achieve kong look dito. Sa haircut na to, medyo Queen Yasmin ako today. Anyway, nag-struck. Anyway, 24. Asan na tayo? Okay, which serum potassium level? May in love na rin ako sa security guard niya. If noted in the client's lab report, should be reported before administering the dose of furosemide. It's letter apple, 3.2 mg per liter. Okay? So 24, that's letter apple. Wait lang, i-solve muna natin to. So, serum potassium, mababa kasi, may hypocal na siya. So, kapag nagbigay pa tayo ng furosemide, mas matatapon yung potassium. Okay, so 24, that's letter apple. 24, that's letter apple. Sagutin ko muna yung question nung isa, kasi previous question siya. Sa PT po, paano naman? Here. Okay, ang therapeutic value naman ng PT natin, ganun pa rin. Dapat multiply natin siya 1.5 times 2.5. Okay, seconds. Or, wait lang, times higher. Okay, ganun pa rin. I-multiply pa rin natin siya sa 1.5 to 2.5. Yung PT. Okay. 24, that's apple. Number 25, several lab tests are prescribed, okay, for a client, and the nurse reviews the results of the tests. Which laboratory test results should the nurse report? Select all that apply. Again, marami-rami pong mga SATA questions talaga na lumalabas sa board. So okay na napaprepare kayo. Okay? So sa 25 po, ang kinakailangan nating malaman is yung kailangang i-report, which is yung mga maling value, deviated values. Letter A, platelets, of course, kasama yan. Napakababa niyan. That's 150,000 to 450,000. Sana yung normal. Okay? Kapag sodium naman, mataas naman. So, dapat ang normal mo dito would be 135 to 145. Right? Ang potassium, okay tayo dyan. Segmented neutrophils, mababa. Okay? Alright. Sige. Kapag platelets, 150,000 to 450. Okay? Kapag potassium, that's 3.5 to 5. Okay? Kapag segmented neutrophils, okay, dapat po ay 0.6 to 0.7 o kaya 60% to 70%. Okay? Ang creatinine naman, okay din tayo sa creatinine. Ano ba yung baseline or yung value natin dito? That would be 0.6 to 1.3 milligrams per deciliter. Sa kanya 1, so pasok pa rin. Okay? Ang hinahanap natin yung mali. Right? Letter F, white blood cells, 3,000 po. Ang normal nga po natin is 4,500 to 11,000. So kasama rin yan. So ang final answer natin would be A, B, dog, and letter F. Okay, so 25, that's A, B, D, and F. 25, A, B, D, and letter F. Okay, balikan lang daw na. Okay na tayo dito, guys. Balikan lang natin yung PT time. This one. Karina. Minultiply ko, 13 times 2.5, 32.5 lang sana. Sa kanya 35, so mataas pa rin. Yung isa pa. Okay, this one. Okay, carry. So 23, that's dog. 24, apple. 25, that's A, B, D, and letter F. 26, client with DM has a glycosylated hemoglobin A1C level of 8%. On the basis of this test result, the nurse plans to teach the client about the need for which measure, that's letter dog, preventing and recognizing hyperglycemia. Okay, bakit ito yung sagot natin? Kasi medyo mataas yung HbA1c niya. Okay, kapag ang pasyente natin ay may diabetes na in the first place, mag-iiba na yung mga acceptable levels natin for this one. So let's say 7%, it would indicate your good control. Okay, tanggap natin yung 7% for the DM patients. Okay, kapag naman 7 to 8%, okay, sige, pwede na. That's fair control. Okay, pero kapag umabot yan ng 8 or greater than 8%, ayun na yung poor control. Ayaw na natin yan. Okay, so 26, that's dog. 26, that's letter dog. One more, number 26 is dog. Isa pa, 26 dog. 27, the nurse is caring for a client with a diagnosis of breast cancer who is immunosuppressed. The nurse would consider implementing neutropenic precautions if the client's white blood cell count was switched value. Walang kasawaan. Puro WBC. So 27, that's apple. 2,000 millimeters cube. Okay, so 27, that's apple. 27 letter apple, again, 27 is apple. 28, a client brought to the ED states that he has accidentally been taking 2 times his prescribed dose of warfarin, okay, for the past week. After noting that the client has no evidence of obvious bleeding, the nurse plans to take which action? All right, so 2 times the prescribed dose of warfarin. I-highlight ko yung warfarin, guys. That's letter dog. Draw a sample of the PT and INR. Okay? So kapag warfarin, yung tinitake ni patient, PT and INR, yung gusto nating malaman. Paano naman po yung APTT kapag heparin naman yung therapy niya? Okay? So magkaiba yun. Okay, magkaiba yun. Ano meron, ma'am? Ay, sir. Wala, lagi ako mga classmate. Ang dami natin, 432. Okay, so 28, that's letter dog. 28, that's letter dog. Number 29, adult female client has a hemoglobin level of 10.8 grams per deciliter. Okay, so the nurse interprets this result is most likely caused by which condition noted in the client's history. That's letter C, iron deficiency anemia. Okay, so that's iron deficiency anemia. Okay, so 29, that's letter C. Mali po sa G form, pakitama na lang po. Tapos +1 kayo if ever. Okay. Kapag at risk na si patient for a very low WBC, pwede mo naman nang simulan yung neutropenic precautions mo. Okay? So for the female client, that's 12 to 15 yung normal. Ay, sorry, that's grams per deciliter. Sa kanya, 10.8 lang. Okay? So balik tayo. Kapag po APTT, that's for the heparin. Kapag PT tsaka INR, it talks about your warfarin. Yun yung pinagkaiba nila. Okay. Number 30, a client with a history of upper GI bleeding has a platelet count of 300,000. Okay, the nurse should take which action after seeing the laboratory results? Is this too high or too low? Yes, hindi na sila nadadala. Okay. Normal yan. So wala tayong kailangang gawing extraordinary, right? So 30, that's dog. Okay? 30, that's letter dog. 30 is letter dog. Uy, ang dali. Na mga question na talaga. Feeling ko umabot kayo ng 70 dito. 31. Ito na yun. The nurse reviews the ABG results of a client and notes the following. Okay, sige. Mag-practice tayo. Okay. 7.45. Is this one high or low or normal? Normal. Okay, normal. The next thing that I would like to ask you is, ito bang 7.45 ay nasa upper end or nasa lower end ng normal? Nasa upper end siya, right? Upper end. Yan lang muna yung mga isusulat natin para di tayo malilito. PCO2, 13 millimeters mercury. Is this one high or low or normal? Low. O, yan lang. Yan lang muna isulat natin. That's low. Okay, tapos i-highlight. Okay? Ang HCO3, high or low or normal? 20 mex per liter. Aba, low rin. Right? Aba, low rin. So, isulat ko pa rin dito low. Okay? Tapos, pag binasa mo yung choices, compensated, uncompensated. So, yun muna yung pakialaman natin. Okay? Pag sinabi mo pong fully compensated, okay? Pag sinabi mong fully compensated, saan ka titingin? Sa pH value mo. Okay? Kapag normal ang pH value mo, fully compensated yan. Okay? Kapag partially compensated naman, okay, kapag partially compensated, aba, tiningnan mo lahat no values, lahat sila deranged, lahat sila ay abnormal values. Okay? Paano naman kapag uncompensated? Ito yung gusto natin. Okay, dito tayo masanay na uncompensated siya. Ibig sabihin, either, okay, your PCO2 or your HCO3 is abnormal. Isa lang sa kanila yung abnormal, isa dyan ay normal. Okay, so nag-define lang tayo ng fully compensated, partially compensated, pati uncompensated. The next thing na kailangan nating malaman, okay, balikan natin yung pH. Normal pero upper end. So isulat mo agad dyan, ito ay alkalosis. Okay? Alkalosis yan. So ibig sabihin, lahat ng mga acidosis sa choices, tanggalin mo na sa paningin natin para hindi ka na malilito. Okay, so elimination method tayo dito. Next one. Okay. Between your PCO2 at HCO3 na parehas na mababa, asan dyan yung mas mababa sa kanila or yung mas deranged? That must be your CO2. Therefore, ang sasagot natin dyan is respi alka. Okay, respi alka siya. At compensated po yan because normal yung pH natin, okay? And through your further analysis, you know that ang nagko-compensate ay si kidney. Okay? Dahil meron siyang respiratory alkalosis, magko-compensate ang katawan. Paano? Magbabawas po siya ng bicarbonate. Kaya mababa yung bicarbonate natin. Compensatory mechanism yan. So 31, that's letter boy, respiratory alkalosis, compensated. Okay, 31 letter boy, respiratory alkalosis compensated. Kaya rin po naging normal yung pH natin kasi may nag-compensate. Ganon. So 31, that's boy. 31 letter boy. I hope mas clear. 31, that's letter boy. Kapag binibigyan kayo ng complex concepts na masyadong maraming kailangang isipin, isa-isahin nyo lang siya. Okay, para hindi kayo malilito-lito. Okay, so 31, that's letter boy. Number 32. Okay. Normal si pH eh. So fully compensated tayo. Okay? Kapag partially compensated, kapag pati si pH mo is abnormal. Okay? Next one, 32. The nurse is caring for a client with a nasogastric tube that is attached to low suction. Funda concept, the nurse monitors the client for manifestations of which disorder that the client is at risk for. So, memorize na natin to, guys. Low suction, so metabolic alkalosis. Kakasuction mo, naubos yung hydrochloric acid sa tiyan ni patient. So, 32, that's boy. Okay, 32, that's letter boy. Yes, kahit low suction. Okay, taking note of the question, at risk for. Okay, at risk for, may possibility. Okay, so 32, that's letter boy. 32, that's boy. 33, client with 3-day history of nausea and vomiting presents to the emergency department. So dito pala mag-highlight na ako ng mga bagay-bagay sa buhay para kitang-kita natin. So ang pinaka-issue niya ay nausea and vomiting. Tapos dinagdagan na po ng mga statements na ganito. The client is hypoventilating and has a respiratory rate of 10 breaths per minute. The ECG monitors displays tachycardia and ABG are drawn and the nurse reviews the results, expecting to note which finding. Okay? Para lang mas kita nyo yung sagot, ano lang ba yung hinighlight ko? Nausea and vomiting. Yan yung chief complaint niya. So yun yung basis ng sagot natin. That would be letter dog, increase in pH and increase in HCO3 as well. So this one is metabolic alkalosis. Okay? Yung iba kasi nalito. Hindi po ba hypoventilating? Okay, yung pinaka-issue niya, hindi po. Okay, so dahil meron na siyang metabolic alkalosis, ito na ngayon yung presenting symptoms niya. Nag-hypoventilate na siya. Okay, ito na lang yung RR niya. At the same time, nagiging tachycardic din siya. And for me to better explain this to you, para mas kitang-kita niyo siya. So nagkuha po ako ng picture from the Google. So ito po yung classic picture ng metabolic alkalosis patient natin. If you would notice, meron siyang tachycardia over here. And at the same time, may compensatory hypoventilation tayo dito. Okay? So letter dog tayo. Correct. Compensation niya yon. So letter dog tayo dito. So, balikan ko lang po ulit. Number 33, that's letter dog. Okay, 33 is letter dog. Practicing natin. Sige, sagutan natin yung ibang options. Decrease pH, increase PCO2. What's this one? Decrease pH. Mataas yung PCO2. So, opposite. Sa room cheat sheet natin, anong tawag dito? Respi acid. This one is respi acid. How about this one? Increase pH, decrease PCO2. Ano nang tawag dito ngayon? Respi alkanolong. Ano pa yung hindi natin nababanggit? Ito na yung sagot sa letter C. Decrease pH and decrease HCO3. Yun na yun. Metabolic acidosis. Very, very, very good. Okay, so 33, we're looking for metabolic alkalosis. That's letter dog. Okay, 33, letter dog. And may mga ganito pong tanungan sa board exam. Hindi nila outright sasabihin sa iyo yung term. Instead, i-describe nila sa choices. Ikaw yung bahalang mag-identify nun. So at least nabibigyan na kayo ng mga ganitong klaseng tanong to prepare you ahead on what to expect. Okay, so 33, that's dog. 33, that's letter dog. Number 34, the nurse is caring for a client having respiratory distress related to an anxiety attack. So kahit ito nga lang yung cue natin, alam mo na yung nangyayari sa kanya. Pero mabait yung question, nagbigay siya ng ABG values natin. pH is 7.53, that's obviously high. Okay, PO2, that's 72. PCO2, that's 32, low. Okay, so opposite. Okay. HCO3, 28 megs per liter. So letter dog, the client is probably hyperventilating. Okay, 34, that's letter dog. Nagsisilabasan na po yung mga memes. Okay, so 34, it's letter dog. The client is probably hyperventilating. Yan ba yun si sir na nag-hyperventilate? O, baka ganyan. Yan na lang imaginein natin. Okay, sige. Pampagising po. 34, that's letter dog. Number 35, the nurse is caring for a client with diabetic ketoacidosis and documents so the client is experiencing Cosmos respirations. Which patterns did the nurse observe? Select all that apply. Iba pala magigil si Sir Raymond, no? Parang hindi ka kikiligin. Parang hindi ka kikiligin kapag nagigil si Sir Raymond. So this one, Cosmos respiration. Parang ibang gigil yung gusto niyang gawin sa'yo. Uy, super duper friends kami ni Sir Raymond. No fourth year, si Sir Raymond, sa UP, I was a freshie. First year naman ako nun. So nagpang-abot kami. So 35, i-describe lang natin sa choices itong Cosmos respiration. That's letter boy. Respirations that increase in rate, and letter dog. Respirations that are abnormally deep. Okay, so 35, that's boy and dog. "35, that's letter boy and letter dog. Yan. Okay, 35, that's boy and dog. Napakababa naman yung age gap namin para maging tsuhin si sir. Oh my God, what's happening sa world? Ganito rin kakulit yung previous section kanina. Sobrang tawa kami ng tawa. Tawa rin ako ng tawa today. Nakakaloka. 35, that's boy and dog. Okay. Number 36, client who is found unresponsive has ABG gas drawn, and the results indicate the following. The pH is 7.12. That's obviously low naman. Okay. The PCO2 is 90. Naku, napakataas. Okay. HCO3 is 22 megs per liter. Basically normal, right? The nurse interprets the results as indicating which condition. That's letter dog, respiratory acidosis without compensation. Okay, uncompensated kasi meron kang normal value dito. Normal siya. Okay, so 36, that's letter dog. Maibibest pa ba kayo? Ipipick pa ba kayo? So 36, that's dog. Patasa po. Okay, just feel free to message me sa chat. Okay, if you want me to sharpen your pencils, okay lang. Okay, so 36, that's letter dog. Parang Retrica Productions yung pictures ni Sir Raymond. Parang galing sa Retrica. 36, that's letter dog. Sure lang, okay lang. Just message me po sa sa Messenger. Okay, 36, that's dog. Okay, 37. The nurse notes that the client's ABG results reveal a pH of 7.5, PCO2 of 30. The nurse monitors the client for which clinical manifestations associated with these ABG results. Select all that apply. Okay? Sa ngalan ng pagpapangalaga ng kredibilidad natin sa buhay, wag niyo na po akong pakantahin, guys. Baka po masira ang reputasyon natin. So, okay na po itong nagsasalita na lang po ako. Okay, so 37, that's letter apple, nausea. Okay, confusion, that's letter boy, tachycardia, and lightheadedness. Okay, so 37, A, B, D, and letter F. Yung mga types ng SATA question sa board exam, pwede po silang magpabigay ng signs and symptoms such as this one. Pwede rin nilang isata questions yung mga risk factors. Okay, pwede rin nilang isata questions yung mga medications. Okay, so 37, A, B, D, and letter F. I could say maraming SATA. Hindi lang ako makapagbigay ng exact number kung ilan. Okay, so prepare pa rin tayo. A, B, dog, and letter F for 37. 38, the nurse reviews the blood gas results with atelectasis. So that's collapse lung or lung or collapse alveoli. The nurse analyzes the results and it means that the client is experiencing respiratory acidosis, which results validates the nurse's findings. So at least binigay na sa yung ABG. Okay, that's letter apple, 7.25, PCO2 15 millimeters mercury. Okay, so 38, that's letter apple. 38, that's letter apple. Gusto ko yung si Sir Raymond ID na dog show nyo, guys. Tipong top-notcher. Tapos, dog show galore naman tayo sa kanya. At gusto ko yung game na game naman din siya sa inyo. Okay? Sa ngalan ng pagpapasa at pagiging top-notcher ninyo, lahat na ginagawa ng mga lecturer dito. Sorry wala akong ambag. Ito lang yung kaya kong maibigay. Okay? 38, that's letter apple. 38, that's letter apple. Again, 38, that's letter apple. Number 39. The nurse is caring for a client who is on MECVEN. Blood gas results of 7.5 na pH. Okay, this is high. PCO2 is 30 millimeters mercury. The nurse has to determine that the client is experiencing respiratory alkalosis. Okay, which lab value would most likely be noted in this condition? That's letter boy. Potassium level of 3 mex per liter. Ayan na, may picture na kami together. Okay, so 39, that's letter boy. Okay, so 39, letter boy. 39, that's boy. Okay, so 39, that's letter boy. Number 40, the nurse is caring for a client with several broken ribs. Okay, the client is most likely to experience what type of acid-base imbalance? So with here, compromised na rin yung long expansion niya. So 40, that's letter apple. Respiratory acidosis from inadequate ventilation. Okay, so 40, that's letter apple. Okay, 40, that's letter apple. 40, that's apple. Number 41, the nurse is caring for a client with heart failure. On assessment, the nurse notes that the client is dyspneic and crackles are audible on auscultation. Okay. Which additional manifestations would you want to expect if excessive fluid volume is present? Okay, that's letter C, increase in blood pressure and increased respirations. Okay, so 41, that's cat. Okay. So number 41, that's letter cat. Number 40, that's apple. Harry, 40, that's apple. Number 41, that's letter cat. So this one, if we have the respiratory alkalosis at risk for hypokalemia si patient. Asan dyan yung hypokalemic version? So that's letter boy. Okay. 42, the nurse reviews a client's record and determines that the client is at risk for developing potassium deficit if which situation is documented. That's letter boy, requires nasogastric suction. Pag nagsa-suction galore ka dyan, pati yung electrolytes pwedeng madamay, maging deranged din. Okay, so 42, that's boy. Okay, 42, that's letter boy. Number 43, the nurse reviews a client's electrolyte laboratory report and notes that the potassium level is 2.5 moles per liter. Okay, which patterns should the nurse watch for on the ECG as a result of the lab value? Select all that apply. All right, so this one is hypokalemia, right? So you would have letter apple, that's U waves. Okay, letter C, inverted T waves. And letter dog, that's the depressed ST segment. Okay, itong absent T waves, wala siya sa hypocal, pero pwede mo siya makita sa AFib na situation o kaya naman mga ventricular rhythms. Okay, itong widened QRS complex. Okay, saan mo naman ito makikita? Kapag naman po hyperkalemia. Okay, saan pa? Hypermagnesemia, pwede rin magnesemia. Answer option 1. Okay. So, ang dami kong sinabi, guys. Ibubonus ko lang pala. Okay, so 43, that's apple, cat, and dog. Okay, 43, bonus. Pero paki-screenshot na lang po. Ito yung hinahanap nating sagot. Apple, cat, and letter dog. Paki-bonus na lang, guys. Uy, dumadami yung mga bonus nyo, Huwag kayo umasa sa bonus sa boards. Parang wala atang bonus sa board exam. Okay? Next one, number 44. The nurse is assessing a client with lactose intolerance disorder for a suspected diagnosis of hypocalcemia. Okay, which clinical manifestation would the nurse expect to note in the client? Okay, so this one is hypocalcemia. Okay, letter apple, that's twitching. Di ba kapag calcium imbalances, about your neuromuscular disturbances naman tayo. So number 44, that's letter apple, twitching. And if you would want to try to tap the patient's face at nag-twitch yan, anong ulit yung medical term natin for that? The Chuvostek sign. Ayan. Very, very proud. Okay, tama yung spelling. Okay, Chuvostek. Okay. Chuvostek sign. Ganon. So 44, that's letter apple. 44, that's apple. Okay, 44, that's letter apple. Number 45, the nurse is caring for a client with Crohn's disease who has a calcium level of 8 milligrams per deciliter. All right. So which patterns would the nurse watch out for on the ECG? Select all that apply. So this one is hypocalcemia. Okay, kunwari yung value natin for calcium that you would want to use would be 9 to 10.5. So masyadong mababa nga yung 8. Okay. That's letter dog, prolonged QT interval, and letter E, prolonged ST segment. Okay, so 45, that's dog and eggplant. Okay, 45, D and E. (46) The nurse reviews the electrolyte results of a client with chronic kidney disease and notes that potassium level is 5.7 mg per liter. Ito naman ay napakataas. Hindi naman napaka, so mataas. Okay. Hyperkalemia naman tayo. Select all that apply. That's letter C, tall peak T waves, and letter E, widened QRS complexes. Okay, so 46, that's cat and eggplant. Okay. Ito pong ST depression, pati ang U-wave, hypokalemia yan, hindi siya hyperkalemia. Itong prolonged ST segment, ito naman ay hypocalcemia. So 46, C and E. 45, D and E. Okay, so 45, that's D and letter E. Okay. 47. Which client is at risk for development of sodium level at 130 mg per liter? Letter apple, obviously. The client who is taking diuretics. 47, letter apple. 47, that's apple. Again, number 47, that's letter apple. One more. 48, the nurse is caring for a client with heart failure who is receiving high doses of a diuretic. On assessment, the nurse notes that the client has a flat neck veins, generalized muscle weakness, okay, and diminished tendon reflexes. The nurse suspects hyponatremia. Okay, what additional signs would you expect? That's letter C, hyperactive vowel sounds. Okay, so 48, that's cat. 48, that's letter cat. Wala tayong nakikitang muscle twitches, okay, sa hyponatremia, pero meron po tayong muscle weakness, rather, it's not twitches. Okay, then the rest of the choices, dapat yung kabaligtaran, dapat ito ay increase, dapat ito ay decrease naman. Okay, so 48, that's cat. 48, cat. 49, the nurse reviews a client's laboratory report and notes that the client's serum phosphorus is 1.8 milligrams per deciliter. Which condition most likely caused the serum phosphorus level? So obviously, ito naman is mababa, right? So meron naman tayong hypophosphatemia here because ang normal value natin would be around 3.0 to 4.5 sana. Okay, milligrams per deciliter. It could be secondary to malnutrition, that's letter apple, or starvation. Okay, so 49, that's apple. Okay. Also, if a patient uses magnesium-based na antacids, that's still a cause of your hypophosphatemia. 49, that's apple. 49, letter apple. Marami po bang lumalabas na ECG sa boards? I could not say. Okay, hindi ko po masabi. Okay, pero mag-prepare pa rin tayo, guys. Di ba? Malay natin lumabas. At least prepared tayo. 49, that's apple. Number 50, the nurse is reading a primary healthcare provider's progress notes in the client's record. and reads that the doctor has documented insensible fluid loss of approximately 800 ml daily, the nurse makes a notation that insensible fluid loss occurs through which type of excretion. So, i-define mo muna, ano ba yung insensible fluid loss? Di ba? Ito yung mga fluid losses natin na hindi naman tayo aware na nababawasan na pala tayo ng tubig. Okay? Pwedeng through your pawis. So, that's your integumentary output. Okay? 50 letters. Okay? Pero may lumabas po ba sa amin na ECG? Parang wala. Wala. Okay? Yeah. Alright, 5 minutes break. Nangalahati na tayo sa NP4, guys. So, be back after 5 minutes. Sobrang quick bladder break lang and water break. Wow, humirit 10 minutes. Sige na nga, 10 minutes. Okay, 10 minutes break. Thank you. 48, that's cat. Okay, 48, that's tetracat. Carrie, number 48, that's cat. Number 49, that's apple. Number 50, that's letter cat. All right, so let's move to number 51. The nurse is the first responder after a tornado has destroyed many homes in the community. Okay, which victim should the nurse attend to first? All right, okay. Sige, mag-reply ako after this. Message ka lang, mag-reply ako after this. Okay, sureness. Okay lang, magpatasa. Carry lang. Okay, that's letter boy. Woman who is complaining, my leg is bleeding so bad, but I'm afraid it is going to fall off. Okay, so 51 letter boy. Of course, bleeding badly. Lalo na paano kung arterial vessel yung na-hit natin. So 51 letter boy. Okay, 51 letter boy. Adi magsha-shock pa yung patient, madededs pa siya. Okay, so 51, that's boy. Number 52, emergency department nurse receives a telephone call and is informed that a tornado has hit a local residential area and that numerous casualties have occurred. The victims will be brought to the ED, but then, ang tinatanong sa atin is the initial action. So that would be letter boy, activate the emergency response plan. Okay, ito yung overall plan mo on how do you handle this mass casualty scenario. Okay, para hindi kayo sabog as a system. Okay, so 52, that's letter boy. 52, that's letter boy. Again, number 52, that's boy. 53, community health nurse is working with disaster relief after a tornado. The nurse assists in finding safe housings for survivors, providing support to families and counseling. Okay, anong klaseng level of prevention daw po ito? Tapos na, right? Yung disaster per se. So after disaster na tayo, ayaw na lang natin sila na we still have to maintain their security and safety as well. Okay, so 53, that's letter C. Okay, 53, that's letter C. Tertiary level of prevention. Balikan ko lang, mabilis lang. Bakit po hindi letter apple? Okay, yung choice natin. Okay, kasi nga po, this one is circulation issue. Okay, at least for shock and death. Then after you attend to this patient, the next best na kailangan mo nang puntahan would be letter apple. So second best lang siya. Okay, so 51, that's boy. All right, so 51 letter boy, 52, that's letter boy. Number 53, that's cat. 54, nurse in the hospital emergency department is notified by the emergency medical services that several victims who survived a plane crash will be transported to the hospital. What is the initial action of the nurse? Ganun pa rin guys, if you would notice, iniikot-ikot lang po nila. Iniiba lang yung situation, pero same concept pa rin naman. Letter apple, please activate their agency disaster plan. Okay, 54, that's apple. Okay, 54, letter apple. 53, that's cat. 53, cat. 54, that's apple. Number 55, the nurse is reviewing the manual of disaster preparedness and response for the annual hospital disaster drill. The nurse reads that which are the function of the American Red Cross as opposed to the FEMA or Federal Emergency Management Agency. Select all that apply. Okay, nakakaloka. The last time I know PNLE yung nire-review natin, bakit may US setting? Charot. Okay, 55. Okay, ano ba muna yung difference ng American Red Cross sa FEMA? So kapag po American Red Cross, they cater to individual patients talaga. Okay, pero kapag sinabi mo kasing FEMA, so parang clustered group of people na to. Okay, mga regional responses to disasters. For example, yung mga money reliefs na yan. Okay, yung magde-deploy ng mga troops. Okay, yun yung FEMA. Okay, so ang tinatanong sa atin is American Red Cross. That's letter boy, crisis counseling. Letter dog, okay, training personnel. And letter F, handling increase from the families. Okay, 55, that's boy, cat, and F. 55, boy, cat, and F. Again, 55, boy, cat, F. 56, the community health nurse is preparing to teach personnel and family preparedness for disasters for a group of parents of school-aged children. Asan daw dito yung kailangan mong isama sa disaster kit? Of course, Letter apple, flashlight. Supply of batteries, battery-operated radio, para makakasaga pa rin kayo ng news kahit papano. Letter dog for the extra pair of eyeglasses, especially if we have a family member na may salamin naman na talaga. Malay mo natapakan, at least may spare kayo. Okay, itong eyeglasses na to, ito would also serve as your protection against the debris, okay, from the disaster. Okay, itong letter E at letter F, napakabigat naman no 4 weeks supply ng water tsaka non-perishable food. O, yung 4 weeks. Okay, dapat po ito ay 3 days supply lang. Okay, okay na tayo sa 3 days supply. So, 56, okay, anything except letter E and F. Ayan. Okay, 56, that's A, B, C, and letter D. 57, the nurse from a medical unit is called to assist with care for clients coming into the hospital emergency department during an external disaster. Using principles of triage during a disaster, the nurse should attend to the client with which problem first. Okay, so letter C po tayo, bright red bleeding from a neck wound. Okay, so this one would be color red, red tag yan. Okay, letter dog is expectant. Okay, letter boy, this should be yellow tag. Letter apple is the green one. Okay, 57, highest priority, letter C, bright red bleeding from a neck wound. Especially binigyan ka ng phrase na bright red. So alam mo arterial bleeding ito. Okay, 57, that's cat. 57, it's letter cat. Again, 57, cat. 58, the nurse is the first responder at the scene of the train accident. Which victim should the nurse attend to first? Again, highlight tayo ng mga tamang words sa buhay. Si nurse daw yung first responder. So basically, safe to say, mag-isa lang siya. Okay, habang nagre-respond sa scene. Ano yung first patient na kailangan niya puntahan? Letter C, who appears dazed and confused and is shivering. Okay, siguro nung binasa mo to, hindi mo siya pipiliin kasi tunog joke, right? Para lang siyang literary sense yung wording. Pero kasi kapag meron kang pasyente na dazed and confused, it talks about, wow, kinanta daw ni ma'am. It talks about the patient's level of consciousness. Possibly nagsha-shock ata siya. Okay? So 58, it's letter cat. Ito pong letter boy, okay, holding pressure on an arm laceration, obviously, kaya niya mag-self-care. Okay, so sige lang, just keep doing what you're doing while I attend to the other patients. Okay, yung letter boy, medyo stable siya. Okay, etong letter dog, screaming frantically. Okay, mahirap po kasi mag-search and rescue kapag mag-isa ka lang. Okay, so hintayin natin yung ibang tao bago tayo mag-perform ng search and rescue. Okay, itong letter apple, hindi rin siya. Okay, ang hirap kaya manghugot ng tao na natrap sa bridge or kung saan man. Okay, tapos mag-isa ka lang. Mahirap yan. It would take so much time and effort then. So letter C is the best answer. Okay, so 58, that's cat. Mag-asawa po ata si apple and dog. So ihatid natin si dog kay apple. Okay, so 58, that's letter cat. Okay, 58, that's letter cat. Again, 58, that's cat. Number 59, the nurse manager is discussing the facility protocol in the event of a tornado with the staff. Which instructions should the nurse manager include in the discussion? Diyos ko, mga SATA question. Ayaw tayong tantanan, guys. Okay? But we answer them anyway. Ganon. So magka-complain at first, then answer. Ganon. Okay, so 59, letter boy, cat, and dog. Move the beds away from the windows. You would want to close the window shades and the curtains and place blankets over the clients who are confined to beds. Okay, as much as possible, baka kasi merong mga flying debris everywhere. So ilayo mo yan sa windows. Okay, at isara mo na rin. Okay, ito pong letter E. Okay, from the hallway back into the room, baligtad. Okay, from the room to the hallway dapat. Okay, so 59, that's boy, cat, and dog. Feeling ko ikakabagsak ko yung katamaran magbasa. So ngayon pa nga lang, i-practice na natin. Okay, 59, boy, cat, and dog. Sarap naman magbasa. Guys, wow! Masarap naman magbasa. Sino niloloko? Charot. So 59, that's boy, cat, and dog. Okay, 59, BC, and letter dog. Yes. Okay, 60. Sagot ka na lang ng sagot ng questions. Yun din yung technique ko before eh. Sagot lang ako ng sagot ng question. Tapos kapag medyo may hindi ako clear na reason kung bakit yun yung sagot, doon ako nagbabasa. Okay, the nurse is the first responder at the scene of a 6-car crash on a highway. Which victim should the nurse attend to first? Obviously, letter Apple is the priority because airway tayo dito. Okay, 60, that's Apple. 60, that's letter Apple. Again, 60, that's letter Apple. Bakit po ulit mali yung letter E? So, from the hallway back to the room kasi yung sabi, dapat po baligtad. From the room, from the kwarto, palabasin mo to the hallway. Kasi as much as possible, ilalayo natin sila sa mga window sources. Baka meron kasi mga flying debris everywhere, shattering glass everywhere, mga ganyan. Okay, so 59, that's boy, cat, and dog pa rin. Number 60, Apple. 60, that's Apple. 61, nursing graduate is attending an agency orientation regarding the nursing model of practice implemented in the healthcare facility. The nurse is told that the nursing model is team nursing approach. Wow. All right. So describe lang tayo dito ng mga statements sa buhay and concepts. So when you see team nursing, that would be letter dog. The RN leads 2 licensed practical nurses, 3 APs in providing care. Okay. 61, that's dog. All right. Itong letter Apple, this one is functional. Functional nursing. Itong letter boy, client's needs at home and begin discharge planning. This must be your case management. Okay. Itong letter C, single RN responsible for providing care, primary nursing. Ganun. So 61, that's dog. Okay, 61, that's letter dog. Again, 61 letter dog. One more, 61 is dog. 62, the RN is planning the client assignments for the day, which is the most appropriate assignment for an assistive personnel. All right. So kanina may nagtanong, ano po ba yung difference no AP sa LPN, LVN, then RN? So again, wala tayong konsepto kasi ng assistive personnel here in the Philippines. Ang counterpart po nito is the nursing aid. Okay, the nurse aid. Okay? So letter C po tayo who requires urine specimen collection. Kaya mo yang ipadelegate sa kanila. Unlike itong letter Apple, boy, and dog, pwedeng RN sana ang gagawa niyan. Okay, so 62, that's cat. 62, that's letter cat. Again, 62, that's letter cat. 63, the nurse employed in the long term. Okay, sorry. Tube feedings. Gusto nating ipagawa sa assistive personnel. Di ba meron tayong risk of aspiration when we do your tube feeding? So kapag may mga risk of complications, hindi natin siya masyadong pinapagawa sa NA. Okay, dapat yung basic of the basic nursing care lang. Okay, 62, that's cat. Okay, 62, that's letter cat. Number 63, the nurse employed in the long-term care facility is planning assignments for the clients on a nursing unit. The nurse needs to assign 4 clients and has a licensed practical nurse and 3 assistive personnel on the nursing team. Asan daw dito yung pwede nating ibigay sa licensed practical nurse? Again, wala rin po tayong konsepto ng LPN, LVN here in the Philippines. So, hindi tayo makarelate. Okay? Pero, kung i-compare natin yung AP, okay, the next one would be the LPN o kaya LVN. Kapag narinig niyo na yung LVN, it talks about your licensed vocational nurse. Okay? Sabi daw, upon reading, ang LPN tsaka yung LVN, nagkakatalo lang din naman yan sa iba't ibang state. Okay? So kung nasa ang state ka, LPN yung tawag sa'yo. Kapag nasa ibang state ka naman, LVN yung tawag sa'yo. Okay? Pero roughly the same lang din naman sila. Okay? Then the highest one is the RN. Is the RN. So, kung titingnan natin, yung LPN, it's 1 level below your RN. Mas extensive yung knowledge ng RN kaysa sa LPN. Okay, at tapos itong LPN, nagre-report sila sa mga RN. Okay? So this one, ano yung pwede nating ibigay sa patients with, sa licensed practical nurse? Okay? Number 1, lahat ng mga kayang gawin ng assistive personnel ay pwedeng gawin ng LPN. Okay, let's say the feeding, okay, enteral feeding, okay, dressing, bathing the patients, morning care, oral hygiene, bed making, mga ganyan, okay. pwede yang gawin ng LPN. Okay, aside from that, pwede rin tayo magpa-monitor ng vital signs, changing of the bandages, okay, cleaning the wounds, irrigations, inserting the catheters, pwede yan, gawin ng LPN. Okay, pwede rin silang magbigay ng meds, pero oral meds lang. Okay, pag IV meds, RN po yan. Kapag naman RN, yung mga advanced specialized care, let's say, endotracheal suctioning, okay, yung mga venipuncture, getting the blood sample and everything, yun yung RN. Okay, so here to answer this question, it would be letter dog, requiring abdominal wound irrigation and dressing changes every 3 hours. Okay, daming sinabi. 63, that's dog. Okay, etong A, B, and C, pwedeng gawin niya ng AP. Okay, honestly speaking, since wala tayong konseptong ganito, hindi siya lalabas sa PNLE. Okay, baka NCLEX concept to, pero at least nadaanan natin siya. Okay? 63, that's dog. Yung delegation powers, RN yan. Okay, RN pa rin yan. Okay, yung delegation powers nasa RN pa rin. 63, that's letter dog. 64, the charge nurse is planning the assignment for the day. Which factor should the nurse remain mindful of when planning the assignment? Pwede pong kumuha na VS yung AP. Pwede silang kumuha. Okay, select all that apply. Letter apple, the acuity level of the clients. And when you say acuity, it's not the literal visual acuity, guys. Ito po yung level of care na binibigay natin sa patient. So for example, sila ay intubated. So of course, kailangan nila ng highest level of care from us. That's the level 4 care. Okay, kapag naman sabihin natin ambulatory si patient, malapit na ma-discharge, pwede na yung level 1 care lang. Ganon. Okay, so 64, that's apple. At the same time, letter E, client needs and workers' needs and abilities. Dapat match din yung skills ni patient doon sa patient, skills ni nurse sa patient na ipapa-assign natin sa kanya. Okay, kasi hindi naman malulugi yung nurse yung patient, yung malulugi doon. Okay, so 64, that's apple and eggplant. 64, A and E, but eggplant. Ayaw mo ba ng elephant? Okay, 64, that's A and E. 65, the nurse is giving report to an assistive personnel who will be caring for a client in hand restraints. How frequently naman should the nurse instruct the AP to check the tightness of the restrained hands? Taking note of the phrase that was used, check the tightness. Okay, check the tightness. That would be every 30 minutes. Okay, every 30 minutes, because we're talking about the neurovascular checks and the circulatory status, okay, ni patient. Okay, so 65, that's letter dog. Okay, every 30 minutes. Okay, sabihin natin, sabi po ni Sir Kenneth ay every 15 minutes. All right, so with that, kapag yun yung basis natin, ganun pa rin. Let's choose the closest answer. Letter dog pa rin yung sagot natin. Okay, so 65, still letter dog. Alright, so iba po yung checking of the tightness, iba rin po yung kung kailan tayo pwedeng magtanggal ng restraints mismo. Okay, pwede bang tanggalan yung restraints? The answer is yes. Ngayon, every kailan pwede siyang tanggalan? That's letter apple, every 2 hours. Okay, so please, okay, take note of the question really carefully kasi mag-iiba yung question or yung sagot kapag iba yung interpretation mo sa question. Okay, so 65, that's dog. 65, that's letter dog. Again, 65, that's letter dog. Number 66, the nurse manager is planning the clinical assignments for the day. Which staff members cannot be assigned to care for a client with herpes zoster? Select all that apply. Of course, this one is very highly contagious and infectious as well. So protektahan natin yung mga staff, okay, na mataas yung susceptibility towards having this herpes zoster, and at the same time, yung mga staff po na mababa yung protection nila against this disease. So that's letter C. And letter E, the nurse who never had chicken pox. And letter E, the nurse who never received the varicella zoster vaccine. Okay, so 66, that's C and E. 66, that's C and E. Again, number 66, that's C and letter E. Okay, 67. When creating an assignment for a team consisting of registered nurse, 1 licensed practical nurse, and 2 assistive personnel, which is the best client for the LPN? Ganun na naman guys, LPN na naman yung tinatanong. So letter dog, kaya or pwede nating magpa-delegate ng urinary catheterization sa LPN. Kaya nilang gawin yan. Okay, 67, that's dog. Okay, 67, that's letter dog. Yung A tsaka B, pwede yung AP. AP. Ang letter C, RN yan. Okay, 67, that's dog. 67, that's letter dog. Again, 67, that's letter dog. Number 68. Okay, number 68. When creating an assignment for a team, ay naulit. Okay, naulit. So 68, that's still letter dog. Okay, so naulit. So 68, that's dog. Number 69. Wait lang. Wait, ayun. Okay, number 69. The registered nurse is planning assignments for the clients on a nursing unit. The RN needs to assign 4 clients and has 1 RN, 1 licensed practical nurse, and 2 assistive personnel on a nursing team. Which client would the nurse most appropriately assign? The licensed practical nurse. Okay, 69, that's letter boy. The client with an abdominal wound requiring frequent wound irrigations. Okay, 69, letter boy. They could do that, yung mga wound irrigations. Okay, 69, that's boy. 69, that's letter boy. Number 68, that's letter dog. Naulit lang po siya sa 67. Ito po yung 68. Letter dog. Tama, no? Naulit lang siya sa previous question. Yes. Okay. 69, that's boy. Number 70. Letter C, remove the water pitcher from the bedside. Wow, hindi na binasa yung tanong. Tinawad na, sagot agad. 270 daw, the nurse is caring for a client with acute glomerulonephritis. O paano, kanya-kanya muna tayo guys. This nurse interprets or instructs, okay, the assistive personnel to implement which action when caring for the client. All right, so here, pinagsama niya yung konsepto ng med-surg, pati yung Palmer concept. And as we know, itong mga patients natin with AGN ay handled once, school age siya. Okay, very, very cute, pero manas as well. Okay, kailangan po natin ng fluid restrictions, correct? Okay, so yung source mismo ng water, alisin na natin sa kanya, baka matempa. So 70, letter C, remove the water pitcher from the bedside. Kayang gawin niya ng AP, right? 70, that's cat. 70, that's letter cat. Again, number 70, that's letter cat. Number 71, the nurse hears a client calling out for help, hurries down the hallway to the client's room, and finds the client lying on the floor. The nurse performs an assessment, assists the client back to bed, notifies the primary healthcare provider, and completes an occurrence report or incidents report. Isa lang po yun. Okay, that's letter C. The client was found lying on the floor. Again, kapag po incidents report ang pinag-uusapan natin as objectively as possible po, yun the way that we should document, okay? With the use of your empirical senses, the touch, touch, feel, taste, even the taste pwede rin, okay? Yun lang yung mga pwede nating gamiting words to describe a certain situation, okay? So, bawal tayong gumamit ng mga sarili nating interpretations or opinions. 71, that's cat. Okay, 71, letter cat. Ito pong number 70. Ano daw yung pwedeng ipagawa sa assistive personnel while we're taking care of a patient with acute glomerulonephritis? So, kaya niya itong gawin, removing the water pitcher from the bedside. Okay, bakit niya po tatanggalin? Kasi may fluid restriction si patient. So, okay lang yan. 70, that's cat. Okay, number 70, that's letter cat. 70 cat, 71 cat, 72. Okay, emergency craniotomy is required. The name of the client is unknown. The client has sustained a severe head injury and multiple fractures. But regarding informed consent, what is the best action? Letter C, transport the victim to the OR for surgery. Okay, 72, that's letter C. Anong klaseng principle yung ina-uphold natin dito kapag may emergency surgery tapos walang pipirma? Paternalism, correct. Okay, so recap lang, yung konsepto po ng paternalism is applicable lang if only the situation is a matter of a life and death. Yung tipong kapag hindi mo ginawa itong intervention na to, within how many minutes, matetegi si patient. Okay, so 72, that's letter C. Ngayon, kung pwede namang i-delay ng konti yung intervention na gusto mong gawin para lang maghintay nung pipirma sa consent form, i-delay natin. Pero ito kasi is emergency, 72 cat. Okay, 72, that's letter cat. Paano po kapag DNR bracelet? May DNR bracelet. Hindi naman siya i-resuscitate. Isa-surgery kasi siya. Okay. Ayan. So 72, that's cat. 72, that's letter cat. 73, the nurse arrives at work and is told to report float to the ICU for the day. To report or float pala yun, because the ICU is understaffed and needs additional nurses to care. Okay, what is the best action? Letter boy, clarify the ICU client assignment with the team leader to ensure that it is a safe assignment. So balik lang tayo sa concept natin of floating yung mga requirements. So dapat well-oriented at dapat meron siyang core competencies. Okay, kung wala siya boot nun, pakisabi doon sa team leader. Okay, so 73 letter boy, to maintain the safety of the environment. Okay, 73 letter boy. 73, that's letter boy. 72, very not necessary yung court order for this one. Napakatagal na proseso ng court order just for a surgical procedure. So letter C na tayo agad. Okay. 73, that's letter boy. 73, that's boy. Number 74, the nurse who works on the night shift enters the medication room and finds a co-worker with a tourniquet wrapped around the upper arm. Okay, may sariling session yung co-worker mo, guys. May sarili siyang private session. Okay, nakita mo daw personally, ano yung next mong gagawin? Letter C, call the nursing supervisor. Okay, 74, letter C. Si surgeon, yes, yung final decision-making body for that kapag paternalism. Okay, so ito naman, tinatanong sa'yo yung direct boss mo. Okay, si nursing supervisor. Tapos si nursing supervisor, siya naman na ngayon yung magre-report sa authorities, let's say the police, mga ganyan. Okay, so 74, that's letter cat. Okay, 74, that's cat. Again, 74, that's letter cat. Number 75, hospitalized client tells the nurse, may nursing supervisor po bang available pag night shift, ma'am? Okay, another example of overthinking kind of question. Wag mo na isipin yun. Okay? Wag mo na isipin yun. Just answer the question as is. Ito yung binigay sa yung choices. Pipili ka lang doon. Okay? So 74, attack the question as is tayo. Okay? 74, that's letter cat. 75, that's letter dog. Number 76, that's boy, cat, dog, and letter E. Kasi the way that we should answer these kinds of questions as ideal as possible. Okay? Wala namang references na magsasabi sa'yo na if the nursing supervisor is not available on the night shift, you call this. Walang ganon. It's ideal pa rin. Okay? This one, 76, mali daw sila nung na-enter sa medical record, na electronic medical record. Select all that apply. Letter boy, letter cat, dog, and E. Right-click on the entry and modify it. Document the correct information and end with the nurse's signature and title. Obtain a co-signature from the RN. Okay, bakit kailangan ng signature ng RN na naka-witness na nasayang yung 1 milligram? Kasi po, we are dealing with your opioid pain medication. Okay, and letter E, document in the nurse's notes in the client's record detailing the corrected information. Okay, so 76, everything except letter Apple, complete and file an occurrence report. Okay, we are talking about the documentation kasi, di ba? Hindi naman focus yung incidents report. So, hindi yan. It's not necessary. Okay. As I said, meron mga iba't ibang protocols yung bawat institution with regards to the documentation na electronically records. Okay? Yung iba kasing mga institution, kapag in-input mo na, hindi mo na may edit, ito, yung situation na to, pwede pa nilang ma-modify and ma-edit. Okay, so 76, that's boy, cat, dog, and letter E. Babayaran po ba nung nurse yon? Hindi ko po sure. Hindi ko po sure. Okay, 76, boy, cat, dog, and letter E. I don't know how it works sa ibang institution, but doon sa facility kung saan ako nag-work, pag may ganitong occurrence, di naman binabayaran ng nurse. Okay? 77. Okay, which identifies accurate nursing documentation notation. Select all that apply. Okay? So here naman, ang focus mo dito is how do you document as objectively as possible. Okay, that's letter apple, the client slept through the night. Letter boy, abdominal wound dressing is dry and intact without the drainage. Letter E, the client's left lower medial leg wound is 3 centimeters in length without the redness, drainage, or edema. Okay? Gusto kong i-emphasize sa inyo na once na gumamit na yung nurse ng word na seem, okay, seems, ano pa, appears, ganyan, medyo implied kasi na gumagawa siya ng opinion niya. Ayaw natin nun kapag documentation. So 77, that's apple, boy, and E. Yes. Okay, 77, A, B, and E. Again, balikan ko lang dito, ang focus natin is about documentation. So, hindi tayo mag-emphasize sa incidents report. Okay. So, 77, that's A, B, and letter E. Number 78, nursing instructor delivers a lecture to nursing students regarding the issue of client's rights and asks a nursing student to identify a situation that represents an example of invasion of client privacy. Ito, feeling ko gas-gas concept na to sa inyo, guys. Alam na alam niyo na. Okay, which of the following indicates an understanding of the violation of this right? Basically, kapag po privacy ang pinag-uusapan, kapag chinika-chika ng staff nurses, yung personal life ng patient, that's invasion of privacy. Ano pa po? Kapag si nurse ay nakikinood sa treatment ng isang patient, ay hindi naman siya part ng healthcare team na yon, especially kapag exposed yung genitalia ni patient, okay, invasion of privacy pa rin yan. So 78, that's dog. Okay, so number 78, that's letter dog. 78, that's letter dog. Ganun pa rin, same principle applies kahit nursing students, tapos hindi naman sila, paano po yung mga nursing student na nakikinood kapag delivery? Di ba, that's for the educational purposes and involved naman tayo sa care ng patients na yon, di ba? Okay, meron naman tayong implied consent for that. So okay lang yon. Okay, so 78, that's dog. Okay, 78, that's letter dog. 78, that's dog. 79, nursing staff members are sitting in the lounge taking their morning break. An assistive personnel tells the group that she thinks that the unit secretary has acquired, okay, immunodeficiency syndrome. Aba, nakichika pa. At hindi pa doon natatapos, proceeds to tell the nursing staff that the secretary probably contracted the disease from their or from her husband, who is supposedly a drug addict or addict. Grabe, ibang level ng Marites moment ito, guys. Nakakaloka, for the grapevine talaga. At napakarami pong mga Marites sa mga facilities and institution. Okay, medyo na culture shock din po ako na ay okay, ganito pala yung sistema ng mga Marites dito. Ito pala ang reality ng buhay. Kasi never akong na-expose sa mga sobrang hardcore Marites sa buhay. Ayoko na lang mag-talk. Pero 79 letter boy slander. Okay, 79 it's letter boy slander. Sobrang blessing pala talaga, no? Kapag naka-meet ka ng mga maayos na colleagues tsaka mga staff nurses who would guide you, who are so professional, to the point na alam mo yon, walang siraan, walang bad vibes sa ward. Yun yung mga masarap katrabaho. Okay, so 79, it's letter boy, slander. Okay, tapos kung sino pa yung mga magagaling, yung mga nilo-look up mo, sila yung mga unang lumalabas or umaalis sa ward kasi hindi na nila masikmura yung mga bad, toxic culture, environment. Ayaw natin. So 79, that's boy. Okay, number 79, that's letter boy. 79, it's letter boy, slander. Okay. Number 80, an older woman is brought to the emergency department for treatment of a fractured arm. On physical assessment, the nurse notes old and new ecchymotic areas on the client's chest and legs and asks the client how the bruises were sustained. Okay, the client, although reluctant, tells the nurse in confidence that her son frequently hits her if supper is not prepared on time when he arrives from work. Anong nangyayari? 'Di ba? I-highlight natin yung patient para mas lumitaw yung konsepto ng elderly abuse po ito. Okay? So here, yung mga classic signs and symptoms na pwede nating makita sa isang elderly abused patient. So, therefore, letter dog po tayo. As a nurse, I am legally bound to report abuse. Okay, I will stay with you for a while you give the report and help you find a safe place for you to stay. Okay? Hindi kasi po pwedeng ikaw mismo as a staff nurse yung mag-a-address nito. This is beyond your control and your scope as well. Okay, so 80, that's letter dog. I-report mo na lang. Okay, number 80, that's letter dog. 80, that's dog. One more, number 80, that's letter dog. Number 81, nurse is assigned to care for 4 clients. In planning the care or client rounds, rather, which client should the nurse assess first? Again, prioritization of care, airway, breathing, circulation, that's letter dog. Client with asthma who requested a breathing treatment during the previous shift. Okay, so number 81, that's letter dog. Superior lagi, yung pagre-report. Laging kay superior. 81, that's letter dog. One more. Number 81, that's dog. Number 82, the nurse employed in an emergency department is assigned to triage clients coming to ED for treatment of the evening shift. The nurse should assign priority to each client. Ito na nga po yun, letter dog, a client with chest pain who states that he just ate pizza that was made with a very spicy sauce. Okay, very spicy sauce. Yung tipong mapapapikit ka sa ka-spicyhan niya. Ganon. Okay, with chest pain. So baka naman nag-MI ngayon si patient. So siya po yung tamang sagot. 82, that's letter dog. Okay, 82, that's letter dog. Alright, so dito ko po gustong ipasok yung konsepto ng emergent, urgent, pati non-urgent cases natin. Isa-isahin lang natin para hindi tayo magkakalituhan. So when you say emergent, basically, una sa listahan is the chest pain. Okay? Pag ayan ay nag-progress pa, nagkaroon ng MI, nagkaroon ng cardiac arrest even. Okay, so emergent cases po yan. Okay, pag na-stroke si tatay, okay, emergent din yan. And any other kinds of acute neurological deficits, emergent case yan. Ano pa ba? Kapag meron pong hemorrhage, of course, hemorrhage, anaphylactic reaction, okay, yan yung mga pasok sa emergent cases. Okay, wag natin kalimutan, massive trauma, injury, emergent pa rin yan. Kapag naman po urgent cases, okay, kapag urgent cases naman, dito papasok, nangunguna naman sa listahan, abdominal pain. Siyempre, kailangan mong i-trace yung cause niyan. Okay, when you say urgent, kailangan mong i-treat, pero it can wait. Okay, kaya ma-delay. Okay, so number 2 priority sila. Ano pa, yung merong mga sabihin nating hypertension patients, yung merong mga asthma, pero without respiratory distress because, respiratory distress because once your patient has this acute or severe respiratory distress, emergent case na po yan. Okay, emergent case na yan. Yun yung mga urgent cases. Baba. Kapag naman po non-urgent, fractured people, urgent pa rin yan. Okay? Kapag naman po non-urgent, okay, sorry niliitan ko yung font. Kapag naman po non-urgent cases, nag-isip, mga minor laceration cases, okay, ano pa ba? Yung mga na-spray naman, okay, non-urgent po yan. Yung may mga sipon-sipon, galore-galore, okay, non-urgent pa rin yan. Okay, so yan lang. Gusto ko lang ilista ulit yung mga differences ng emergent, urgent, and non-urgent para walang lituhan. So 82, that's letter dog. Yun yung priority natin. Nag-MI siya, or chest pain. Okay, 82, that's letter dog. 82, that's dog. One more, 82, that's letter dog. Ang COVID po, saan siya magpo-fall? Okay, depende sa presenting symptoms ng COVID. Okay? So kapag meron siyang respiratory distress, automatic emergent siya. Okay, so kapag naman colds lang, cough, pwede nang non-urgent yan. Okay, ganon. Ang burns, massive burns, sulat natin sa emergent cases. Yan, emergent yan. Massive burns. All right. Ganon. Next one, 83. The nurses received assignment for the day shift. Okay. Paano po yung A? Sorry. History of seizure. History of seizure. Wala naman siyang actual seizure, right? So, pwedeng non-urgent to. Okay. Harry. This one, 83, received the assignment for the day shift. After making initial rounds, checking all the assigned clients, which clients should the nurse plan to care for first. Siyempre, yung mga relatively kailangan ng further assessment and care intervention, that's letter dog, white blood cell count of 14,000 and temperature of 38.4. May infection si patient. 83, letter dog. Okay, the rest, relatively stable sila. 83, that's dog. Again, 83 letter dog, one more 83, that's dog. 84, the nurse is giving a bed bath to an assigned client with an assistive personnel enters the client's room and tells the nurse that another assigned client is in pain and needs pain medication. Another classic question, right? Which of the following is the most appropriate action? Pakitakpan muna si patient na pinaliliguan. Okay, babalikan po kita. Kailangan ko lang mag-administer ng pain med sa isang pasyente. Okay, 84, that's dog. Okay, wag mo naman pong iwanan na nakatiwangwang lang si patient. Okay, naka-expose yung mga private parts. Okay, kumutan mo naman. Okay, kumutan mo naman siya. Okay, gusto mo lagi lang siyang komportable. 84, that's dog. Okay, 84, that's letter dog. 84, that's letter dog. Number 85, the nurse is conducting a session about the principles of first aid. Di na binalikan. Nakapila na sa bondi. Magta-time out na. Hindi pa pala tapos yung naliligong patient. And is discussing the interventions for a snake bite to one extremity. The nurse should inform those attending the session that the first priority intervention in the event of this occurrence is which action. Okay, so snake bite po yung pinag-uusapan natin. Okay? Ayaw nating nagbabonding pa rin sila nung snake pati yung patient. So tanggalin mo na siya sa source ng possible toxic venom substance na yon. Okay? So 85, that's letter dog. Kinagat ni Bess. Okay. Meron ako nakitang meme, yung parang talk to the snake ba yun? Meron option na gano'n na super duper funny for me. Anyway, 85, that's letter dog. Move the victim to a safe area away from the snake and encourage the victim to rest. Okay, this is the first thing that you would do. The next thing na kailangan nating gawin is letter boy. Remove the jewelry and constrictive clothing from the victim because as we know, kapag meron po tayong toxic venom, okay, substance sa loob ng katawan, of course, magre-react po yung katawan natin. Possibly magsiswell yan. So at least wala na po tayong mga jewelry. Okay, wala na rin tayong clothing for that. Okay, the next thing, okay, that we have to encourage the victim to rest kasi malay mo maging in distress siya or maging aggressive. So ayaw natin yan. As much as possible, dapat rested siya. Okay? At hindi siya tense. Yun yung gustong iparating ng letter dog. Okay? The third thing that you would want to do is letter apple to immobilize the affected extremity. Okay? The last thing, place the extremity below the level of the heart para lang hindi mabilis na kumalat yung venom if ever. Okay, 85, that's letter dog. Okay, kasi kapag at rest si victim, mas babagal po yung circulation ng venom sa loob ng katawan. So best answer pa rin yung dog. Okay, so 85, that's letter dog. 85, that's letter dog. One more, 85, that's dog. 86, the nursing instructor asks a nursing student to identify the priorities of care for an assigned client, which statement indicates the student correctly identifies the priority client needs. That's letter apple, actual or life-threatening constraints. Ganun lang. Okay, ganun lang. 86, that's apple. Okay, 86, that's letter apple. 86, that's apple po. Number 87, the nurse is assigned to care for 4 clients. Which one would you want to assess first? Apparently, naulit na po ito, letter dog, client with asthma. Okay, 87, letter dog. Kung sakaling magdadasal kayo sa universe na sana may maulit na test question, okay, pakikumpleto po ng dasal. Okay, sana po kung may mauulit na test question, alam ko po yung sagot. Ganon. Okay, sana yung alam ko po. Okay? So kapag magma-manifest tayo sa universe as specific as possible, kunwari naghahanap ka ng jowa mo, sana po ganito siya at ganito po siya. Okay? Para nagkakaintindihan po tayo. Para hindi ako mako-confuse. Kapag may dumating, siya na ba yun? Ganon. Yes, so 87, that's dog. Ang daming nalalaman. Nakakaloka. Magturo ka nga lang dyan. Ay, nako. 87, that's dog. 87, that's letter dog. Ganon. Okay, 88. Okay, the clinic nurse is caring for a client complaining of a foreign agent splash into the eye. What intervention should the nurse employ before the treatment? Letter boy, evaluate the client's visual acuity. Yes, tama yan. Mag-please ka, lambingin mo siya. Gusto mo lagi lang siyang nasa good mood. Ganyan. Para ibigay niya sa'yo yung gusto mo. Okay, so 88, that's letter boy. 88, that's letter boy. Okay, kasi ang sabi po kasi sa atin dito is you would want to employ before the treatment. Kung mapapansin natin, pag binasa mo yung choices, halos lahat yan is may ginawa na siya, may actual intervention. Pero itong letter boy kasi nag-a-assess pa rin siya. So assessment always comes first. Okay, so 88, that's boy. Ayoko na lang mag-talk kung may nahanap na daw ba ako sa LU. Hindi naman ako naghahanap, guys. So 88, that's boy. Okay, 88, that's letter boy. 85, that's dog po. Okay, 85, that's dog. 85, that's letter dog. 86, apple. 87, that's dog. 88, boy. 89, a child with autism spectrum disorder is being admitted to the hospital for diagnostic tests. Which room assignment is the most appropriate for the child? Of course, kailangan nating maintindihan ano ba yung nature, ano ba yung behavior ng patients natin with autism. Diba? As much as possible, dapat sana decreased stimulation kasi kapag nag-agit yan, mahirap na. Okay, so dapat decreased level of noise, decreased level of lighting, ganyan. Okay, so private room, 89, letter apple. Ayaw mo na madidistract siya. Okay, so 89, that's apple. 89, that's letter apple. One more. 89, that's apple. Number 90, the labor and delivery room nurse has just received reports on 4 clients. Wow, puro prioritization ng client. Asan daw dito yung kailangan nating assess first? Okay? So again, kapag po magpa-prioritize tayo, lagi nating iisipin, sino dito yung may pinakamataas na risk of complication or harm kapag hindi ko inuna? Okay, that's letter dog, a client who has just received an IV loading dose of magnesium sulfate to stop the preterm labor. Okay, to stop the preterm labor. Bakit? Anong meron sa magnesium sulfate or magsul? Ano to? CNS depressant, very, very, very good. Ano pa yung mga possible adverse effects niyan, toxicity effects niyan? Pwede ka magkaroon ng depressed respiratory rate or respiratory depression. Ano pa? Severe hypotension even. Ano pa? Absent deep tendon reflexes. Mahirap kasi kapag late mo na siya makatch. Right? So 90 letter dog tayo. Yan yung acronym natin, burp. Okay? Number 90, that's dog. 90 letter dog. Sa pa, 90, that's letter dog. Number 91, the nurse managers involve all staff members in the development of goals and decision-making. Which leadership style has the unit manager exercise? Galing, no? Tumawid na agad. Palmer concept na ulit. So 91, that's letter boy, democratic. Okay, democratic. Ito lang yung mga keywords. Huwag tayong lumayo sa mga powerful keywords natin. Yun yung mga magsasalba sa atin. Okay, so 91, that's letter boy, democratic. Okay, number 92, the nurse manager is discussing the facility protocol in the event of a tornado with the staff. Actually, naulit na ulit ito at buti na lang alam natin yung sagot. That's B, C, and dog. Okay, that's B, C, and letter dog. Okay. Ay, sorry. May question pala. Saan nga po ulit yon? Okay. So, isa-isahin natin yung burp para masaya. Ayan. BURP. BP is decreased. Sa hypotension yon, right? The urine output is decreased as well. Okay? The urine output is decreased as well. Okay, you have your respiratory rate that is decreased as well. So respirate decreased. Okay, yung letter P, patellar reflex is absent. Yan yung burp. Ayan. So that's the burp. Okay. Refresh lang natin. BURP. Carry. Carry na. Okay tayo dyan. 90, that's dog. 91, boy. 92, BC, dog. 93, that's democratic, letter C. Bakit? Anong keyword natin? Empowering the staff to achieve excellence. Ganun. 93, that's cat. 94, nurse educator presents an in-service training session on case management. What is the characteristic of case management? So babalikan lang natin yung description yan. That's letter boy, promotes appropriate use of hospital personnel because when we are doing this case management, let me highlight this for you, gusto natin i-maximize yung pagiging involved ng iba't ibang healthcare staff sa patient. Okay, so 94, letter boy. Okay, number 94, that's letter boy. 94, that's boy. 95, the staff members working at the trauma center have characterized their nurse manager as task-oriented and directive. Yun na yun. Okay, so task-oriented, directive, it talks about your autocratic kind of leadership. Okay, so 95, that's letter apple. 95, that's letter apple. Okay, kapag autocratic, gusto ni leader siya lahat magde-decide. Okay, kapag laissez-faire naman, usually kapag independent naman yung workers mo or yung colleague mo, pwedeng sila na yung magde-decide on their own. Okay, yung decision making nasa staff. Kapag democratic naman, that's a shared decision making. Okay, so 95, that's apple. 96. Home health nurse develops a plan of care for the client. Which actions should the nurse include in the plan? As a case manager, that's apple. Organize, manage, and balance healthcare services needed for the client. Okay, so 96, that's apple. 96, that's letter apple. Again, 96, that's apple. 97, the RN is planning the client assignments for the day. What is the most appropriate assignment? Ito na naman tayo. Assistive personnel, that's letter boy. Client requires assistance with ambulation every 4 hours. Okay, so 97, that's boy. Okay, number 97, that's letter boy. Number 97, that's letter boy. Number 98, the nurse is planning the assignments for a group of clients and has a LPN and assistive personnel on the nursing team. Asan dito, yung pwede nating ibigay sa LPN, that's letter dog, emphysema receiving oxygen 2 liters per minute and becomes dystic on exertion. Okay, ito kasing letter apple and boy, ibibigay natin to sa RN. Okay, RN yan. Ang letter C, this one, assistive personnel. Wala na tayong kayang maisagot. Okay, letter dog na lang for the LPN. Okay, and appropriate din naman sa kanya yan. Okay, kaya niyang i-handle yan. 98, that's dog. Okay, number 98, that's letter dog. Okay, the number 99 question, RN, planning client assignments and cannot take a client assignment today. So, i-highlight ko po ito, hindi po pwedeng humawak si RN. So, lahat ng mababasa niya sa choices, paghahatian yan no AP tsaka no LPN. Asan daw dito yung pwedeng i-handle no LPN, which is a higher, di ba? Higher responsibility than your AP. That's letter boy, client scheduled for cardiac catheterization. Okay, 99, that's boy. Technically, sana si RN. Okay, eh hindi nga siya po pwede. So si LPN na yung next na pwede. So 99, that's boy. Okay, number 99, that's letter boy. Again, number 99 is boy. Number 100, the RN has provided instructions to a licensed practical nurse regarding administration of enemas. Okay, sabi daw, nakatatlong beses na daw siya nung pag-administer ni enema, pero the returns is still not clear. What is the most appropriate thing to do? Letter boy, stop administering the enemas. Okay, and then you would want to assess further. Baka naman kasi nag-fluid overload na pala tong si patient. 3 beses na. Okay, so 100 letter boy. Okay, 100, that's letter boy. Questions. Of course, I'll give you your break. Okay, 5 minutes break ulit. 5 minutes break. Okay. Ay, sorry, 97, that's boy. Then 98, that's dog. '99 is boy. Okay. Walang lumabas na LPN questions during our boards. Baka pine-prepare kayo nung set of questions na to for the NCLEX. After NLE, NCLEX agad. Okay, thank you guys. Break muna tayo. Meron ako nabasa na in some states daw, pwede mag-delegate yung LPN sa mga assistive personnels. Pero in some state, hindi po pwede, RN lang. So, case-to-case basis talaga siya kung nasaang state ka daw sa US. Okay? May technique po ba sa pag-transfer ng answer from the questionnaire to Scantron? Like every 10th number bar, every after question, shade agad, or isahang transfer after the last number. Pinaka hindi ko recommend yung isahang transfer. Sorry naman, sorry po. Okay, yung isahang transfer lang. Okay, pero I would highly recommend, I think, every 10th number. Okay, every 10 items, mag-shade, magta-transfer tayo. Okay, ayan. Ganon din naman yung ginawa ko. Correct, yes, correct. Ganon din yung ginawa ko, every 10th item. All right, so thank you very much for reaching NP5 Recalls 11. Okay, sana marami kayo natututunan at hindi puro kaartehan ang nakukuha niyo sa akin, guys. So, ganun pa rin. If we have any concerns, okay, I'll do my best to answer it. Okay, if you feel that we're going too fast, pakisabihan niyo po ako. Okay, baka anytime pumasok ulit si Dr. Carl Balita, pakisabi welcome naman po siya, pati yung mga iba nating special guests kanina. Okay, so now, NP5 na po tayo. We'll start with number 1. Relatively easier lang din, okay, to understand yung mga questions. The home care nurse is visiting an older client whose spouse died 6 months ago. Which behaviors by the client indicates effective coping? Select all that apply. So obviously, that's everything except letter apple, neglecting personal grooming. Kasi, ano to, medyo depressed symptom ito, right? So hindi siya effective coping mechanism. Okay, so number 1, B, C, D, and letter E. A, B, C, D, and letter E. Paano mo masasabi na effective ang isang coping ng taong namatayan? Diba? Kapag decreased yung stress, pati yung anxiety level niyan. Okay? Kapag nakaka-proceed siya sa buhay niya, kapag hindi niya napapabayaan yung hygiene niya, yun yung mga effective coping techniques. So number 1, that's B, C, D, and letter E. Number 2, client with a diagnosis of depression has attempted suicide, says to the nurse, I should have died. I've always been a failure. Nothing ever goes right for me. Ano klaseng therapeutic communication yung kailangan natin? That's letter dog. You've been feeling like a failure for a while. Okay. Sinulat ko na rin dito kung anong klaseng therapeutic communication ba to. Restating po yan. Okay, so number 2, that's letter dog. Number 2, letter dog. When we restate the client statement, mas mapoprompt siya to explore more about the client's feelings. Okay, so 2, that's dog. 2, letter dog. Number 3, the nurse visits a client at home. The client states that I haven't slept at all the last couple of nights, which response by the nurse demonstrates therapeutic communication. Ganun pa rin. Letter C, you're having difficulty sleeping. Ganon. Restatement pa rin po ito. Restatement pa rin yan. Itong IC, nakakaloka naman yung IC na state. Wala na siya ibang masabi, IC na lang. Sana chinat mo na lang, no? Itong letter boy, really? Oh, medyo sarcastic yung really. Ayaw natin yan. Itong letter dog, sometimes I have trouble sleeping too. Hindi ka naman po tinatanong, nurse, okay? It takes the focus away from the patient. So, wag mo siyang agawan ng spotlight. Okay, so number 3, that's cat. Okay, number 3, that's letter cat. Okay, number 3, that's cat. Number 4, client experiencing disturbed thought processes believes that his food is being poisoned. Which communication technique should the nurse use to encourage the client to eat? That's letter apple, using open-ended questions and silence. Ganun. 4, that's apple. Very, very therapeutic. Okay, number 4, that's letter apple. For apple, number 5, the nurse should plan which goals of the termination stage of group development. As we know, we have these different stages of group development. Okay, you have your initial stage, that's number 1, your working stage, and of course, your termination stage. Bawat taong dumadaan sa buhay natin, okay, eventually, it's only a matter of time for them to leave us eventually. Okay, so nasa termination stage po tayo dyan. Number 5, letter apple and letter F. Hindi naman forever kasama natin yung patients. Okay, maghihiwalay din tayo. Okay, so number 5, apple at F. Okay, number 5, that's apple and letter F. 5, apple and F. Again, 5, that's apple and letter F. Sana hindi ko na kayo ma-meet, okay, sa next season ng top rank kasi may mga sarili-sarili na po kayong lisensya at naka-move on na po kayo sa mga buhay-buhay ninyo. At kung ma-meet ko man kayo dito sa top rank, sana ay part na rin kayo ng research team para kayo na rin yung awayan ng mga students afterwards. Okay, samahan nyo kami dito. Okay, masaya dito. Okay, so number 5, that's apple and letter F. Of course, I'll pray for you. Okay. Number 5, that's apple and F. Ano bang gusto mong dasal ang kailangan mo? Okay, that's 5, A and F. Number 6. Alright. So, sa mga dito naman na gustong mag-pursue ng career outside the Philippines, full support din naman po ako sa inyo. I mean, who am I, di ba, to prevent you from leaving? If you want to leave, carry lang. Okay, baka nandun talaga yung future nyo. Okay, so number 6, a client diagnosed with terminal cancer says to the nurse, I'm going to die, and I wish my family would stop hoping for a cure. I get so angry when they carry on like this, di ba? With feelings, with emotion, ganon. After all, I'm the one who's dying. Alam nyo ba guys, if you want to pursue the career or having a career at the bedside, it's a very, very fulfilling job for me. As in, kapag, alam mo yung feeling na kapag the word is too noisy, alam mo yung willing ako mag 16 hours sa duty para lang magstay sa bedside. Ganun siya ka-therapeutic for me. I love being at the bedside. Okay, and if you plan to be at the bedside in the future, okay, hindi po malabong mangyari na makamit ka ng isang tao that would tell you these exact statements. Okay, I want to die already. Why can't they just let me? Okay, and with that, alam mo na unusual response yon because basically when you're at the hospital, we're there to be treated. Okay, and to be cared for. Tapos ito yung ma-receive mong statement. Ano yung next mong gagawin? You have to explore that statement kung bakit. Okay, so number 6, that's letter C. You're feeling angry that your family continues to hope for you to be cured. Okay, para lang mas ma-explore mo yung feelings niya. Okay, so number 6, that's letter C. Okay, so number 6, that's letter cat. 6 is letter cat. Iba yung mundo ng bedside, guys. Full support din ako kung gusto niyo mag-bedside. Okay, so number 6, that's letter C. Do your best. Okay, NP5 na po tayo. Opo, NP5 na po ito. On review of the client's record, the nurse notes that the admission was voluntary, and based on this information, the nurse plans care anticipating which client behavior. Again, kapag voluntary yung admission natin, syempre, na-expect mo na magpa-participate siya sa mga gusto nating ipagawa sa kanya. Asan dyan yun? Letter dog. Okay, willingness to participate in planning the care. Okay, itong letter apple and boy, ito ay involuntary yan. Okay, itong letter C, just because you voluntarily admitted yourself doesn't mean na meron ka agad na understanding. So yung gaining ng insight natin, medyo matagal pa yan. Okay, hindi yan sa admission day mismo. So number 7, that's dog. Number 7 po, that's letter dog. One more, number 7, that's letter dog. Number 8, when reviewing the admission assessment, the nurse notes that the client was admitted to the mental health unit involuntarily naman. Okay, so binaligtad lang yung situation, and based on this type of admission, the nurse should provide which intervention for this client. And as we know, okay, sino ba yung mga tao na involuntarily admitted karaniwan? Di ba sila po yung merong possible danger not only to self, but with the other people around them. So all the more that we would want to monitor them closely, okay, for any harm possible. So number 8, that's apple. Okay, so number 8, that's letter apple. Okay. Yun yung mga common reasons kung bakit involuntarily admitted sila. Kasi danger to self and others. Okay, so number 8, that's apple. 8 is letter apple. Number 9, when a client is admitted to an inpatient mental health unit with a diagnosis of anorexia nervosa, a cognitive behavioral approach is used as part of the treatment plan. The nurse plans care based on which purpose of this approach. And let me highlight these words for you. Cognitive behavioral approach. Okay, dyan iikot yung sagot mo. Ano bang ibig sabihin yan? Siyempre, i-tweak natin, i-shift natin yung perspective ng tao, okay? And eventually, pati po yung behavior niya, mapabago na rin natin. That's letter dog, helping the client to examine dysfunctional thoughts and beliefs. Okay, so number 8, that's letter dog. Okay, so number 8, that's letter dog. Sa unang basa ng choices, parang lahat sila tama. 'Di ba? Medyo tempting na isagot sila pero kasi cognitive behavioral approach yung focus natin. Okay, so number 9, that's dog. 9 is letter dog. Number 10, client is preparing to attend a gambler's anonymous meeting for the first time. The nurse should tell the client that which is the first step in this 12-step program. Again, hindi naman expected for you to memorize this 12-step program na to. Pero sana po, kahit yung first step lang, alam natin. And that is the patient admitting na wala po siyang control and power over the alcohol. Or yung kung ano man yung addiction niya. Sa kanya kasi gambling. So wala daw siyang power over the gambling behavior. Okay, so number 10, that's Apple. Admitting to having a problem. Okay, admitting to having a problem. Usually, di ba, yung defense mechanism nila commonly denial. So once you admit the presence of a problem, medyo you're one step ahead. Okay, doon sa proseso. Okay, so 10, that's Apple. Number 10, that's letter Apple. Again, number 10, that's Apple. One more. 10 is Apple. Number 11, the nurse in the mental health unit plans to use which therapeutic communication techniques when communicating with a client. Select all that apply. So with the back to the rescue, andun po yung mga theracom natin. That's Apple restating, letter boy active listening, letter dog maintaining neutral responses, and letter E providing acknowledgement and feedback. We never ever give advice or approve or disapprove. Non-therapeutic po ito. Ano pa, asking the client why. Diba? Ayaw natin to guys. Medyo kasi magi-invoke ng defensive state si patient kapag tinanong mo siya directly ng word na why. So 11, A, B, D, and E. Case 11A, B, D, and letter E. Number 12, what is the most appropriate nursing action to help manage a manic client who is monopolizing a group therapy session? So when you say monopolizing, siya na lang lagi nagsasalita. Okay, wala ba kami dito? Di ba? So para may iba pa, give chance to others naman. So number 12, that's dog. Thank the client for the input, of course, to acknowledge the manic patient, but inform the client that others now need a chance to contribute. Okay, so 12, that's dog. 12, that's letter dog. Isa pa. Number 12 is dog. Number 13, client is participating in a therapy group and focuses on viewing all team members as equally important in helping the clients meet their goals. The nurse is implementing which therapeutic approach? That's letter Apple, milieu therapy. Okay, so that's milieu therapy. 13, letter Apple. Okay. Very important yung role ng mga team members natin if we want to have this milieu therapy. Okay, so 13, that's Apple. Which one? Ito po, you want to answer letter Apple. Number 12, ask the client to leave the group for this session only. Ay, ang lungkot, pinalabas. Hindi naman necessary. Okay, nai-outcast natin siya. Okay, letter dog. Okay, tell the client, okay, to stop monopolizing in a firm but compassionate manner. Okay, so although it could be a direct response, okay, yung gusto kasi nating hanapin na option, dapat more specific, okay, at the same time, it would provide a direction for the manic client on what to do. Okay, so inform the client na yung iba naman. Okay, so number 12, letter dog. Okay, this one is not enough kasi. Okay, mas gusto nating isagot yung letter dog. Okay. Number 12, that's letter dog. And at the same time, yes, acknowledge the client. 13, that's Apple. 14, the nurse is working with a client who, despite making a heroic effort, unable to rescue a neighbor trapped in a house fire. Ay, okay. So baka nagkaroon siya ng PTSD. Next one, which client-focused action should the nurse engaged during the working phase? That's letter dog. Okay. Inquiring about the client's feelings for any that may block adaptive coping. Okay, so 14, letter boy. Dog rather. 'Di ba kapag working phase, ito na po yung opportunity mo para i-dissect yung feelings ni patient. Okay, so 14, letter dog. 14, letter dog. Para team kayo, okay, to manage this crisis. Exploring the client's potential for self-harm. Okay, because ang gusto natin dito isagot is or i-highlight is during the working phase of the nurse-client relationship. Okay, yung feelings niya about this situation. Okay? Wala rin naman siyang mga possible cue para masabi natin na magsi-self-harm siya. So 14, that's dog pa rin. Okay? 14, that's letter dog. 15, federal guards were sent to kill me. Delusional na si patient. That's letter C. Do you feel afraid that people are trying to hurt you? So kapag ganito, na delusional si patient, wag mo na i-feed. Lalo yung delusions niya. So wag tong letter dog. Wag mo na i-explore further. Okay? At wag mo rin sasabihin itong letter boy. The guards are not out to kill you. Okay? Kasi parang sinang-ayunan mo na merong mga guards na present talaga. So magpo-focus po tayo lalo sa feelings ni patient about that particular delusion. So 15 letters C. Okay? 15, that's letter C. Again, 15, that's cat. Number 15, letter cat. Number 16, client diagnosed with delirium, becomes disoriented and confused at night. Which intervention should the nurse implement initially? Okay, initially. Okay, tapos i-highlight natin tong delirium, disoriented, tapos confused pa. Pakipatay po muna nung TV. Okay? Kasi baka mas ma-feed natin yung disorientation at baka mas lalong ma-confused si patient. Okay? So instead, yung light source, wag mo kunin sa TV. Okay, sa iba. Okay, so 16, that's letter boy. Okay, 16, it's letter boy. Baka mapaghalo niya yung naririnig niya sa TV, pati yung reality. Right? So 16, that's boy. 16, letter boy. Okay. It could be necessary yung letter apple, pero hindi siya yung initial action na gagawin natin. TV muna. Okay, so 16, that's boy. 17, client is admitted to the mental health unit with a diagnosis of depression. Play soft music during the night and maintain a well-lit well-lit room. Okay, pwede. Pero kasi letter boy pa rin yung tamang sagot. Okay? Letter boy pa rin tayo. Kasi nga, ang focus natin is sa patient having confusion and disorientation. Baka nga mapaghalo niya yung noise, okay, sa TV, okay, tapos hindi rin magandang gamiting light source yung TV. Okay, so 16, that's boy. Again, just because hindi natin pinili yung isang option doesn't mean na sobrang mali siya. It's just that meron tayong mas priority answer. Okay, so 16, that's boy. 16, letter boy. Number 17, diagnosis of depression. The nurse should develop a plan of care, which includes what? Letter dog, structured program of activities in which the client can participate. Okay. Ang usual presenting symptoms ng patient natin with depression, number 1, they're often withdrawn. Ayaw nilang kumausap ng ibang tao. Okay, medyo wala silang interest or pleasure to do other activities. They have this low energy, meron silang laging fatigue, laging pagod, ganyan. Okay, but just because, okay, they feel those kinds of symptoms doesn't mean na hahayaan na lang natin siyang masadlak sa kalungkutan ng buhay. Okay, mag-prepare ka pa rin ng structured program of activities so that whether or not pumayag siya, nasasali siya, at least naka-prepare na. Right? 17, letter dog. That's of course, encourage the client to join. Okay, so 17, that's dog. 17, letter dog. One more. Number 17, letter dog. Number 18, when planning the discharge of a client with chronic anxiety, which is the most appropriate maintenance goal. Okay, chronic anxiety. As we know, we can never eliminate the anxiety in our lives. So, una po nating buburahin sa paningin yung merong absolute word such as eliminate all anxiety. Okay, next one is meron siyang chronic anxiety. Gusto mo lang siyang laging nasa maintenance goal. Okay, ayaw mong nati-trigger yung anxiety na yon. At para hindi mo siya matrigger, alamin mo ano ba yung triggers. Right, so 18, that's boy. Okay, so 18, it's letter boy. 18, it's letter boy. When you suppress, hindi natin ma-resolve yung anxiety na yan. Okay, so 18, that's boy. Number 19, client who is unwilling to go. Okay. A client is unwilling to go to his church because his ex-girlfriend goes there and he feels that she will laugh at him if she sees him. Ay, ibang klase. May drama. Okay. And because of this, the client remains homebound. The home care nurse develops a plan of care that addresses which personality disorder. Okay. So, ang dami nating cues na pwedeng makuha. Pero ito yung gusto kong i-highlight. Avoidant personality. Okay. So, 19, that's Apple. Okay, 19, Apple. Meron silang social withdrawal at the same time, grabe yung sensitivity nila to potential rejection. Sobrang more hurt sila times 10,000 times. Okay? Kapag na-reject yung tao na yon. So 19, that's Apple. 19, that's letter Apple. Okay, 19, that's letter Apple. Okay na ba tayo sa mga personality disorders? So ito naman pong borderline, ano yung pwede nating keyword dito? Unstable po yung mood nila. Okay, ano pa? Unpredictable yung behavior. Unpredictable behavior. Kapag naman schizotypal, sila naman po yung mga meron abnormal thoughts, abnormal speech and behaviors, mga ganyan. Okay, kapag OC naman, OCPD, which is different from OCD itself. Okay, ito naman po yung mga perfectionist. Okay, ano pa? Napakataas ng urge na mag-micromanage ng ibang tao. They have this need to control other people. Ano pa? Sila yung mga workaholic. Ibang klase yung devotion nila sa trabaho. Devotion to work. Okay, na may mga keywords na. Okay, so 19, that's Apple. 19, it's letter Apple. One more, 19 is Apple. Number 20, the nurse is conducting a group therapy session. During the session, a client diagnosed with mania consistently disrupts the group's interactions. Which intervention should the nurse initially implement? That's letter Apple, setting limits on the client's behavior. Okay, mania consistently disrupt. So, hindi na po pwede yun. Okay, so 20 Apple tayo. Okay, 20 letter Apple. Okay pa ba tayo, guys? Are you still with me? Carry lang ba? Nag-zone out na yung iba. Konting-konti na lang. Okay, last 80 items. Okay, mabilis na lang to. Mabilis na lang to. GCS 3 na po. Wag naman. Okay, wag naman. Okay. So, kayanin natin. Kapit-kapit po tayo. Okay. Sige. Breakdown ng 2 hours. Ayoko po masabunutan ng mga classmates ninyo pag nagpa-break pa ako ng 2 hours. Okay, so carry pa po. Proceed lang. Proceed ka lang dyan, ma'am. We're here. Sayaw. Ba't niyo ba ako pinasasayaw at pinakakanta? Okay. Masisira nga po yung kredibilidad ko, guys. Wag na po. Hindi niyo po gugustuhin na makakita na isang JD Rojas na sumasayaw at kumakanta. It's not my specialty. Wow. It's not my specialty. Nakakaloka. So 20, that's Apple. Okay, 20, letter Apple. All right, next one. 21. Surf tayo, guys. Okay, pag pumasa kayo, magpapa-beach party tayo. Okay, 21, client admitted to a medical surgical unit with a diagnosis of acute blindness after being involved in a hit-and-run accident. Okay, so medyo kita-kita moment ito. Okay, so acute blindness ito. And wala daw reason kung bakit siya hindi makakakita. Okay, so that's an exact description of your conversion disorder. Okay, so 21, letter C, possibly through the trauma. Okay, so 21, that's cat. 21, that's letter cat. Again, 21, that's cat. Number 22, which nursing intervention are more appropriate for a hospitalized client with mania who is exhibiting manipulative behavior? Ito naman, okay, may master's degree na kayo kapag manipulative behavior yung pinag-uusapan. Since day 1, alam niyo na to. Okay, so 22, that's Apple. Communicate expected behaviors. Letter C, assist the client in identifying ways of setting limits. Letter dog, follow through. And letter F, have the client state the consequences. Okay, so if you have a patient na mayroong manipulative behavior, dapat malinaw sa inyong dalawa. Okay, ako as a nurse and you as a patient, na you have your responsibility towards your own actions. Okay, so 22, that's A, C, D, and F. Okay, 22, A, C, D, and letter F. One more. 22, A, C, D, F. 23, the nurse observes that a client is pacing, agitated, and presenting aggressive gestures. What is your priority of care? Okay, pag yan na nag-escalate, okay, ubos tayong lahat dito. So 23 letter apple, provide safety pa rin. Okay, so 23, that's apple. Damay-damay na to, ganun. Okay, so 23, that's apple. 23 apple, 24, the nurse is preparing a client with schizophrenia with a history of command hallucinations. Okay, alam natin na ito yung pinaka-dangerous kind of hallucination. Okay, what is or which of these statements indicate that a client has a need for additional information? So, yung mali, yung hahanapin natin, highlight mo yan, tas negative sign ka dyan. It's letter C, when I have command hallucinations, I'll call a friend for help. Okay, medyo tamang pakinggan, tas binasa mo ulit, I'll call a friend for help. Diba? Bakit si friend? Okay, dapat nurse ang tinatawag. Wag ako. Okay, baka wala ako doon. Okay, so 24 letter cat. Okay, so 24, that's letter cat. 24, that's letter cat. One more, 24, that's cat. 25, the nurse is caring for a client. Okay, just admitted to the mental health unit, diagnosed with catatonic stupor. So iba rin naman yung features ng patients with catatonia. Okay, ayaw nilang gumalaw, immobile sila. At the same time, mute din, ayaw nilang magsalita. Okay, but that doesn't mean na wala na tayong pwedeng gawin with these kinds of patients. Okay, letter C, offer yourself, sit beside the patient in silence with simple open-ended questions. Malay mo sumagot. Right, so 25, that's cat. Okay, so 25, letter cat. Again, number 25, that's cat. Number 26, the nurse is caring for a client diagnosed with paranoid personality disorder who is experiencing disturbed thought processes. Okay, so what is the best intervention? Whispering. Okay, so 26, letter boy. Avoid a whisper voice in front of the client. Okay, so 26, that's letter boy. Alam na alamin na rin yan, guys. Suking-suki po sa mga tanungan, yung paranoid personalities. 27, the nurse is planning activities for a client with bipolar disorder with aggressive social behavior. So ito yung highlight ng question at hindi yung actual bipolar disorder niya. Okay, asan daw dito yung pinaka-appropriate? That's letter B, writing. Okay, letter B, writing. So sana solitary activities, okay, productive activities. Okay, so 27, that's boy. Avoid the competition or yung element ng competitiveness. Okay, so 27, that's boy. 28, the home health nurse visits a client at home and determines that the client is dependent on drugs. Okay. So letter boy, ask the client about the amount of drug use and its effect. Okay, so 28, that's letter boy. Of course, the way you should elicit this information, dapat non-judgmental and direct as possible then. So 28, that's boy. Okay, 28, that's letter boy. The rest of the choices, judgmental yung mga yan. Itong letter dog, do not ask any questions. Passive approach naman to. Ayaw natin yan. 28, that's boy. 28, boy. 29. Which interventions are most appropriate for patients with alcohol withdrawal? So like all that applies. Sa Apple, monitor vital signs, provide safe environment, address the hallucinations, and provide reality orientation. Kasi di ba, yung ibang patients na mayroong alcohol withdrawal symptoms ay nag-hallucinate din. Minsan yung iba may delusions din. Okay? So itong letter dog, provide stimulation, baligtad. Okay, decrease dapat. Maintain NPO status. Okay, hindi natin to gagawin kasi sila ay nangangailangan din, okay, ng maintenance ng adequate caloric intake. So, hindi natin yan ipapa-fasting. Okay, so 29, that's A, B, C, and letter E. Okay, so 29, that's A, B, C, and letter E. Okay, so number 30, the nurse determines that the wife of an alcoholic client is benefiting from attending an Al-Anon group if the nurse hears the wife make which statement. So here naman, kapag Al-Anon group ang pinag-uusapan, ano yung klaseng support group members meron tayo? Yung mga family members na merong addiction. Okay, kunwari yung asawa, okay, the wife, yung husband na may addiction. Okay, enroll natin sila sa ganitong klaseng support group because yung mga ganitong family members, sometimes they tend to feel, okay, na sila po yung responsible kung bakit nagkakaganon yung family member nila. Okay, so 30 letter apple, I no longer feel that I deserve the beatings my husband inflicts on me. Okay, so 30 letter apple. Okay, hindi po sa kanila yung blame. At kailangan din nilang ma-assure na nag-gets nila yon. Okay, so 30, that's letter apple. 30 apple. Again, 30 letter apple. 31. Diyos ko, ang hahaba ng mga tanong. Nakakaloka. I'm leaving now. I have to go. I don't want any more treatment. At nag-aalsa balutan na siya for real. Ready na siya to walk away. Okay, so tawagin mo pa rin yung direct supervisor mo, si nursing supervisor. Okay, 31, that's apple. Okay, actually, yung technical answer natin dito, dapat si doktor yung tinatawag kasi nga naman, siya yung may responsibility na magpasign no home against medical advice. Okay, so 31, that's letter apple. Okay, so 31, that's letter apple, call the nursing supervisor. Number 32, wag security. Okay, the nurse is preparing to perform an admission assessment of a client diagnosed with bulimia nervosa. Okay, asa dito yung makikita natin sa kanila. Okay, just because na merong bulimia ang isang pasyente, it doesn't necessarily mean, okay, na meron din siyang anorexia nervosa as well. Okay, pero yung ibang anorexic patients natin, may bulimia rin. Okay, so not the other way around. At bakit sila nagkakaroon ng dental decay, loss of tooth enamel, pati electrolyte imbalances because of the induced vomiting. So 32, that's A, C, and dog. The purging, correct. Okay, 32, that's A, C, and letter dog. Yes, oo, true, meron talagang ibang mga questions na napakahahaba. As in, kasi binibuild up nila yung question. Okay? So 32, apple, cat, and dog. Pasensya. Okay? Yung key doon. Okay? Yung sikreto doon. Patience is the key talaga. 32, that's apple, cat, and dog. 33, the nurse is caring for a female client who was admitted to the mental health unit recently for anorexia. What is the most appropriate thing to do kapag nakita mo daw po siyang nag-engage sa rigorous push-ups? Ayan na si Queen Yasmin. Okay, nagpakita na siya. Okay, so 33, that's letter boy. Interrupt the client and offer to take her for a walk. Okay, kasi nasasayang yung caloric intake na pinapasok natin sa katawan niya. And as we know, ang walking, therapeutic yan in its essence. So 33, that's boy. Okay, 33, that's letter boy. Okay, 33, that's letter boy. We do not want to allow. Kasi tingnan mo yung word na ginamit, rigorous rather. Okay, so kapag nakita mo yung words na rigorous, excessive, or vigorous, mga ganyan, okay, medyo red flag yun. Ayaw nating isagot yan. Okay? So we do not allow to complete the exercise program, especially kapag ganito. Okay, so paglakarin natin, 33, that's boy. 33, that's letter boy. Again, 33, that's letter boy. 34, a client with diagnosis of anorexia nervosa is in a 2-bedroom. Sino daw yung pwede niya maging roomie? Okay, so paano natin ito sasagutan? Elimination method. So pneumonia, of course, number 1 nating tatanggalin kasi baka mahawa naman yung patients natin with anorexia. Okay? A client who thrives on managing others. Okay? At hinalo mo siya sa pasyenteng may anorexia. Kaya iba, medyo specialized yung treatment natin dito sa patient natin with anorexia. So baka lang pakialaman niya, ayaw natin yan. Client who could benefit from the client's assistance at mealtime. No, hindi rin yan. So, letter boy tayo, client undergoing diagnostic tests. Okay, so 34, letter boy. Okay. 34, that's letter boy. Kapag kasi pinili mo to, who could benefit from the client's assistance at mealtime, parang sinama niya yung patient with anorexia doon sa mealtime niya, edi sino nag-suffer? Edi yung anorexic patient. Okay, so 34, ayaw natin yan, letter boy. 34 boy, 35. Diagnosis is assessing a client who was admitted 24 hours ago for a fractured humerus for potential alcohol withdrawal delirium. Okay. That's letter dog, hypertension, changes in LOC, and hallucinations. Okay, so 35, that's letter dog. Medyo ibang level ng presenting symptoms natin kapag may alcohol withdrawal delirium symptoms. Okay, aside from this one, the patient could also have these agitated episodes. Pwede siyang magkaroon ng delusions as well. Okay, fever, pwede rin. Ano pa ba? Anorexia, anxiety, insomnia, mga ganyan. So 35, that's letter dog. Okay, 35, that's dog. 35, that's letter dog. Number 36, the spouse of a client admitted to the mental health unit for alcohol withdrawal says to the nurse, I should get out of this bad situation. Okay, bakit? Diba? So explore more. 36, that's boy. What do you find difficult about the situation? Okay, so that together kayo magsisolve ng problems niya. Okay, 36, that's boy. Okay, 36, that's letter boy. Very, very ekis. Itong cat and dog. We do not want to give opinions and advice. Okay, and approvals. Itong letter apple, pinasa mo siya sa ibang tao. Wag ganon. Okay, so 36, that's boy. 36 boy, 37. A client with anorexia nervosa is a member of pre-discharge support group. Ano, pagkahaba-haba na naman. Okay, so this one, the group members have brought some used clothes to replace the client's old clothes. Pero ang gusto kong i-highlight dito is that masyado na daw masikip and it has to be reduced to 800 calories daily na lang. So that's obviously letter boy, evidence of the client's disturbed body image. Ito yung pinaka-basic issue niya, basic problem niya, disturbed body image. 37, that's letter boy. Okay, so 37, that's letter boy. Again, 37 is boy. 38, the nurse observes that a client with a potential for violence is agitated, pacing up and down the hallway and making aggressive and belligerent gestures at other clients. Which statement would be most appropriate to make? Okay, classic question dito. Ilang beses na natin to na-encounter. Letter C, you seem restless. Tell me what is happening. Okay, so making observations, tapos encouraging verbalization. 38, letter C. Okay, 38, letter C. Letter A daw po, you need to stop that behavior now. Huh? Diba? Sinabi mo yun kay patient. Napaka-demanding nung tone niya. Right? Kapag sinabi mo to, mas magi-increase yung agitation niya. So, X po ito. Okay? Itong letter boy and letter dog, yes, it's not therapeutic, correct? Medyo gumamit ka ng threatening words dito sa boy and dog. Ayaw din natin ito. Inappropriate yan. Okay? So, 38, that's cat. 38, that's cat. Okay, 38, that's letter cat. 39, the nurse is reviewing the assessment data of a client admitted to the mental health unit. Okay, this one naman is about your situational crisis. So anong klase daw ng mga examples natin for situational crisis? Before we go to the choices, i-describe muna natin. Diba kapag sinabi mong situational crisis, yung source ng stress ay externally found, hindi siya internal sources. Okay, so for example, natanggal ka sa trabaho mo, or nagbago ka ng trabaho, ano pa, namatayan ka ng loved one, that's letter boy. What else? If you underwent this abortion, okay, kapag nagbago yung financial status mo, kapag nag-divorce kayo, okay, ng partner mo, kapag nagkaroon kayo ng additional family members, mga ganyan, pregnancy even, ano pa ba, ang presence of severe illness, yung mga situational crisis. Okay, ito pong letter apple, letter cat, and letter dog is a very much perfect example of what you call your adventitious crisis. Okay? So kapag sinabi mo namang adventitious crisis, pwedeng from a natural disaster, okay, yung mga floods, typhoons, earthquakes, pwede rin naman po yung mga national disaster. Dito lalabas yung mga war, riots, mga ganyan. Okay, and of course, yung mga violent crimes natin, murder, rape, assault. Okay, so 39, that's boy. Situational crisis. Okay, so 39, that's letter boy. 39, that's letter boy. Yes. Number 40. Gusto ko yung may sarili-sarili kayong mga keywords. Okay yan, guys. Okay yan. Basta alam niyo sa sarili niyo na with using those keywords, mas natatandaan niyo siya ng mabilis. Okay tayo dyan. So 40. The nurse is conducting initial assessment of a client in crisis. Okay, when assessing the client's perception of the precipitating event that led to the crisis, what is the most appropriate question? That's letter C. What leads you to seek help now? Okay, so 40, that's cat. Okay, 40, that's letter cat. Itong letter apple and boy, itatanong mo to kung gusto mong i-assess yung support system ni patient. Itong letter dog, ito naman yung personal coping skills assessment niya. Okay, so 40, perception ng event, letter C. Correct. Okay, so 40, that's letter cat. 40, that's cat. 41, the nurse is creating a plan of care for a client in a crisis state. When developing the plan, the nurse should consider which factor. Again, textbook lang po ito. Okay, so 41, letter dog. Client's response to a crisis is individualized. I-describe mo lang siya. Okay, so 41, that's dog. 41, that's letter dog. Again, 41, that's dog. 42, the nurse in the ED is caring for a young female victim of sexual assault. The physical assessment is complete. Physical evidence has been collected. Pero upon further assessment, the client is withdrawn, distracted, tremulous, and bewildered at times. Of course, this is very, very much expected after you were sexually assaulted. So letter boy, reactions to a devastating event. I-expected natin yan. So 42, that's boy. 42, letter boy. One more. 42, that's letter boy. Number 43. The press client on an inpatient unit says to the nurse, my family would be better off without me. Yun na yun. Okay, nagpaparamdam na siya. That's dog. You sound very upset. Are you thinking of hurting yourself? Okay, so kapag may potential for suicide patients tayo as much as possible as direct and confrontational. Okay, so 43, that's dog. 43, that's letter dog. Okay, 43 is dog. 44, the nurse has been closely observing a client who has been displaying aggressive behaviors. Okay, if it is escalating, what could you do? That's boy, cat, and dog. Acknowledge the client's behavior. Assist the client to an area that is quiet. Okay, and letter dog. Maintain a safe distance from the client. 44, letter boy, cat, and dog. Okay. Sorry, meron ako hinahanap na term. Okay, yung mga psych nurses, ano yung correct term doon? Nasa dulo ng dila ko. Kapag nag-escalate yung aggressive behavior nila, okay, tino-talk down nila. Talk down approach. Yon, tino-talk down approach nila. And I've seen a lot of really, really good psych nurses in the ward who are so good in this talking down approach. Grabe. Wala lang. Iba rin kasi yung wonders kapag nakamit ka ng isang magaling na psych nurse. Okay, so 44, that's boy, cat, and dog. Okay, 44, that's boy, cat, and dog. Iba-iba lang din talaga tayo ng specialty, no? Ayan. So 40, that's boy, cat, and dog. Okay, 45. Which behavior observed by the nurse indicates a suspicion that a depressed adolescent client may be suicidal. Okay, may be suicidal. So certain moment. Okay, so 45 apple makes Sir-Ken proud. Okay, so that's letter apple. Kapag nagpapamigay na po siya ng mga favorite things niya, yun na yun. Baka sign na niya yun. Is 45, that's apple. 45, that's letter apple. Okay, pamana niya. Okay, 46, moderately depressed client. Sabi niya, uy, sobrang creepy nito. He began smiling and reporting that the crisis is over. And he tells the nurse, I'm finally cured. O yun na yun, guys. Medyo magi-internally panic ka ulit dito kasi suicidal siya, baka totohanin niya na this time. So 46, letter C. Okay, 46, that's letter C. 46, that's cat. Again, 46, that's letter cat. Number 47, the ED nurse is caring for an adult client who is a victim of family violence. Which priority information should be included in the discharge instruction? So let me highlight this phrase for you. Family violence. So this one, okay, gusto natin mag-promote ng tertiary prevention strategies. Okay. iiwasan na lang natin mangyari ulit. So letter apple, information regarding shelters. Okay, so 47, that's apple. Information regarding the shelters. You could also do your letter boy, but it's not a priority answer. Okay? So kapag kasi letter apple yung sinagot mo, medyo independent pa rin yung dating nung information na binigay mo. Okay, may control pa rin si patient sa situation. So 47, that's apple. Number 48, female victim of a sexual assault is being seen in the crisis center. Sabi niya daw sa'yo, as though the rape just happened yesterday, which is a very very valid statement to be received. Okay, so that would be letter C. Tell me more about the incident that causes you to feel like the rape just occurred. Okay, so 48, letter C. Okay, ayaw natin na nape-pent up lang, okay, nababottle up inside yung feelings niya. So the more na nailalabas niya yon, the more na magigain siya ng insight, magigets niya, okay, yung process, or not really process, but the actual crisis that happened to her. Okay, so 48, that's letter C. Okay, 48, that's letter C. It will take some time to get over these feelings about your rape. You could also segue say that. Segue say, okay? Pero kasi ang tinatanong sa atin is the most appropriate, okay, nursing response. So encourage verbalization of feelings. Okay, so 48, that's cat. Okay, 48, that's letter cat. Kasi kapag naka-receive ka ng ganitong cue, parang gusto pang mag-explore further or gusto pa niya mag-open up, so hayaan mo lang. Okay, 48, that's cat. 48, that's letter cat. Number 49, client admitted to the mental health unit after an attempted suicide by hanging. Okay, the nurse can best ensure the client's safety by which action? That's letter C. Who will remain with the client at all times? The staff member dapat, hindi yung kaibigan niya. So 49, that's cat. Okay, 49, that's letter cat. To ensure safety. Again, 49, that's letter cat. Admitting the client to a seclusion room. I think I've told you this before, right? Medyo iwas tayo in doing this intervention na seclusion room kasi merong ethical pati legal responsibilities when we're trying to resort to that kind of intervention. So dito pa rin tayo, client at all times. Kung meron klaseng choice na letter C, dito tayo sa C, over letter dog. Okay, over letter dog. The last resort mo yung dog. Okay, so 49, that's letter cat. Okay, 49, that's letter cat. Okay. Ano yung mga instances na pwedeng ilagay si patient sa seclusion room kapag destructive na yung behavior niya? Okay, overly aggressive. Okay. Pwede rin kapag mataas yung level of suicide precaution na gusto natin. Correct. Na gusto nating i-provide kay patient. Okay. Pero kasi specialized protocol or specialized intervention yung seclusion room, hindi natin siya masyadong ipaprioritize na isagot. 49 letters. Okay, 50. The maternity nurse is providing instructions to a new mother regarding the psychosocial development of the newborn infant. Okay, using the Erickson psychosocial development theory. Okay, ano daw yung gusto mo dito? Actually, I could consider two answers for this one. Okay, letter apple, pwede ko rin niyang i-consider, and letter C. Kasi ang pinaka-focus ng question is all about the infant, okay, having her trust towards his or her caregiver. Okay, so this one, the trust versus mistrust. Okay? Hindi po pwede yung letter boy. Anticipate all needs of the newborn infant because kapag in-anticipate mo lahat ng needs ng newborn infant, kahit may newborn pa yan, we have to allow the patient or the infant to have a control naman sa situation. Okay? Baka naman maging overdependent siya sa'yo. Okay? So hayaan mo siya mag-signal ng need, and letter C, you have to attend to that crying infant immediately para lang mas ma-promote natin yung trust because we are talking about the consistency here. Okay, so 50, that's apple and cat. Okay, 50, pwedeng apple, pwede rin cat yan. Basta infant yung patient natin, as much as possible, dapat i-attend immediately just to promote the trust. Okay. 51, which would be the highest expected growth and development occurrences at 9 months of age for an infant who has had appropriate growth. Okay, select all that apply. So i-highlight lang natin yung 9 months of age, and gusto ko lang i-remind kayo na kapag pedia patients po yung pinag-uusapan, okay, dapat malinaw sa'yo kung ilan yung edad niya, kung ilang taon siya, kasi different age ranges, iba-iba yung assessment, iba-iba rin yung intervention natin. That's D, E, and F. Should be able to say mama and dada, will pull up and stand, holding onto furniture, and will be able to pick up small pieces of wood. Okay, so 51, that's letter D, E, and F. Okay, 51, that's D, E, and F. So, itong letter dog, okay, avoid the newborn infant during the first 10 minutes of crying. Bakit? Anyway, we don't do this as much as possible. Okay, attend immediately. Wag mo siyang paghintayin. Mako-confuse siya. Magkakaroon siya ng trust issue sa'yo. Okay? Ayan. So 51, that's D, E, and letter F. Number 52, okay? Document the findings. Tinawad na, sagot agad. 52, that's letter boy. Okay, assesses the vital signs of a 12-month-old infant and notes that RR is 35 breaths per minute. Okay, so here, binigyan ka na naman, okay, na value. Kailangan mo munang malaman kung normal ba to or abnormal. And kapag infant yung patient natin, that's 20 to 40 breaths per minute. Okay, sa kanya 35, normal. So letter boy. Okay, so 52, that's letter boy. 52, that's letter boy. Okay, 52, that's letter boy. You may want to check out Pilitary for the reference ng mga developmental milestones. Okay. If meron ka rin nakitang Wong, okay, na reference, pwede rin siya. Comprehensive din yun. Okay, yun yung mga references natin pag pedia. Pilitary, tapos si Wong. Okay, 52, that's boy. 52, that's letter boy. 53, the nurse is monitoring 3-month-old infant. Hindi si Sir Wong. Hindi si Sir Wong. Okay. Yung author na Wong. Okay. For signs of increased ICP. On palpation of the fontanelles, the anterior fontanelle is soft and flat. Paki-document lang din. Okay. Paki-document lang din kasi expected natin yan. Kailan ba magko-close itong anterior fontanelle na to? Diba? That would be around 12 to 18 months of age. So, okay pa yan. Okay, so 53, that's boy. Uy, ang gagaling. In fairness, I'm so proud of you. 50, that's boy. 50, that's letter boy. Number 53, that's boy, sorry. Okay, 54. Select all that apply for the infant. Provide swaddling. Yes. Sobrang fun mag-swaddle ng mga babies. Okay, letter dog, mobiles with black and white contrast designs and caress the infant while bathing or during diaper changes because kailangan po nila ng kalinga ninyo. Kailangan po nila ng sensory stimulation from you guys. So 54, that's apple, dog, and eggplant. Okay. Okay, so 54, that's apple, dog, and eggplant. All right, 55, which would be the highest expected growth and development occurrences at 12 months of age for an infant who has had appropriate growth assessed at each well-child visit. Okay, that's letter dog. Walks holding on to someone's hand. Saan po yung wala sa form? All right. So here, walang D, E, and F. Letter dog na lang, none of the above. Okay, so 54, consider na lang po yung letter dog na none of the above. Okay? Para A, D, and E yung sagot. 55, that's dog. Break. Okay, kayo nagsabi ng break. 3 minutes break. Bladder break lang. Okay, 3 minutes lang ah. Andito lang ako. Okay, thank you. Marami po bang lumalabas na Medsospsych? Yes. Okay. I could say yes, maraming lumalabas. Hindi ko sasabing maraming lalabas, okay? Pero maraming lumalabas, okay, na Medsospsych. So please, pakiaral din. Okay, pakiaral din siya. Okay, so 55, that's letter dog. 55, that's dog. Number 56, an infant is being seen in the pediatrics office for a 2-month-old well child visit. Okay. So sabi daw, hayaan lang daw natin na mag-suck siya ng pacifier. Okay, bakit? According to your prejudice cognitive development, the patient is still under your sensory motor development. Okay, so 56, that's cat. Okay, 56, letter cat. Sensory stimulation, yung pinaka-important dyan. Okay, so when we're talking about Piaget's cognitive development, so pinakauna yung sensory motor stage from birth to 2 years old. Okay, then after is the pre-operational stage. So kapag sinabi mong pre-operational, 2 to 7 years old naman yung mga yon. Okay, kapag concrete operational, that's school age people, 7 to 11 years old. Okay, and hindi po lahat ng tao ay nakaka-reach ng formal operational stage. So kapag nakaabot na sila ng formal operational stage, ibang klaseng level of thinking na yun, guys, they can think abstractly. Okay, so 56, that's cat. Okay, 56, that's letter cat. Number 50, which one? Isulat ko na lang. Okay, so we will start with sensory motor. Okay. Sensory motor, birth to 2 years. Birth to 2 years. Next one is the pre-operational. Pre-operational. Sabihin natin toddler to school age. 2 to 7 years old. Okay, the next one is the concrete operational. Operational. Ito naman ay 7 to 11 years old. Okay, the last one is the formal operation. Okay, is the highest stage, 11 years old and beyond. Okay, these can think abstractly. Abstractly. Ganon. Okay, so 56, that's cat. 56, that's letter cat. One more. 56 is cat. 57, 1-year-old child with hypospadias is scheduled for surgery to correct this condition. Which factors should the nurse take into consideration? Kapag hypospadias, alam nating wala sa tip of the penis yung urethra niya. Okay? Nasaan? Above or below? Kapag may hypospadia si patient, saan makikita yung urethra? Above or below? Okay. Ventral or dorsal? Yan yung mga tanong. Okay. Hypo is below. Okay, below yan. Pero hindi kasi yun, yung, uy, ba't nandito si Prof. Garino? Hindi yun yung focus ng question. Gusto nang malaman, 1 taon na po yung bata. Okay? So, fears of separation are great here. So, 57, letter apple. Okay, nako-conscious ako, nandito si Sir Keith. 57, that's apple. Okay, 57, that's letter apple. Okay. Ganun ba siya? Ganun ba si Sir Kit? Yup. Medyo passive ata kasi ako nung na naging lecturer ko siya. Hindi ko napansin yung mannerism niya. Okay. So 57, that's apple. Okay naman si Sir Kit. Dami ko natutunan sa kanya. Okay. Pati si Sir BJ, si Sir Wong. First name basis. Sir Kit, so close kayo. 58, that's letter C. Monosyllabic babbling because yung age po na infant natin is 5 months old infant. Okay, so 58, that's letter C. Saan po yung letter C yung sagot? Sa form, which one? Ah, this one. Letter A po, pakipalitan na lang. Okay? Thank you so much. #57, that's apple. Okay tayo, 58, that's cat. Okay? Itong letter dog, sinulat ko na rin yung mga age ranges. Okay, ma-appreciate mo yan around 9 to 12 months. Kapag linking syllables together, that's 6 to 9 months. Kapag whose when comforted, that's birth to 2 months. Okay, so 58, that's letter cat. 58, that's letter cat. Again, 58, that's letter cat. Okay, below the penis, mo makikita yung urethra ni patient. Okay. 59 or below the end of the penis. Okay? Ayan. So 59, this one, 10 months old infant, the nurse plans, kaya ko pa ba today? The nurse develops a plan of care rather. That's letter dog, providing a consistent routine with touching, rocking, and cuddling throughout hospitalization. So ganun pa rin, yung focus ng concept natin. Kapag infants po kasi, we're all about the sensory stimulation. Okay, 59, that's dog. 59, that's letter dog. Number 60, the nurse notes 6-year-old child does not recognize that objects exist when the objects are outside of the visual field. Ano concept ito? Object permanence. Taking note of the age of the patient, 6 years old na po siya. Super duper delayed. So you have to report that observation to the pediatrician. Okay, so 60, that's apple. 60, that's letter apple. One more, 60 is apple. 61, the nurse is describing Piaget's cognitive development theory. Okay, paano naman daw kapag naka-reach ng formal operation stage? That's apple. Okay, so number 61, that would be letter apple. Okay, pag formal operations, that's ability to think abstractly. Number 62. Okay, the mother of an 8-year-old child tells the clinic nurse that she is concerned about the child because the child seems to be more attentive than to friends than anything else. According to Erickson's psychosocial developmental theory, ano daw yung kailangan natin gawin? Hayaan niyo lang po siya, okay, mother, kasi po siya po ay nagde-develop ng sarili niyang personality. 62, that's cat. Okay, 62, that's letter cat. 61, this one. Okay. Gets 61, apple. Number 62, that's cat. Okay, number 63. 4-year-old child diagnosed with leukemia is hospitalized for chemotherapy. The child is fearful of the hospitalization. Ano yung kailangan gawin? Anong kailangan kong gawin? Hayaan niyo lang po yung parents na tabihan si patient. 63, that's apple. Okay, 63, that's letter apple. Okay, 63, that's letter apple. Number 64. Pwede itong concrete. Pwede siyang concrete operational. Okay, yung letter dog. Right? Question. Sorry. Ano po normal age for object permanence? Okay, it could be around 7 to 8 months of age. Okay, 7 to 8 months. Okay, recommended reference for pedia regarding development theories, si Piliteri and si Wong. Search nyo lang Wong PDF. Ganon. Wong PDF free download. Ganyan yung mga technique natin sa buhay, okay? Para makahanap tayo ng mga resources. 61, that's apple. 7 to 8 po. 7 to 8 months. 62, cat. 63, that's apple. 64, 5-year-old child having placed in a traction. That's letter dog, crayons, in a coloring book. Okay, 64, that's dog. Okay, 64, that's letter dog. Okay po, 64, that's dog. 65, mother of a 5-year-old child tells the nurse na pinapagalitan ni bata kapag tumatama, okay? Yung tone niya, sabihin natin sa mesa o kaya sa upuan. Okay, gusto niya magsabi ng masasamang word sa sobrang sakit. Okay? Bad table, gaganon siya. Bad chair, ganon. So 65, that's letter apple. This is an example of animism. Okay, 65, letter apple. 65, that's letter apple. 65 apple. 66, which car safety device should be used for a child who is 8 years old and 4 feet tall? Okay, so that's booster seat. Okay, 66, based sa edad ni bata, that's booster seat. Okay, the very first thing na pwede nating ipasakay kay baby, ipasakay. Ano ba yung tamang words doon? Pwede nating ilagay si baby ay sa letter C, rear-facing convertible seat. Okay, ito po rear-facing convertible seat. Ito po yung tipong nakaharap po sa likod si baby. Okay, ang edad po ni baby dito is from the birth until 2 to 4 years old. Okay, so that's from birth until 2 to 4 years old. Now, kapag po na-outgrow na ni baby yung rear-facing convertible seat, pwede na po nating ipatry. Okay, yung front-facing convertible seats. Ito naman po ay until at least 5 years old. Pwede na siyang mag-convert to front-facing seat. Okay. Next one is the booster seat. Okay, that would be from 8 to 12 years old. 8 to 12 years old. Pwedeng booster seat yan. Kailan po magpapa-seatbelt? Okay, kailan magpapa-seatbelt? Of course, pwede na siya mag-convert to seatbelt basta hindi siya lulusot. Diba? Kapag nalagay mo ang seatbelt. At the same time, kapag na-outgrow niya na yung booster seat, okay, ano pa po? Kapag okay na yung height niya, okay, for the car to be placed in a seatbelt, pwede na yung seatbelt. Okay, so 66, that's boy. 66, that's letter boy. Ang pinaka-general considerations naman natin dito is yung age, pati yung weight, pati yung height ni patient. Okay, so 66, that's boy, booster seat. At itong seatbelt po pala, pwede itong from 9 years old. Okay, from 9 years old. Okay. Ayan, so 66, that's letter boy. Ang reference ko dito ng mga ages na share ko po sa inyo is yung CDC site. Sa CDC po ako nag-base. Okay, so 66, that's boy. 67, a mother tells the nurse she is concerned because her children must let themselves into the house after school each day while she is at work. Naiiwan mag-isa. Okay? Syempre, iba rin naman yung effect nun sa developmental stage ng bata kapag mag-isa lang siya. So, letter C, find community after school programs or activities. Okay? 67, that's letter cat. 67, that's letter cat. Okay, 67, that's letter cat. Bakit po mas okay na rear-facing seat kapag mas bata? So kapag nakatalikod siya, okay, tapos bumangga yung kotse na sinasakyan ni baby, yung trauma, okay, mas ma-absorb nung likod niya. Okay, ganon. Kaya siya nakatalikod. Okay. It's about the absorption of the trauma that was placed to the child. Okay. 67, that's letter C. 68, a 10-year-old child has been diagnosed with type 1 DM. Okay. So what is the best focus of the nurse's teaching? That's 68, letter boy. The child is taught how to monitor insulin requirements and how to self-administer the insulin. Okay, 10 years old din si bata. Kaya na po magkaroon ng self-care interventions para sa sarili niya. Okay. The family member who will benefit the most from these health education methods is kung sino yung patient itself, which is the child. Okay, so 68, letter boy. Okay, 68, letter boy. 10 years old na yan. Medyo malaki na siya dyan. Okay, 68, that's boy. 69, a 7-year-old child is hospitalized with a fracture of the femur and is placed in traction, limiting the psychosocial needs, that's board games. A school-age child, competitive enough na yan. Kaya niya yan. 69, that's apple. Okay, 69, that's letter apple. 69, that's letter apple. Number 70, the clinic nurse is preparing to explain the concepts of Kohlberg theory, okay, of moral development. So 70, that's letter dog, punishment and rewards. Okay, that's punishment and rewards. Pre-conventional level po pala. Okay, yung gusto kong i-highlight dito. Okay? Pag nasa pre-conventional level pa lang yung isang bata, wala siyang sariling definition ng what is right and what is wrong. Nakadepende siya sa external factor, which is sa parents mostly. Okay, so punishment and reward tayo. 70, that's letter dog. 70 is dog. 71, nursing student is presenting clinical conference about the Freud psychosexual stages, specifically the anal stage. So anong classic characteristic daw ng anal stage? That's letter apple. This stage is associated with toilet training. Ganun lang. Okay. 71, that's apple. Huwag ka na lumayo. Anal stage is about your toilet training. All right. 71, that's apple. 71 apple. Number 72, the parent of a 3-year-old child tells a clinic nurse that the child is rebelling constantly and having temper tantrums. First and foremost, this is expected, okay, sa age niya. Okay, but what could you do? Okay, kasi hindi naman po pwede na i-tolerate lang natin siya. We cannot ignore, okay, we could not also just allow the behavior. So kailangan pa rin natin mag-set ng limits, okay, and to provide a simple explanation kung bakit unacceptable yung behavior niya. 72, that's dog. Okay, punish the child every time he says no. So bugbog sarado na po sa'yo yung anak mo. Okay? Kasi nature niya yan eh. Okay? Do not go against the nature of the person or of your patient. Okay, so 72, that's apple and dog. 72, that's apple and dog. 73, the nurse is evaluating the developmental level of a 2-year-old. Okay, what do you want to observe in this child? Letter boy uses a cup to drink. Okay, uses a cup to drink. So para lang din ma-practice niya yung control ng jaw niya para wala masyadong lalabas na tubig or fluids habang umiinom siya. 74, a 2-year-old child is treated in the ED for a burn to the chest and abdomen dahil daw, okay, hinawakan niya yung hot coffee na nasa lababo or kitchen counter. All right, so when we're talking about the safety at the home, that's letter apple, we will be sure not to leave hot liquids unattended. Okay? Malikot kasi yung mga bata natin na 2 years old, na toddlers, eh hindi mo naman kayang all the time nakasubaybay ka sa kanya. Okay, so 74 apple tayo. Okay, number 74, that's apple. Again, number 74, that's letter apple. Number 75, 16-year-old client is admitted to the hospital for acute appendicitis and appendectomy is performed. Okay, pero hindi yun yung focus ng tanong about the growth and development ulit. So ito naman, ang pinaka gusto niyang lagi makasama ay yung friends niya. So hayaan lang natin, 75, that's dog. Okay, 75, that's letter dog. Again, number 75, letter dog, last 25 items. Kayang-kaya. Kayang-kaya yan. Last 25 items. 76, the mother of a 16-year-old tells the nurse that she is concerned because her child sleeps about 8 hours every night. May mali po ba sa anak kong teenager? Ay, mother, okay lang po yan. Wala pong problema. Okay, so 76, that's letter boy. Okay, need that amount of sleep every night. Paano naman po yung mga magti-take for the board exam? Kailangan po ba ng 8 hours every night? So ang sagot natin is yes, of course. Kailangan niyo pa rin ng 8 hours every night of sleep. Pero ang next question natin ay, deserve niyo ba? Charot! Deserve niyo bang matulog? Okay? Hindi, joke lang. Siyempre deserve niyo. Siyempre naman. Maslow's hierarchy of needs tayo, guys. Okay? So 76, letter boy. Grabe ba? Okay, 76, that's why. Siyempre, deserve nyo namang matulog. Okay? Nang very, very slight lang. Charot. Okay, deserve nyo, period. Yun yun. Okay? Do not neglect your self-care activity. Self always comes first. Tapos anything else. Okay? Ganun yung mantra natin sa buhay. Self, number 1. Number 2, anything else. Ganon. Okay? Wala nang mas importante pa than yourself. Okay? It's not selfish. That's self-care. Okay, 76, that's letter boy. Okay, 76, that's letter boy. Mga alipin po nung salapi, paano po yun? Okay. Paano naman kapag nagkasakit ka, di maubos din yung pera mo. So dapat self pa rin over anything else. 76, that's boy. 77, 15-year-old is injured and sustains a fractured jaw. Okay, so kailangan na daw niya ng full liquid diet as prescribed. What would best promote compliance about this patient? Letter dog, ask a teenager for food preferences and liquefy these foods using a blender. Okay, 77, that's letter dog. Just to make sure lang din na marireach natin yung adequate nutrient values niyan. Okay, 77, that's dog. Okay, 77, that's letter dog. Again, 77, that's dog. 78, the nurse is caring for a 14-year-old girl naman who is placed in traction using crotch-filled tongs. Ayan, self-image rather. Na-issue po ito, especially adolescent child, right? So letter apple, let the child wear her own clothing when friends visit. Okay, body image kasi. 78, that's apple. 78, that's letter apple. One more, number 78, that's apple. 79, a mother arrives at a clinic with her toddler and tells the nurse that she has a difficult time getting the child to go to bed at night. Okay, common problems ng mga nanay na mayroong toddler. What is the most appropriate thing to do? That's letter dog, inform the child of a bedtime a few minutes before it is time for bed. Okay, 79 letter dog. Kausapin ng maayos yung bata. Susunod naman siya sa'yo. Okay, remind mo lang. We have 5 minutes na lang bedtime na. Ganon. Then you enforce that instruction. Okay, 79 letter dog. Okay, 79, that's letter dog. Number 80. The nurse is providing medication instructions to an older client who is taking digoxin daily. Okay, the nurse explained to the client that decreased lean body mass, decreased GFR, which are age-related body changes, could place the patient at risk for which complication. And as we know, kapag elderly yung patient natin, di ba? Tapos magti-take ng medication therapy, very, very at risk for toxicity yan. 80, letter boy. Okay, so 80, that's letter boy. One more, 80, that's boy. Allow the child to set bedtime limits. Bakit si child? Di ba? Yung magsiset, it has to be the mother or the caregiver. Okay? 79 letter dog. Paano kung sabihin niyang 12 a.m., I want to sleep at 12 a.m. Yan. Nag-inorte siya sa'yo. Di ba? So, 79 dapat letter dog tayo. Okay? 80, that's boy. 80 boy. 81, the nurse is caring for an older client in a long-term care facility. Okay, which action contributes to encouraging autonomy in the client? Just because tumanda ang isang tao, okay, wala na silang freedom. Okay, so 81, that's letter dog, allowing the client to choose social activities. Okay, nakaka-bore kaya yan. Okay, so dapat meron silang activities. 81, that's dog. 81, that's letter dog. Okay, 81, that's dog. 82, the nurse is providing instructions to assistive personnel. Okay, regarding care of an older client with hearing loss. Again, classic question natin ito. Alam mo to, promise. Okay, kalkalin mo lang yung knowledge mo about this one. Kaya mo to. 82, that's cat. Okay, they respond to low pitch tones. We know this, right? Yan. Kapag nakalimutan, at least na-refresh. Okay, so 82, that's cat. 82, that's letter cat. One more, 82, that's letter cat. Okay, 83, the nurse is providing an educational session to new employees and the topic is abuse of older client. Okay, sino dito yung pinaka-victim ng abuse? Letter C, woman who has advanced Parkinson's disease. Because if you would notice, okay, among the choices, yung letter C po yung pinaka may mataas, okay, na tendency to be highly dependent. Okay, so wala siyang kalaban-laban dyan, guys. So 83, that's cat. Okay, 83, that's letter cat. All right, 83, that's letter cat. 84, the nurse is performing an assessment of an older client who is having difficulty sleeping at night. So need for further teaching daw po. I-highlight lang ulit natin. Okay, tapos naka-ready na po yung negative sign. Hinihintay niya na tayo. Let's letter C. I drink hot chocolate before bedtime. Di ba? Matutulog na nga kasi, girl. Di ba? Pinainom mo pa na hot chocolate, stimulant yan. Right? Yun. So 84, that's cat. 84, it's letter cat. 84, that's cat. 85, visiting nurse observes that the older male client is confined by his daughter-in-law to his room. When the nurse suggests that he walk to the den and join the family, he says, I'm in everyone's way. My daughter-in-law needs me to stay here. Okay. So, nilimit mo na po yung mundo na isa older male client. Kawawa naman. So, 85, letter dog. Suggest appropriate resources to the client and daughter-in-law, such as respite care and a senior citizens center. Okay, so 85, that's letter dog. 85, that's letter dog. We never say nothing. Okay, yung letter apple, hindi rin po pwede yan. Okay, sinabihan mo lang siya nito, pero wala kang ibang ginawa. Okay, hindi dyan magtatapos. Okay, so 85, that's dog. 85 is letter dog. 86, the nurse is caring for a terminally ill adolescent client. When caring for this client, the nurse should implement which intervention? Yun na yun, guys. Dahil nga po siya ay terminally ill na, wala na tayo ibang kayang maibigay, kundi ang comfort, dignity, ano pa ba, respect for this patient. So 86 letter dog, encourage the client to maintain maximum self-control. Okay, ipa-feel mo pa rin sa kanya yung control. Okay, comply with the client's wishes at all times. Kailangan or gusto ko po makakita ng pony sa ward namin or sa ward natin. Okay, magka-comply ka ba? Gusto niya daw ng pony, guys. Maghahanap ka ng pony para sa kanya. Okay, hindi naman. Okay, wag ganon. Tsaka may word kasi na all. Eh, absolute term to. Diba? So, iwasan natin yan. So, 86 dog tayo. Kailangan ko pong maka-experience kung paano humit-hit. Okay, mamamatay na rin naman po ako. Ganon. Wag ganon. Okay, so 86, that's dog. 86, that's letter dog. Okay, 87. Sorry, number 87. Etivacting. The long-term care nurse is performing assessments on several of the residents, which are normal age-related physiologic changes, and the nurse should expect to note, select all that apply. 87, of course, decline in visual acuity, that's letter boy. Increase susceptibility to UTI, again. Okay, letter F, increase incidence of awakening after sleep onset. 87, that's boy, eggplant, and F. Okay, 87 is B, E, and letter F. Okay, 87, that's B, E, and letter F. Gusto ko yung mga taga Cavite, as in sila na mismo yung nagva-validate na marami pong nanghihit-hit sa Cavite. Ibang klase yun Di ba usually gusto mo lang na maganda sa paningin yung city mo, gusto mo na maka-encourage tayo ng turista, gano'n na, uy, punta kayo dito. Pero yung iba yung mga taga-Etivac, as in, ibang klase. Sila na mismo yung magre-remind sa'yo, ganyan. Okay, so 87, kumaway naman daw mga taga-Bacoor. Ay, iba. Nagne-name drop, nagpe-place drop na rin dito. Okay, 87, that's letter boy, E, and letter F. Okay, Kadiwa Park. Dasma po talaga. Okay. Di ba sa Tanza? Di ba mas marami sa Tanza? Okay, so 87, that's boy, E, and letter F. All right, so letter 8, number 88. Okay. 13, Lunggam. Nilahat na yung Etivac. 88, older client is admitted to the hospital with a diagnosis of malnutrition. Other than cognitive status, what other factors now would increase the risk for malnutrition and dehydration? Okay, that's letter boy. Okay, physical fatigue. Okay, letter C, limited mobility. Letter dog, sensory decreases. And letter E, inadequate dental care. So 88, boy, cat, dog, and letter E. Okay, so 88, boy, C, T, and E. Okay, malapit lang yung Las Piñas sa Cavite. Konding kembot mo lang, Bacoor na. So alam ko yung mga yan. Okay, so 88, boy, cat, dog, and letter E. All right. Number 89, the nurse educator is preparing to conduct a teaching session for the nursing staff regarding the theories of growth. Yan, mga kaway-kaway po, mga taga Las Piñas. Hello everyone. Ang dami po natin. Ayan. Si Cynthia Villar naman yung evil dito. Okay, Kohlberg's theory naman tayo. So, ganun pa rin. Okay, select all that apply. That's letter boy, moral development progresses. Letter C, person's ability to make moral judgment. Yung letter dog, the theory provides a framework for understanding how individuals determine a moral code. And letter F, okay, that's in stage 2, the child conforms to the rules to obtain rewards or have favors returned. Okay, so 89, that's boy, cat, dog, and letter F. Okay. Gusto niya sarilihin yung mga kalsada since siya naman daw po yung nagpagawa. Okay, gusto ko sana sabihin, sana nayayakap mo yan, no? Tuwing gabi, yung mga kalsada ng pinadaan mo. Di ba? Tsaka naman, Diyos ko, public official, ang damot. Di ba? Nakakaloka. Yung mga bumoto sa'yo, sila yung mga pinagdadamutan mo niyan. Kakaloka ka, girl. 89, that's boy, cat, dog, and letter F. Na Grant, inigigil niyo siya. Inigigil niyo ako, guys. Charot. 89, that's boy, cat, dog, and letter F. Okay. Number 90. Okay. Yon yung mag-a-avail ng sticker. Bawat gates na lang may sticker. Paano kung doon ako nakatira? Hindi ba pwedeng tatawid lang kami? Kailangan pa ng sticker. Based on experience pala yung rants. Joke lang. Number 90. Okay, preparing to care for a dying client. All right, that's letter C. Encourage expression of feelings, concerns, and fears. Letter E. Touch and hold the client's hand if appropriate. Okay, may word na if appropriate. And letter F. Be honest. Okay, and let the family know they will not be abandoned by the nurse. Okay, so 90, that's cat, E, and letter F. Okay, 90, that's C, E, and letter F. Okay. 90 CE and letter F. Okay. Last 10 items, guys. Sorry for keeping you waiting. Okay. Malapit na po tayong matapos. Okay. 91. The nurse recognizes which interventions are likely to facilitate effective communication between a dying client and family. Select all that apply. Okay. That's letter apple. The nurse encourages the client, okay, to discuss openly. And letter B. The nurse assists the client and family in carrying out spiritually meaningful practices. And letter E. Okay, the nurse maintains a calm attitude and one of the acceptance when the family expresses anger. So 91, that's apple, boy, and letter E. Okay, 91, that's apple, boy, and letter E. Napapagsama-sama ko na yung words. Ayan. 91, A, B, and letter E. Anak niya kanina yung nag-rasha sa amin. Sino doon? 91 A, B, and letter E. Naging apoy na. Oo, naging apoy na. Nagre-review ka po ba dati? As hindi ka napapasilip sa phone? O hindi. Hindi ako ganyang klaseng student. Okay? Laging nakabukas yung phone ko. Okay? So 92 naman tayo. After autopsy is prescribed, the client's family requests that no autopsy be performed. All right, so what is the most appropriate response? Paki-contact ko lang po, sorry, si doctor regarding your request. Okay, so 92 letter C. Siyempre, ang ending naman yan, i-honor natin yung wishes nila. Okay, so 92, that's cat. 92, that's letter cat. Okay, number 93. The community health nurse is providing educational session to a group of community members regarding the issue of organ donation. A member of the group asked the nurse, how old does someone have to be to provide consent for organ donation? Ayun na si Cynthia Villar, nag-enter na ng room. Oh my God. Hello po, good evening. Number 93, that's boy, 18 years old of age. Okay, dapat legal pa rin tayo. Okay, dapat legal tayo dyan. I am firm about what I said, Ma'am Cynthia. Sana po nayayakap mo tuwing gabi yung mga kalsada na pinapadaan niyo. Okay, sana na i-date mo yan. Okay, sana na out of town trip mo yung mga yan. Okay, so 93, that's boy. 94, the nurse is caring for a client with terminal cancer who is close to death. Okay, on reviewing the plan of care, what is the most priority? That's letter C, ganun pa rin, client's dignity and self-esteem, and make the client as comfortable as possible. 94, that's letter C. Sa panahon ngayon, may Villar apologies pa rin ba dito? 94, that's cat. Okay, number 94, that's letter cat. 94, that's letter cat. I am very, very much willing to compile lahat ng mga offensive words na sinabi ni Cynthia Villar. Okay, 94, that's letter C, na hindi na daw kailangan na masyadong maraming effort para sa mga nurses kasi magiging room nurse lang naman daw siya in the future. Mga ganong banat, di ba? Grabe yon. So 94, letter C tayo. 95, a client brought to the ED is dead on arrival. The family of a client tells the doctor that the client had terminal cancer and the doctor examines the client regarding the autopsy, which response of the family is appropriate. That's letter C. I will contact the medical examiner regarding your request. Okay? Parang naulit na to. Pag ayaw po nila magpa-perform ng autopsy, pwede naman po. Okay? Kailangan lang natin i-notify si doctor. Okay, so 95, that's cat. Ayun. Ano lang sila, yung parang mag-aalaga, di ba? The choice of words, Diyos ko. 96, the nurse is caring for a client with cancer. The client tells the nurse that the lawyer will be arriving today to prepare a living will and ask the nurse to act as one of the witnesses for the will. And as we know, hindi tayo po pwedeng maging witness because, may conflict of interest po. Okay, so 96 letter dog, ask the client who might be available to serve as a witness. Okay, so number 96, that's letter dog. 96, that's letter dog. Okay, 96, that's letter dog. Ako na po magsasabi, the views, opinions expressed by the lecturer is not the views and opinions of top rank. Okay, akin lang to guys. 96, that's dog. 97, the nurse is monitoring ongoing care for a potential organ donor who has been diagnosed with brain death. Okay, which finding indicates to the nurse that the standard for ongoing care has been maintained. So ito naman po yung konsepto ng organ donation. Okay, gusto natin na habang hinihintay natin na ma-transfer yung organs is to remain the viability of those organs. Okay, so with that, malalaman natin na viable pa po yung kidney ni patient kapag may urine output pa siya. That's letter boy. Okay, so number 97, that's letter boy. Number 97, that's letter boy. Again, number 97, that's letter boy. Number 98. A client who suffered a head injury has had vigorous treatment to control cerebral edema. Brain death has been determined. Okay, how do we maintain the viability of the kidneys before organ donation? Letter C po, administering your IV fluids. Okay. So for us to maintain the perfusion of the kidneys, of course, yung blood pressure, kailangan din nating i-monitor yan. So depende po yan sa fluid volume at the same time sa tone ng blood vessels ni patient. Okay? So ito pong number 98, letter C yung sagot natin para lang ma-make sure natin na rehydrated si patient lagi. Okay, so 98, that's letter C. Okay, 98 is letter C. Kapag well-hydrated si patient, okay yung perfusion yan. 99, which intervention should the nurse take? Okay, for a decreased client whose eyes will be donated. Select all that apply. Okay, so that's letter apple, close the client's eyes. And letter boy, elevate the head of the bed. And letter E, place the wet saline gauze pads and a cool pack on the eyes. 99, that's A, B, and E. Okay, wala po yung letter A. Can I see the choices? May none of the above po ba? Kasi kung wala, paki-bonus natin. Ibo-bonus natin yan if ever. May none of the above. May A, B, E daw. Meron naman daw pong A, B, and E. Okay, so 99, that's A, B, and letter E. Last number 100. Many client begins to make sexual advances, okay, in the day room. So, sa ibang students na wala pong letter apple, kung merong none of the above, yun yung isasagot natin. Tapos paki-screenshot na lang po so that ma-review nyo siya on your own. Okay? Number 100, verbally abusive na si Manny client. Anong gagawin? Doon na natin siya i-escort with the assistance of the other staff kasi distractive na siya to the rest of the people around him. Okay, so 100, that's letter cat. Okay, 100, that's letter cat. Questions? Alright, so let me stop sharing now. Wala, sa 89 po, sorry last na. Okay. Wala pong option. Okay. Na B, C, D, and letter F. So paki-screenshot na lang po ulit nito. Okay. Tapos, ibubonus ko na lang ba? Kapag wala namang none of the above, ibonus na lang natin yan. Okay? Thank you so much, guys. Alright, so meron kasing nagtanong kanina, gusto ko lang i-address. Okay, sabi niya po kasi is, nag-worry siya, baka hindi siya makasagot or makasabay for the May board exam. Sabi ko, nag-type ako sa kanya, sabi ko babalikan po kita, pero kasi nung nagre-reply na ako, hindi na siya available sa chat. So, sabihin ko na lang live, okay? If ever nandito ka pa po, ma'am, okay? Yung readiness mo to take the board exam, ikaw lang naman yung makakaalam yan. Okay? Yung overall readiness mo. Hindi rin kasi maganda na pilit lang, okay? Yung for the sake na maka-take ka ng board exam. So kung hindi kaya, wag nating pilitin. Okay? Kung hindi kaya, okay, wag nating pilitin. Okay? So ang magde-decide pa rin naman, ang may final say, ikaw pa rin yan. Just make sure to take care of yourself. Yun yung pinaka-importante. Okay? Nagpupuyat po ba kayo noon nung ako yung nagre-review? Yes, nagpupuyat po ako nung ako yung nagre-review kasi nga po ayoko nang manood ng recorded video. Gusto ko live yung pinapanood ko para sa gabi, pag oras ko na yon. Okay? Ang time ko talaga for myself would be 10 to madaling araw hanggang kung kailan ako makaabot. Okay? So nagpupuyat po ako nun. Okay? So, yun lang guys. Tiwala sa sarili. Konting-konti na lang. Kapit-kapit po tayo. And pahinga pag may time. Okay? Thank you so much for spending your Monday night with me. Okay? So, ulitin po. Sana magkita-kita pa tayo to top the board exams. Okay? To top the board exam. Thank you so much. Meron po bang way back 10 years plus na graduate? Pero po ang dami yan. Marami yan. Okay, marami yan. Promise. So kapag 10 years plus na po kayong graduate, tas ngayon lang magtitake ng boards, mataas yung chance na papasa ka pa rin po for the board exam. Okay? Mga retakers, I fully support you. Okay, nag-retake kayo kasi gusto niya talaga to. Okay? Yes, sa 3 pre-boards. Hindi ako nag-top. Okay. Gantong-ganto yung reaction ko. Kasi yung mga batchmates ko na taga-UP, lahat sila, nakakalat yung pangalan nila, top to 1 to 50, tas pangalan ko wala. Okay. Kalungkot, pero syempre, perseverance is the key rin. Okay? Thank you guys. Thank you so much. Ingat po tayong lahat. Ingat. Thank you.
Thank you, ma'am.
Top 10 na lang pala yung ni-release daw ng top rank. Hindi ko alam kung anong shade to, sorry. Napulot ko lang to somewhere. Tapos ginamit ko lang din. Ang dugyot. Napulot somewhere, tapos ginamit ulit. Anyway, guys, pahinga na po kayo. Pre-boards na tomorrow. Thank you so much. Ingat everyone. Ingat po. Thank you.